morning to you, ladies and the jury. Let the record reflect all of the jurors are here present. I apologize for the delay. I know you were all here an hour plus ago, but just blame me for any kind of delay. We've dealt with a legal issue that I should have dealt with late last night after y'all left, but I didn't. So just blame me for any issues you have with the delay. All right, Dr. Gill steps up. Raise your right hand and be sworn.
Do you swear to tell the truth, so help you God? Judge, at some point I have 3 photographs that were sent out. I don't think those.
They're right there.
Good morning, Dr. Carney.
Good morning.
Could you please state your full name for the record?
Yes, it's Erin, E-R-I-N, last name Carney, C-A-R-N-E-Y.
And Dr. Carney, where are you employed and what is your position?
I work at the Center for Forensic Medicine. We service the Davidson County Medical Examiner's Office and the Regional Forensic Center for Middle Tennessee, and I'm a forensic pathologist.
And what is your current position?
I am the interim chief medical examiner for Davidson County.
And how long have you worked at the medical examiner's office?
Been there, it'll be 13 years next week.
And prior to that, what did you do?
So prior to that, I did my education and training to become a forensic pathologist. I earned my Bachelor of Science degree in biology with a concentration in biochemistry and cellular and molecular biology at the University of Tennessee, Knoxville. I attended Vanderbilt University School of Medicine, where I earned my Doctor of Medicine degree. I completed residency in anatomic and clinical pathology at the Johns Hopkins Hospital and a forensic pathology fellowship at the State of Maryland Office of the Chief Medical Examiner.
Is that shaking my
And do
It
you
is.
hold any certifications or medical licenses?
So I have medical licenses in the states of Tennessee, Texas, and Kansas, and I am board certified in anatomic, clinical, and forensic pathology.
And can you describe to
Apparently, I was on mute when I came on. So just so you guys know, we're going to jump right back into this. Day 4, Blaise Taylor trial based out of Nashville, Tennessee, accused of unaliving his pregnant girlfriend. This is one of the medical people who's on the stand. We've been in voir dire all morning. So it's good to see you guys. Please make sure to double tap your screens if you're on your phone or hit the thumbs up button on your computer. Thanks.
do you do any teaching in the field?
Yes, so we teach residents in pathology who rotate through our office, and I am an assistant professor at Vanderbilt.
And approximately, can you estimate how many autopsies
Puppy.
you performed in your 13 years at the medical
Richie.
examiner's office?
I've performed over 3,000 autopsies.
And that's you yourself.
Yes.
I knew that was
Your
wrong.
Honor, has the witness a document?
Okay.
Okay, guys. Let's hit that like button. Double tap your screens, please. Push this video out.
Dr. Carney, do you recognize that document?
Yes, ma'am.
And is that a copy of your CD?
Yes, ma'am.
Your Honor, at this time, I'm asking that be made the next numbered exhibit, which I believe is number 30.
Okay.
Dr.
Happy
Carney, can
Friday.
you describe what is an autopsy? What is that process?
So an autopsy is an examination of the body that consists of 2 parts. There's an external examination and an internal examination. For the external examination, I'm looking at the outside of the body. We will record the length of the body on the table to estimate their height in life, look at the hair color, the eye color, and I'll look for evidence of disease or injury that would help me understand why this person died. Then we'll do an internal examination that starts with a Y incision on the chest and abdomen, where we reflect the skin and soft tissue so I can see the ribs, look for any rib fractures. We'll cut through those ribs and take off that sternum and ribs, the chest plate, if you will, so I can see the internal organs and look for any bleeding or fluids around those organs, maybe that shouldn't be there. And then I'll look carefully at each of the organs for evidence of disease or injury. And then finally, we'll do an incision behind the ears, across the top of the head, and reflect the scalp forward. And that way I can look for any bruising that might be hard to see if we have a lot of hair. And then we'll actually cut through the skull, and that way I can look at the brain and look for any evidence of stroke or bleeding in the brain.
And when you're completing an autopsy, what is kind of the ultimate determination that you are making as a medical examiner?
So the goal of the autopsy is to determine the cause of death.
And obviously there's many causes of death. Is there another determination that you assess?
Yes, so I want to determine the cause of death from autopsy. And then from the autopsy findings, in combination with the investigation into the circumstances surrounding the death, I will come to a conclusion for the manner of death. That's a classification of death, and it typically fits into one of 5 categories. There's 6 on the death certificate because there's a pending option if we're still waiting on information.
And that determination of manner of death, is that for purposes of the death certificate?
Yes, ma'am.
Is it a legal determination that has anything to do with this criminal process?
No, ma'am.
And what are the 5, or you said actually 6, possible outcomes as to the manner of death?
So it's homicide, suicide, accident, natural, could not be determined, and then the 6th one, like I mentioned, is the pending investigation. So if I don't have all the information yet to make the determination in one of those 5, then they'll get a pending death certificate until I have everything.
And that is a separate standard that you use just for the death certificate, is that correct?
Yes, ma'am.
So if you labeled something a homicide, it would not mean that a criminal homicide occurred, is that right?
Correct.
And many times it could not be determined from your perspective for purposes of the death certificate.
Yes.
But you still come to court and testify in criminal cases, even in that situation, is that correct?
That's correct.
And did you perform the autopsy of Jade Benning on March 7th of 2023?
Yes, I did.
And at this time, I would proffer Dr. Carney as an expert in forensic pathology.
Okay. Are you again, ladies and gentlemen, Dr. Carney to be allowed to testify as an expert in that field and give her opinion that a lay witness wouldn't be allowed to give? You could place such weight upon her testimony as you choose to. Okay.
And at this time, I would ask that the witness be in a
Welcome.
document.
Hey, everyone.
Dr. Carney, did you complete a report of the autopsy that you completed on Jade Benning?
Girl says hello.
Yes, ma'am.
That report, you can take a look at it and let me know if that you guys.
Yes, this is my autopsy report with the attached toxicology report.
Dr. Carney, how did you first get notified of Jade Benning? Was it when she was received by your office at the medical examiner?
The question was, when did you get notified about the death of Jade Benning?
Well, my office was called
That's
actually a
good.
few days after she went into the hospital because she had experienced
That's
this
totally
anoxic
right.
brain injury, and it was believed that her death was imminent.
Is that a typical thing that happens?
Yes.
And once you were contacted, did you engage in discussions with people at Vanderbilt?
Yes.
And specifically, who were you speaking to at Vanderbilt?
I had a lot of dialogue with the toxicologist at Vanderbilt because initially Ms. Benning's reason for her brain to be deprived of oxygen, the reason that her heart, stopped, was unknown. And so there was a lot of testing and trying to determine why this happened. And so we were in discussion trying to determine, what might be her cause of death and what I might need to test for or look for when she came to my office.
And did you actually make requests related to Jade Benning before her body ever arrived at your office?
Yes. So when we are notified that a death is imminent and they're in the hospital for an extended period, and I think the toxicology could be very important in the case, then we want to make sure that that initial blood sample that was taken when they first came to the hospital is saved and not discarded. So we contacted the laboratory at Vanderbilt Hospital to make sure that they saved that blood for me to be able to test after her death was pronounced.
And Your Honor, I'm gonna ask the witness be handed Exhibit 12, which I have, as well as three
She's a pretty
other
woman.
photographs.
Pretty woman walking down the street. That was way out of time. Welcome everybody for day
Dr.
4
Carney, do you recognize
Blaise
the image
Taylor
in
trial.
Exhibit 12?
Yes, ma'am.
And can you describe what is that in that image?
So this is the hospital blood, the sample that I mentioned that was taken when she first arrived at the hospital that we asked them to save in the laboratory for us to pick up after she passed away. And this is that blood sample.
Your Honor, may I display this exhibit to the jury? I have it digitally.
Okay, and that exhibit that's been talked about before, the photo, who made that?
Who made this photo? The photographer at my office took this picture. This was when the blood sample was transported to the medical examiner's office.
And Dr. Carney, does this have the
Thanks,
specific
Ashley.
date and time the blood sample was collected from Ms. Jade Benning?
Yes, ma'am. So you can see on the label, it says 2/25/23 at 22:31, so 10:31 that evening.
And is there a Vanderbilt University medical record number also on that same label?
Yes.
And I guess, can you describe, does it have Ms. Benning's date of birth?
Yes. So her date of birth is listed there at the top of the sample. It's upside down in this picture, but yes.
And the labeling underneath it, can you describe what that is?
So whenever an individual comes to my office, they are given their own unique medical examiner case number. So the MEC number 23-0842 is Ms. Benning's specific case number. And then the date underneath it is the date that she died.
Your Honor, at this time, I would ask that Exhibit 12, which was previously marked only for identification, be entered as Exhibit 12.
Okay,
Yeah, may I object in that, folks? Okay.
Okay. Okay. See, guys, just watch. He is so chill before lunch. And then lunch happens and he is just so mean. He is so mean. And this morning was crazy. If this man is convicted, he's absolutely getting an appeal. Basically what you guys are going to find out here shortly is that the blood that was taken to test for in her system was MIA for 10 days. Like there was no chain of custody. In no way whatsoever is that okay. It's really unfortunate.
you also have 3 additional photos. Do you recognize those?
Yes, ma'am.
And can you explain, when did you receive the blood sample on the one from 2/25/23 and 22/31? When did you receive that?
So that blood was actually transported to the medical examiner's office along with Miss Benning's body on March 7th in the early hours of the morning.
And you said that it was photographed at your office, is that correct?
That's correct.
And then what, if anything, did you do with that vial of blood?
So I wanted to see what kind of tube it was in and how much blood was there so that I could determine what kind of testing I could order on it. And then I sent it to NMS Labs for the needed toxicology testing.
And can you explain what you mean by you wanted to see what type of tube it was in?
Well, typically when we draw blood at the time of autopsy, we put blood into a tube that has a gray top. It contains sodium fluoride, which is important to inactivate those esterases in the blood. It's these enzymes that can break down cocaine. And so they continue working even after death. And so I wanted to see what kind of tube it was. This is actually a clear top tube, so those esterases are still able to break down the cocaine. But just so I'm aware, and that way I order the correct testing so that I can not only see if there's cocaine there, but if there's those breakdown products that have probably been formed over the time that it's been in this tube in the hospital.
And Dr. Carney, can you explain why was it that you were wanting to have it tested for cocaine?
It was, I learned in the process of while Miss Benning was still in the hospital that she had a urine drug screen that was positive for cocaine.
And so once you received that vial, did your
For those of you who were not here 2 days ago, there was testimony given that the decedent was the hookup, if you can pick up what I'm throwing down.
office submit a request to NMS?
Yes, ma'am.
And can you explain what is NMS Labs?
So NMS is a toxicology laboratory that is located in Pennsylvania, and they have a lot of capacity for testing. And so we send our specimens to them.
And did you send that specimen to them for testing?
Yes, ma'am.
And did they report the testing results to you?
Yes.
And then what, if anything, happened with the blood from Jade Benning from 2/25/23 to 22/31?
So when they were done with testing, they sent me a laboratory report with the results. I actually ended up talking to a toxicologist at NMS, and I let them know, typically they hold the blood for 1 year and then they discard it. So I let them know I did not want them to discard this. And then before that year was up and time to discard, I asked them to transport it back to my laboratory so that we can preserve it.
And do you recognize what is in those 3 photographs?
Yes.
And what is that?
So this is that same tube of blood that I asked them to send back to our office, and now it has their case label on it.
No, at this time, I would ask that those 3 photographs be entered as the next word exhibit, which I believe is 34.
You know what I want. I want it now.
Sure.
I can't even imagine. I mean, I believe you. That's really unfortunate. What are we doing? What are we doing? What are we doing? Oh,
Okay.
did you hear him sigh? It's almost lunchtime. I can feel the vitriol coming off of him. From Columbus, Ohio. Where are you guys watching from? What's the weather like? Tell me everything.
Okay.
All right, show those 31.
And Your Honor, may I have permission to publish the photographs for Exhibit 31 to the jury?
Okay, you need these? Okay.
Dr. Carney, can you see the image that is on the screen?
Yes, ma'am.
And can you describe what's in the image and how you were able to identify it?
So if you see on the tube, it has the case ID, which is her unique medical examiner case number and her name. And then the label at the bottom is one that we printed at my office to take the picture.
And the next image, which is 31B, can you describe what is shown here?
So here we have a barcode and we have a series of numbers. That 231-26889 number, that is the unique work order number that is attached to her laboratory report, her results.
And if you need to reference your autopsy report, do you recognize that work order number from NMS?
Yes, and even the 001 identifies it as the hospital blood for this particular case.
And can you, just for the record, read out what the work order number is and verify that it's the same in your autopsy report?
Yes, ma'am. 231-26889, which is the work order on the report as well.
And the next image, which is Exhibit 31C, can you describe what's shown here?
So this again confirms this is her hospital blood. It shows the date that we entered the order into the computer. And then the date, it looks like the date they received it. So we didn't ship it out the day that we ordered it. We usually send it out twice a week. So it got sent out likely on the 3rd for overnight shipping for them to have it first thing in the morning. And it's sent with cold packs to keep it in the best quality.
And where is
He did say that yesterday.
It is at my office.
And it is still at your office, is that correct?
That's correct.
The troll ain't trolling on that issue.
Dr. Carney, when the blood was sent out, did you receive a report from NMS Labs?
I did.
And specifically, can you describe what was the testing that you requested and what was the testing that was done as it relates to that 2/25/23/22/31 hospital blood?
So I ordered
Me too,
a
Steve.
cocaine and products panel so I could catch not only the cocaine, but any breakdown products that may have formed while it was sitting in that tube. And then I also asked them to test for designer opioids.
Like Chanel?
At this time, I'm going
Gucci?
to ask that Dr. Carney's autopsy report be made the next numbered exhibit. I just believe that I can.
No objection. Okay.
You have a copy.
Yes, ma'am.
No objections outside of that, standing objections.
Dr. Carney, your autopsy report, which is now Exhibit 32, did you incorporate the NMS lab work order number 231268889 as part of your report?
Yes, I did.
And did you rely on these findings in making your determination as to the cause of death?
Yes, ma'am.
That's the perfect.
And Your Honor, may I publish
Day
a
for
page
me.
of Dr. Carney's autopsy report to the jury that is part of
But I'm sorry.
Exhibit 32?
Okay.
Dr. Carney, can you describe what is shown here on the screen?
This is the front page of the toxicology report, and this shows the positive findings, the testing that I requested, and the specimens that they received. And it also has her identifying information up in the right-hand corner.
And this next image is kind of a zoomed-in image. Can you describe what was the testing that you requested as it related to just the item 001 hospital blood?
So if you see under testing requested, I asked for the 1303B test, which is cocaine and products panel on the blood, and then the 1480B designer opioids on the blood.
And going
I'll make
to
myself smaller.
just that first blood sample, From the 225-23 at 2231, can you describe the toxicology results and kind of what those results mean? What is the result related to cocaine with the result of 78?
So this is the actual parent drug, cocaine, that was present at 78 nanograms per milliliter in the blood.
And can you describe what that means of parent cocaine? When someone ingests cocaine, are there things that happen within your body, and are there other substances that are created?
Yes, so the body, you'll absorb the cocaine and have this parent drug, cocaine, in the blood. And then, like I mentioned, the enzymes will break it down, and so you have breakdown products. So these other two that are listed, the benzyl ecgonine and the ecgonine methyl ester, are the breakdown products.
And can you describe the difference between the two?
So you typically don't see a large amount of ecgonine methyl ester circulating in a live person's blood, but it very well can form post-mortem in a tube of blood or even in the body as the blood sits there and they're awaiting to have their blood drawn, for example, at an autopsy. So when we look at these breakdown products in the autopsy setting, this ecgonine methyl ester was likely parent cocaine at the time of the person's blood draw.
Your Honor,
But it's,
I would object to this witness testifying to things that relate to toxicology as opposed to a pathologist, as she's not been qualified as an expert on toxicology.
Okay, do you want to ask whether she can, from her experience, make that connection?
Yes, Your Honor, I'm happy to. Dr. Carney, do you have training and experience in toxicology?
yes,
So is this something that you do on a regular basis?
yes, ma'am,
Are you extremely familiar with the topic that you were speaking about?
yes.
All right, I'll overrule the objection. Go
Can I
ahead.
take the witness on word on it?
I'll overrule the objection. Go ahead.
If you could continue, you were explaining that the ecgonine methyl ester,
Thank you,
that
Scott.
it was most likely the parent cocaine. Can you describe what you mean by that?
So like I mentioned, this cocaine is about the only drug that does this.
Can't hear
where
me.
The enzymes in the blood can continue to break it down after death.
Oh, okay.
Most everything else relies on being circulated through the liver, and really nothing changes after death as far as if you get them to autopsy soon after death. In this case, the ecgonine methyl ester has formed because the esterase is in that clear top tube that didn't have the preservative to stop the breakdown, has broken down the cocaine into ecgonine methyl ester. So if you add the cocaine number and the ecgonine methyl ester number together, that will give us an idea of how much cocaine was in her blood at that point in time on February 25th, 2023 at 22:31.
And so is it your testimony that that amount would be 7,878 nanograms per milliliter?
Yes, ma'am.
That would be the
What?
concentration of cocaine in Jade Benning's blood on February 25th, 2023 at 22:31 p.m.
Yes, ma'am.
Dr. Carney, you've already testified that you had performed autopsies where someone has overdosed. Can you describe, is that amount of cocaine in a person's blood, is that common?
No.
And so when you first got this case, you said you were talking to Dr. Blaire, is that correct?
Correct.
Did people from my office, including myself, meet with you kind of early in the process, specifically about these toxicology results?
Yes.
And at that time when we met, had you ever seen an amount that high in an autopsy?
No.
And did you, I guess go back and look at other autopsies that were done in your office?
I look primarily at my cases because I'm familiar with those, I've interpreted those, and that was almost 300 cases that I signed out, the cause of death or contributory cause of death, including the drug cocaine.
And in that first time that we met, had you ever seen anything close to that level?
I could not recall anything this high.
What would a typical level be in a overdose where it's just cocaine, no other substances, that you were familiar with from your 300 cases?
So I went back over the acute cocaine intoxications, and they're pretty much all under 1,000 nanograms per milliliter. 2 or 3 were in the 1,000 to 2,000 range.
And since that first meeting that we have, did you do another review looking for anything that compared to this particular result?
I did go back through looking at all of my acute cocaine intoxications, really trying to look at those carefully. I even looked at dozens of the ones that had cocaine plus other drugs involved.
And did you find anything that was similar to that amount of 78 nanograms per milliliter?
I found one.
And can you describe what was the result in the one case that you
Dow.
found?
The cocaine level was 10,000 nanograms per milliliter in the blood.
Can I put
And
that down?
Going back to the ones that you had done that you initially reviewed where 1,000 was the highest, can you describe what were the findings in your autopsies of the method of ingestion?
So a lot of these, we do have scene investigations. They look for drug paraphernalia, and there's a.
I
in
love
many of
you.
those, you would find evidence that the person smoked it, or perhaps we would call it nasal insufflation or snorting it, and
What the-
or intravenous injection if they were able to put it in a syringe and inject it into the veins.
This is like
Had
intense.
you ever, I guess, done an autopsy before where oral ingestion was the method?
It's very uncommon, and I did not recall cocaine ingestion being a common method of administration.
And that one case that you found that the medical examiner's office and autopsy was performed, what was the method, or can you just describe the circumstances of that particular case?
That one was believed to be ingestion. It was someone who had been taken into custody, was believed to have swallowed something while in intake at the detention center, and then died during the booking process.
And when you say died during the booking process, what was the amount of time? And you said they ingested it. How did they ingest it?
Swallowed.
So it was an oral ingestion. Do you know an approximate time frame?
I don't, but it did not sound like it was a very long period of time.
So something that happened fairly quickly, comparatively speaking.
Yes, ma'am.
And in that autopsy, are you familiar with autopsies where there's been other oral ingestions of cocaine?
I did have another one with oral ingestion of cocaine, but it was mixed with another drug. And we knew that it was oral ingestion because I found the bag with the crystalline substance that had broken open that was still in the stomach.
And typically, what is the result going to be for cocaine?
They're going to have to be able, if you think about it, they are absolutely going to have to prove that Blaise Taylor had that baggie. They are going to have to prove that he purchased it. I don't know if it's phone or banking records or surveillance or fingerprints, but they're going to, like, if they do that, then it's over. But I just, this is wild to me. This is absolutely crazy. Also, if you guys tell me that she's snoring too loud, that would be great. I don't want people to leave. Yeah, thanks.
In a case like that where someone swallowed a balloon, have you looked at any data related to that?
Yes, so in the literature, it shows that those are the cases where they swallow cocaine in an attempt to transport it somewhere internally, not to use it for its effects, or they swallow it to avoid perhaps being caught with it. In those cases, the cocaine level is high.
Is it as high as the 78 or the 10,000 in the other case?
Yes.
And specifically that case with the 10,000, in that autopsy, was there a bag found?
No.
And can you describe what would the bag potentially have to do with what the cocaine level would ultimately be?
Well, if you have a bag or some sort of protective covering, then that's going to delay the time, because then the acid in your stomach has to kind of break through that bag in order to get to the drug. So it should delay it.
And can you describe what information did you have about the method of ingestion related to Jade Benning and the subsequent cocaine testing?
I found from the police investigation, there was concern that she may have ingested it by drinking it.
And are you familiar with the additional testing from NMS labs, specifically of the substance on the comforter?
Yes.
Objection, Your Honor.
What's your objection?
The line of questioning that she's going into in regards to any findings on that comfort at this stage.
Okay, do you care to be heard?
Yes, Your Honor, I'm asking her for,
She factored in something from further test of the comforter.
correct, Your Honor.
Okay. All right, let the lawyer look at
Okay. So for those of you just joining us, welcome. Please make sure, my goodness, please make sure to double tap your screen if you are on your phone. That gives me a like. Make sure you are subscribed. And if you are on your desktop or laptop computer, hit the thumbs up button, because we are watching day 4 of the Blaise Taylor trial happening in Nashville, Tennessee. He is accused of unaliving his pregnant girlfriend. He is a former NFL scout for the Tennessee Titans, and apparently the cops blew it with the chain of custody. Unfortunately, it's something that can't happen. Like, you can't let this happen. And for that reason, I feel a little bit jaded right now. Yeah. So Rose asked, have they proven that she was dealing? Yeah. With the phone records yesterday.
Methods testing of the ink substance on the comforter. Can you describe, when you're making your determination for cause of death, are you considering other testing that's done, things from the scene? What do you consider?
So forensic pathologists don't work in a vacuum. We do need that information from the scene, from the police investigation, so that way we can appropriately direct our testing, especially in a case like this when I don't have a lot of admission blood to work with. So we do look at that in totality.
And can you describe what information did you have? Did you make a determination as to how Ms. Benning ingested the cocaine that resulted in that toxicology report?
Well, yes. So based on the high level of cocaine, and knowing even from the literature, from the toxicology textbook, that you really see this in an oral ingestion, which is, consistent with the investigation, I actually signed her death certificate to say ingested cocaine.
And going back to kind of the toxicology, when you're looking at kind of ingestion and levels, are there any studies that you sometimes reference to make a determination about maybe when this substance was ingested compared to when the level of the toxicology report is done?
Yes, so there are studies, and they've kind of pulled everything together, even in our toxicology textbook, that looks at the time frame from the time that it was taken into the body by whatever method, and the kind of high level, the peak level is found.
And in those studies, I guess, can you describe what do you mean by peak level?
Well, in the study scenario, when you're actually administering cocaine to a volunteer, you can draw their blood serially and look and see how the numbers change to try to determine how high are they going to go and at what point do they get there. So yeah, they've done those sorts of studies with low levels of cocaine.
And is that, those types of studies, are they looking at the half-life of cocaine or whatever the substance is?
They are. So they look at how quickly it shows up in the blood, what the numbers are, and then how long it takes for the parent cocaine to be broken down into those breakdown products, including that inactive metabolite benzoyl that you see.
And you referenced the studies that they were giving test subjects cocaine. What form of cocaine are given in those studies?
So there was one that I found that was for the oral ingestion. It was a capsule form, and it was, I believe, 100 and 200 milligram capsules.
In those studies where we have this capsule,
Mm-hmm.
are the peak levels anywhere near as high as this?
No.
Can you explain what would happen if they were?
They would be deceased.
And looking at those studies, which obviously you've explained, it's a capsule, it's a low dose. What is the
I do too.
time generally?
So usually for those, the oral ingestion takes a while. I mean, the absorption from oral ingestion takes a while. So like 45 minutes to an hour. Now they did have one where they looked in this country, ingestion is not a common thing, but in other countries, they may be able to chew those powdered coca leaves. And then they looked at those individuals with the low levels of cocaine chewing the leaves, and they saw the levels peaking at 24 minutes to an hour or two. And that's not in the capsule form.
Do we think that this guy
You
knew
said
that
for the capsule,
sort of lore?
45 minutes to an hour was kind of common.
Yes.
Are there any studies on anyone ingesting liquid cocaine?
No, not that I'm aware of.
Is it possible to liquefy cocaine?
Sure.
And kind of comparatively speaking, those studies with the capsules, you can't really relate it to a liquid cocaine. It's different. Is that correct?
That's correct, because liquid medications are absorbed more quickly than a capsule or a hard like tablet form.
And the testing that we have from 225, 23, and 2231, where Ms. Benning's cocaine concentration was 78 nanograms per milliliter, are you able to say if that is a peak level?
No, that's what it was when she came into the hospital and they drew her blood, but I don't know if that's as high as she would have gone had she continued to live, or if she had already peaked. I really don't know. That's what we have at this point in time. I don't have subsequent blood samples to compare.
So any of those studies, they're not really comparing the two same things, correct?
Correct.
And can you go through and describe the autopsy of Ms. Benning and what your findings were, and explain the cause of death?
Yes. So Ms. Benning came to my office and I examined her body. I found that, like I mentioned before, she had the period of time where she didn't have a pulse and she wasn't able to supply her brain with enough oxygen. So she had what we would call an anoxic brain injury. When the brain is injured, it does one of two things. It bleeds or swells. It bleeds typically if it's been injured like by blunt force injury or gunshot wound. And if it's not, then it usually swells. So her brain was very swollen. Unfortunately, there's only so much space in the skull for the brain to go. So when it gets really swollen, it pushes
Burr
down
holes.
on the bottom of the brain where you control your heartbeat and your breathing. So her brain had actually begun to herniate down out of her skull. So I saw brain swelling, cerebral edema, and herniation. The other things I found is the chambers of her heart were dilated, but her heart was not enlarged. And she was pregnant. So I saw the fetus, a baby girl, approximately 25 weeks gestational age. I examined the baby, and there was no anatomic or congenital malformation with the baby. It looked like a healthy, normal 25-week gestation pregnancy. I also did histology. I took samples from several of her organs, looked very carefully at her heart, even in that conduction system, that electrical system that causes your heart to beat normally, to see if there was anything wrong there, and submitted those. And let's see. I did not find that she had any pneumonia, did not see any infection in her lungs. She had a few heart cells that were a little bigger than normal, but she didn't have any infection. She didn't have a heart attack. I didn't see
And you kind
any
of would think,
inflammation in the placenta or the umbilical cord, any sort of infection that would have hurt the baby.
you kind of would have thought perhaps she would have had a heart attack if she had that much of that illicit substance named after the drink in her blood. I don't know. Not a medical professional. I'm just common sense.
So at the end of all that, and I have these toxicology results, the cause of death I determined was acute cocaine toxicity.
And can you describe, the toxicology results of Ms. Benning? Can you describe, once she ingested that liquid cocaine, what would happen to her body?
So cocaine causes your heart rate to go up, and your heart has to work harder. It actually causes the force of the contractions of the heart to be stronger. It also, unfortunately, clamps down on the blood vessels. It causes them to spasm or constrict. So your heart's working harder, but you're not able to supply it with oxygen as well. And really, it's affecting all of your blood vessels. So it's going to make it harder for you to supply all of your organs and tissues with the oxygen that you need. In some cases where people have used cocaine, they may actually have a heart attack. It can also cause an abnormal rhythm of the heart, particularly if it's high. And that abnormal rhythm, if it can't sustain life, then the person will become unconscious and lose their pulse.
You said that it can cause a heart attack. Did Ms. Benning suffer a heart attack?
No.
And you said that there was no problem with her heart. She had a healthy heart. Is that right?
Right. Well, the chambers were dilated, but the heart itself was not enlarged. And she has no history of any sort of heart problems, congestive heart failure, anything to make me think that that was an issue for her.
Is that something that is common in pregnant women?
It can happen, especially postpartum. They can have issues like that. The blood volume, increases in pregnancy.
But there was nothing unusual about that at all.
It was nothing concerning for a cause of death.
And can you describe, if someone ingests liquid cocaine, would they immediately go into cardiac arrest?
Not seconds later. It would take a little bit of time for them to absorb it through the, stomach wall, intestinal wall.
And kind of those first minutes, and I'm talking like maybe 2 to 3 minutes, what would the effects do to the body? Would it make it perfect?
Objection.
Right. Question before you kept going was, what would it do to your body?
So it's like I mentioned, what cocaine is going to do to the body. It's going to cause the heart rate to go up. It's going to cause the arteries to kind of constrict or be small or, kind of clamp down, tighten up to where it's harder for the blood to flow through them. But you're gonna have to absorb it into your bloodstream in order for it to affect you. So you've got to have time for that absorption. Not long if it's gonna be a liquid form, or unencapsulated form.
And would you expect someone to be dizzy?
They can be, yes.
Would you expect them to continue to be able to walk?
Be wavy with their words.
You could walk initially, but as the level rises, it's going to affect you more.
And then what about any type of, aspirating or vomiting? Would that be something that you would expect to occur?
That is a common thing to happen in a lot of deaths.
And if someone describes someone as snoring, does that have anything to do with these symptoms?
Agonal
Snoring
breathing?
often, especially when it's around the time of death, often refers to agonal breathing. So it's kind of that gasping breaths that can sound like snoring.
And agonal breathing, you said it's close to death. Like, is there any type of time frame that you can give to that?
I'm not sure, but we do hear it very frequently where they'll say someone's snoring and then they stop breathing completely. And it's probably because they were gasping for some period of time and then they stop breathing.
Would the person be able to vomit after that?
Yes, I mean, people vomit pretty routinely close to the time of death when they're unconscious, and then that's where we run into some aspiration issues for people who make it to the hospital and survive for a period of time.
You said the person would be unconscious.
Yes.
12:30 is always like
And I
a
guess
low hour for me.
what happens to the body when you have that lack of oxygen to your brain?
That's why her brain is swelling. So once you deprive the brain of oxygen for too long and it can't recover, it will swell. And it'll swell to the point where we have, like in her case, the herniation out of the skull, and it causes their death because it presses on that center that controls your heartbeat and your breathing.
I feel weird today.
And so you said that the studies that you referenced about oral ingestion, that time frame can't really be compared to this. If you had the circumstances of Miss Benning being able to paint words on a photo at 9:10 p.m. and at 9:24 p.m. she's been painting, and the word beautiful is now added to the photograph. It's been painted. The words are legible. You can see them. If that happens between 9:10 and 9:24, and then there's 4 minutes of photographs taken where you can't really tell anything about symptoms. But then 19 minutes from that kind of first painting, she's added words at 9:24, and then at 9:29 p.m., there's a phone call where someone describes Ms. Benning as being able to talk at the beginning of the 6-minute call, but by the end of the 6-minute call, her words do not form and make any sense. And then she is found by EMTs within 20 minutes of that, and she is pulseless. That time frame, is that consistent with her ingesting that cocaine within 30 minutes of her being found pulseless?
Yes, ma'am.
I want to talk about Miss Benning's unborn baby girl. You did an autopsy on the fetus as well, is that correct?
Yes, ma'am.
And can you describe what actually caused Jade Benning's death?
So acute cocaine toxicity caused Ms. Benning to die.
So it was the cocaine in and of itself.
Yes.
And she was pregnant.
Yes.
Is there anything about cocaine and pregnant women that is something that you
Not advisable?
Yes. So cocaine is one of the only drugs that we know can cause pregnancy loss, because it can cause placental abruption, where the placenta pulls away from the uterine wall. That disrupts the blood flow from mom to baby. So now baby's not getting the oxygen that it needs through the blood, and then baby dies.
And did Miss Benning suffer placental abruption?
No.
And I guess why is that?
Well, she died of the cocaine toxicity. And so the abruption maybe didn't have time to occur or just didn't occur in this case.
We're guessing.
And I guess if she maybe had been given less cocaine, is it possible that it could have caused a placental abruption?
It could have.
And this information about cocaine and pregnant women and the cause that it causes placental abruption, are there studies on that?
Oh, yes.
And you said, oh, yes. Can you describe how many studies are there on that?
I don't know how many studies, but they're out there because that's something that I searched early in my career to learn the connection between drugs and pregnancy loss. And that was one of the clear
Why?
connections was cocaine and placental abruption.
What were you
and pregnancy
doing?
loss.
And are those studies available on the internet?
Yes.
Can you describe, you said that there was no placental abruption to Jade Benning's unborn baby girl. Can you describe the autopsy of her unborn baby?
Yes. All right. So the baby. Sorry, I was looking for the weight here. We have an 830-gram female fetus, and then I have all the measurements listed. We take the weight and the measurements to compare it to a chart to see how far along the pregnancy was, and it fit with a 25-week gestation pregnancy. She was in the uterus, the baby surrounded by amniotic fluid. The amniotic fluid was yellow, but there were green particles in it concerning for meconium, which you typically see when the child is distressed. So the child was under some sort of stress, which means they basically had their first bowel movement in utero into that amniotic fluid. Then I measured the placenta. I saw a 3-vessel umbilical cord, which is normal. I did not see any adherent coagulated blood on the placenta that you might see with abruption. And I didn't see any evidence of infection, nor did I see any under the microscope. And then I looked at the organs. All the organs were in the right place. The weights were accurate and as expected. No other abnormalities with the child.
If Jade Benning had not ingested the liquid cocaine that she did,
Objection, Your Honor.
Okay, you want to rephrase your question?
So are we really
I hadn't finished.
putting our hat on the theory that this was a liquefied state for which there is zero studies, medical journals, research showing that that's even a thing? Am I wrong? But does that not feel like a leap? Like, for real? Tell me if I'm wrong.
My question, Your Honor.
She's objecting to
The
Oh my
asking,
God.
the way you phrased it.
She knows what she's objecting to,
Dr. Carney.
Your Honor.
if Jade Benning had lived, would you have expected her to have a healthy pregnancy based on your autopsy of her unborn baby?
Yes, ma'am.
Was there anything wrong with her baby? Would her baby be able to live after ingesting that level of cocaine?
Would the baby be able to live after mother ingested that level of cocaine?
Mother ingested that cocaine and could her baby have lived without her?
Okay, so I understand the question. So the baby died because mother died.
And did you do further testing of anything related to the baby's organs?
Yes, I sent the liver tissue from the fetus for testing.
And can you describe why did you do that?
I was looking for the presence of any sort of drugs that might have circulated through the baby's liver while mom was under the influence of this drug.
And You said that you submitted that liver tissue specifically for testing,
Yes,
and is that result also incorporated in your autopsy report?
yes.
Can you describe what was that result?
So the liver tissue was presumptively positive for fluconazole. That's
Oh,
an
yeast
antifungal
infection.
commonly given to women for yeast infections.
it's like I'm a doctor or
And did you have
something.
any other information related to the testing of that liver tissue?
There were no other positive findings reported. Based on further investigation, I called and discussed the toxicology findings in this case with a toxicologist at NMS Labs. They said that cocaine was found, it was triggered in the liver tissue, but it was very close to the cutoff limit. So they said if we sent it for confirmation, it might not show as positive because it was so close to the reporting limit, but it was there. And in forensic pathology, we're often interested if a drug is even present. So that's why I asked.
And that liver sample was taken on March 7th, is that correct? The liver tissue?
Yes, ma'am.
And so that would have been 10 days after ingestion.
Yes.
And can you describe what would happen to, I guess you were talking about the ingestion of cocaine.
Welcome,
that
everyone.
is down on the blood vessels.
Yes.
That ingestion of cocaine by Jade Benning, what would have been happening to the baby in that moment?
Well, everything that's in mom's blood goes
Please
into
hit that like button.
circulation as well. So clearly the cocaine in her blood did make it into the baby and was still in the liver even 10 days later. Unfortunately, because the cocaine causes that difficulty for the blood to flow to all the organs and tissues, including the uterus and the baby is likely deprived of oxygen during this time. So by the time EMS makes it to Miss Benning, she doesn't have a pulse, so she doesn't have enough of a blood pressure to supply her own brain with oxygen. She's not going to be able to supply the baby with adequate oxygen either, because she doesn't have enough of a blood pressure. They worked very hard to try to save her and took her to the hospital, but they didn't get actual circulation back for some time. I mean, there's I believe a 12-minute gap between the time they left the scene, they get her to the hospital, and at some point after that, they get her circulation back. And my understanding is the first evaluation of the baby, as mentioned in the medical record, is the heart
I
rate
mean,
was already
I hope
low.
so.
So she had already been deprived of oxygen as well.
And Dr. Carney, you referenced the medical records. Did you review other, records related to the medical health of Miss Benning as well as her unborn baby?
I did try to obtain as many of the OB records as I could find.
So you had her records from Dr. Mullally and BUMC,
I believe that's where it was, yes.
as well as her Jade Benning's medical records from being in Vanderbilt University Medical Center. Is that correct?
Yes, ma'am.
And you were mentioning the baby's heart rate.
Mhm.
Can you describe what happens?
Look at
medically, what does that mean when a baby has a heart rate as low as Miss Benning's unborn baby that I believe went down to 30 beats per minute?
It's very concerning because again, she doesn't have, her heart is responding to not getting enough oxygen. It's not beating normally because normally the heart rate is much higher. So I know there was a lot of concern that,
That's
the
really
baby wasn't getting enough oxygen and was already in the same kind of scenario as mother with that anoxic brain injury.
Is it possible if anyone made a decision to do a cesarean section and take the baby, is it possible the baby would be in the exact same condition as Miss Benning?
Yes, and then you have also the added challenge of at that point when she first went into the hospital, the baby was only about 24 weeks, even 25 at autopsy. So at that point, the lungs aren't very well developed, and it's really difficult to oxygenate those little ones and for them to survive.
Thank you, Dr. Kearney. I don't have any other questions. Actually, I'm sorry,
Excuse me?
I did forget to ask a question. May I ask?
Okay.
Dr. Kearney, did you determine a manner of death?
Yes,
And what was the manner of death?
could not be determined.
that's what I thought.
And you did not make a determination on that, correct?
the circumstances surrounding her ingestion of cocaine were very concerning, that she ingested this unknowingly. Most cocaine intoxication, someone is taking the drug for wanting to get the effects, and so we would call it an accident because they didn't take it to try to kill themselves. In this case, police investigation did not show any history of illicit drug use. Everything that they found that as soon as she found out she was pregnant, she wanted to do everything she could to take care of herself and take care of that baby. And
Baby.
it didn't really fit with your classic using drugs for the euphoric effects and accidental death. It was much more suspicious that someone gave it to her without her knowledge, but it didn't have enough to get to that, homicide determination.
And your autopsy report, that was completed, I believe, August 11th of 2023, is that correct?
That's a long time
Thank you, Dr. Hunt.
after her death date, which was March 6th. I didn't realize
Good morning.
that was a thing. Take that long.
I have a few questions for you, Dr. Carney.
Maybe I'm just crazy.
Probably.
Sorry. That was a little bit louder. This way.
Just so the jury knows, we've met before, correct?
That's correct.
Okay, thank you. Let's talk a little bit first about your qualifications.
Okay.
You are in fact a pathologist medical examiner.
Correct.
That's what you went to school to learn to do, correct?
Did for my training, yes.
You are not a toxicologist
That's correct.
and have not been to school to become a toxicologist.
That's correct.
You'll agree with me, that is a totally different area of expertise.
That's different, because that's taking the blood and taking it through the machines and interpreting the data. So that's not what I do.
And it takes a whole nother specialized training to understand the toxicology, let's say, for example, cocaine and the metabolites like the BCE and the MEE, which are the metabolites of cocaine, correct?
It takes training to be able to test for those, interpret them in the data, yes. My training is in taking those toxicology results in the setting of that autopsy. I did actually spend a whole month in the toxicology lab as a resident, and then I rotated again as a forensic pathology fellow so that I could learn how this is done, what's important in the autopsies, and how to interpret them to determine cause of death.
Boom.
But just so that the jury is clear, that doesn't make you a toxicologist, correct?
That's correct.
And it takes, if we were to ask a toxicologist, if 1 month in a lab is all it takes to be able to become an expert, would they agree or disagree?
Well, I'm not an expert in performing the toxicology. My expertise is in taking those toxicology results in the setting of the autopsy to determine cause of death. A toxicologist will not determine a cause of death.
No, of course not. Tell me exactly then, outside of that month, what other trainings have you had in regards to toxicology?
So in my fellowship and in the 13 years that I've practiced since, it's been my job to take these toxicology results in almost every autopsy I perform and apply those to that case to determine if it is a toxicologic cause of death or not.
But my question was the training. What training, and not on-the-job training in terms of, I have a body in front of me that has toxicology results.
Mhm.
What specific schooling and training do you have outside of that month for toxicology?
Like I said, in your fellowship, you learn how to apply results. You have attending pathologists that you can ask questions of. There's toxicologists to ask questions of, and then you continue to do that in your practice.
So no schooling.
There's no specific schooling for that, no. You don't go to a special set of training in order to learn how to do this as part of forensic pathology. It's part of your forensic pathology training.
I'm speaking about toxicology. That's the question before the jury. Toxicology schooling and training.
But I don't perform the toxicology testing. I take the results and apply them. That's part of forensic pathology training and practice.
And that's a different area of training and schooling as well, to interpret toxicology results, is it not?
And that's what I do. That's what I was trained to do in my forensic pathology fellowship and what I've been doing for years.
Okay. And what school did you go to for that toxicology training?
I went to the state of Maryland Office of the Chief Medical Examiner for my forensic pathology fellowship in which I was trained.
Okay. And you were there though for forensic pathology, not toxicology. Let's go now
She's
to,
gotten training in interpreting toxicology.
so let's go.
Yeah,
now
this is
to
this lady's
your duties
go-to
with
beat a dead horse move.
Ms. Benning.
Okay.
When did you first learn about this case?
I first learned about the case when she was still in the hospital in the intensive care unit.
And do you remember when that was?
That was February 28th. My office was notified.
Who were you notified by?
The initial note mentions a physician at Vanderbilt, but it did not have a name. Here we go. A physician from Vanderbilt contacted the office. And then we were also called by the toxicologist at Vanderbilt.
Oh, there was a toxicologist that was involved?
Yes.
What was that toxicologist?
She's just now
Dr.
finding that out.
Blaire.
And do you remember the purpose of the call?
The initial call to our office was to let us know that she was expected to die of her anoxic brain injury. And given the case information, that she would be a medical examiner case.
And so was there anything specific that they needed you to do at that time?
There was a question about whether or not she was a consented organ donor. So there was a question about organ donation.
Were you aware that at some point prior to her coming to your office and speaking about Ms. Benning, that there was an investigation going on in regards to whether or not she ingested some type of drug?
Yes.
And over the course of that time, did you ever have an opportunity to speak with the homicide detective, Adam Reese?
Yes.
Did you also have an opportunity over the course of that time to speak with General Norman?
Yes, I think I did speak to General Norman during that time frame, or shortly after.
And all of this was prior to Ms. Benning getting to your office,
Correct.
arriving at your office.
Yeah.
So when
Yes.
Ms. Benning arrived at your
Yes.
office,
Hold
you
on.
performed the autopsy.
I don't know if you guys remember this, but I mentioned this on day one that I thought it was really messed up that the pathologist the pathologist who performed the autopsy knew great details about this case before the decedent, Jade, was even on her table. For the simple reason, like, how does that impact cause of death? You know what I'm saying? In this case, she determined it as undetermined, but that just seems like some backdoor dealings.
Correct?
That's correct.
And you'll agree with me, I was there early on, that an autopsy is not done in a vacuum. Have you ever heard that phrase?
Yes.
Can you tell the jury what that means?
She reminds
Well,
me of
it means that
very nice.
we need to know what the circumstances are surrounding the death, because there are some deaths that don't have specific autopsy findings, or they have very few. So we need to know how to interpret that in the setting of the circumstances surrounding death.
And that just basically means sometimes you just can't look at the body and the body itself
Correct.
in order to determine the manner of death.
Or even, yeah, that's true.
Okay, fair enough. And And so would you say then that you would consider Miss Benning's case one of those cases where you had to look at circumstances outside of the body?
Yes, ma'am.
Now, knowing that you now are looking for specific drug, perhaps that there is a homicide investigation going on, what did you do to try to determine what, if any, drugs Ms. Benning would have been involved with?
There was more than 1 urine drug screen that was performed at the hospital. And there was additional testing done because they were trying to determine at the hospital if there was any drug that she had ingested that they could treat for, maybe understand why she was in the state she was in. So I did talk to the toxicologist about that to find out what had been tested, if anything was positive, what was negative, and that could help me direct the testing on the small amount of blood I had to work with.
So you were looking then for particular drugs based on all of the investigations surrounding this death.
Yes, ma'am.
Did you take a hair sample?
No.
You did
Well,
not,
Not for toxicology testing, no.
but did you take a hair sample?
Because she's a suspected homicide, there might have been some sort of hair sample collected, but it was not used for toxicology.
Why not just cover all the bases?
May I ask that I pass an exhibit for identification purposes? Would it help you if I showed you a couple of pictures that were results of your testing and or collection to refresh your memory?
Okay. Yes.
So do you remember taking a hair sample?
Yes, so this is a pretty common practice with a homicide investigation that we would take a hair sample, but it was one that's not used for toxicology testing.
And did you take fingernail scrapings?
In this case, we did fingernail clippings.
Clippings?
Yes.
Yeah, they're not removing the nail bed.
So there were no fingernail scrapings?
I don't usually do scrapings. I'll actually clip the whole nail itself, or the end of the nail where you would have the scrapings, and just take the whole thing and put
Why
it in
didn't she just
in the
become
hole.
a doctor? She has great bedside
And
manner. I can
did
already
you
tell.
have, knowing that, because you got the body on March the 7th,
Yes,
and you did not make your findings until August 31st?
yes, or August 11th, I believe it
I'm
was.
sorry, August 11th?
Oh, that's Frank's
Yes.
birthday.
Okay, so that's 5 months.
Mhm.
And during this 5 months, I think you stated that the manner of death was pending.
Correct.
So you were trying to find what involvement, if any, Ms. Benning would have had with drugs.
Correct.
And so then did you send that hair sample out to be tested? Why
Oh,
not?
here she comes.
I
I'm not
normally
making
test
eye
for hair
contact.
instead
Oh,
of
God, here she is.
long-term things, and usually I think I've only sent hair for heavy metals testing. It's not a common thing that I test for
But you
illicit
can't.
drugs.
Kappa?
Sure.
But you can find the different types of drugs that a person may have been involved with, come in contact with, or utilized with a hair sample.
Yes.
It's possible. I've never.
She's not a
tested hair
toxicologist.
for cocaine.
But you can do that, can't you?
I think you can.
You don't.
I'm not sure. I've never done it, so I haven't checked into that.
We've made it very clear she's not a
What
toxicologist,
about
ma'am.
to test the fingernail clippings? Did you have any of that tested?
No, actually, I gave the fingernail clippings. I believe that was picked up by the police department.
Have you ever heard of someone taking cocaine with their finger and doing it like that?
It is possible.
So wouldn't it have been important in trying to determine what happened truthfully to Ms. Benning to have those scrapings tested?
I've never sent clippings for drug testing.
And so you did not do that either?
No.
So you landed on the testing for the blood.
Yes.
And did you try any other means or methods to determine what types of drugs you would have been involved with?
Any other
Are you
means
okay?
other
Are
than
there
testing?
any other means that you as a pathologist can engage in to determine what type of drugs that Ms. Benning could have been involved with?
Well, blood is really what we want to know, if there's any drugs there, because that's what's going to be circulating through her system. And we have a peripheral blood sample, which is ideal. So from that, we know what drugs are circulating in her system at the time that she goes into the hospital. There was other testing done, and I did try to gather all of that in order to direct my testing.
What about the vitreous fluid? Did you do, can you educate the jury what the vitreous fluid is?
Vitreous fluid is the fluid of the eyeball, and we do collect that on every autopsy. You can test that for, occasionally I will test it for drugs. Usually I want to use that to look at their electrolytes to see if they were dehydrated, if there's any chance they might have had high blood sugar, died of, diabetic crisis.
Wild.
But yes, so we do have vitreous fluid that we draw in each case.
Did you draw that from this thing in your search for what type of drug she was using?
I believe we did.
It's just like crazy to me that you can tell that from dehydration from eyeball fluid. You know what I'm saying? Yins knowns what I'm saying. If you're wondering what I'm cleaning, this is
I
my
did not send the vitreous fluid,
desktop vacuum.
but I think we did collect it. Although I wasn't concerned about her hydration levels, considering she'd been in the hospital and that had already been followed.
And it is life.
Right.
Will you agree with me that you can do drug testing with vitreous fluid?
You can.
That's wild.
Sometimes it's the best way to test for different types of substances.
I don't know that I would say the best way, actually. Blood is the best.
Okay. But it is in fact able to get it done.
It is a way. I have used vitreous fluid to test for a substance that normally I would use urine for, and I didn't have any urine in the case, so I used the vitreous.
Now, you talked about the findings in this case in regards to the blood.
Yes.
And you stated that based on you adding the amount of the EME
Yes.
along with the cocaine, in your opinion, was the best way to come up with how much parent cocaine she would have had in her system.
Correct.
Can you explain that to us, please?
Well, like I mentioned before, there are enzymes in the blood that can break down cocaine even after someone has died, unless you get it into that tube with the sodium fluoride, which we didn't have in this case. So there was a week, 10 days in the hospital that blood, cocaine could be broken down, and then additional time before it got to the laboratory to be tested. So there was quite a long time for the cocaine to be broken down. So that's why it's important to look at both of those.
And so that we can educate the jury, the cocaine itself would be the parent cocaine, right?
Right.
The BE is the next metabolite that parent cocaine will break down to, correct?
So that is a breakdown product that is inactive, and it can build up and be there for a little while.
And then you have, from BE, it goes to EME, is that correct?
I don't think it goes in that order, but with this one, we're worried about the cocaine being broken down in the tube after death, and it gets broken down into ethylene methyl ester.
And those are the three levels in
Oh.
which cocaine breaks down.
Yeah,
just-
those
I
are the
think
three, the cocaine plus the two breakdown products.
I think she would have been a
And
great
your
doctor.
testimony that the
Not
best
working
way
with
to
dead
determine
people.
From Ms. Benning,
Mhm.
about how much cocaine would have been in her system on 225 would be to add the parent cocaine with the EME. That's your testimony.
That's correct.
And the 7,878 nanograms per liter is a huge number. Will you
Wow.
agree with
Per
me?
milliliter. Yes, it is.
Okay. And it is too much, I think you stated, for the body to take.
Right. It can be overwhelming for the heart.
Now, you're not stating that everyone who has a level of 78 ends in death, are you?
I'm not aware of someone with that level surviving.
Okay, so is your opinion that anyone who has that kind of level would be dead?
It's hard sometimes to interpret in some
did.
of these illicit drug levels what's a lethal dose, because you have to find out, have they been using cocaine over time? Have they developed
That's what I was
tolerance?
thinking,
Maybe
yeah.
they can handle higher levels.
Kind of like George Floyd.
In this case, she is a naive user, so for her, this is too much for her.
Now, how did you come to the conclusion she was a naive user?
The investigation did not reveal any history of cocaine use.
And who relayed that information?
Yeah,
How did you come to that?
please.
That was talking to the police, because they did the investigation into, anything about her.
And who specifically did you speak with in regards to that conclusion?
I believe I talked to Detective Reese, because I specifically asked him about a history of drug use.
And I'm
And what
a
did he
police
tell you?
supporter.
That she was not known to partake of cocaine.
Did he tell you cocaine or drugs, period?
This was specific to when I was asking about the cocaine.
Did you ever make a statement that you were told through the police investigation that there was no history of drug use, period?
No, I don't think I said that. Because I think in the past, there might have been some marijuana edibles.
Just a little bit,
I
though.
believe she may have used
Every
marijuana
once
in
in
the
a while.
past.
So you don't think you ever said that?
Let's see. Yeah, see here, it says, no history with illicit drugs other than marijuana used to make edibles.
No mushrooms?
So no other illicit drug use, specifically cocaine.
Would it help you if I was to show you your testimony from the bond hearing to refresh your memory about whether or not that statement was ever made?
Sure.
Yeah,
I put a sticky.
Okay.
I'm willing to die on the hill that she should have been a GP, because we need more doctors with a cheerful disposition. But however, maybe she's cheerful because she doesn't have to deal with people's BS all day long.
So if you're referring to this, I stated,
Never mind.
the investigation does not show Ms. Benning as someone who used drugs historically or even recently close to her time of death. It doesn't appear that she used this sort of illicit drug in the past. So referring to the cocaine.
And so when you stated that it doesn't appear that she had the history of using any drugs, you're saying that you were speaking about cocaine?
Yes, because I specifically say this sort of illicit drug.
Now, can you tell me when you talked about things that you look for, when you talked about cocaine, seeing it in the past, things that were in the system, you remember talking about that?
Is Ashley still here? Is
And-
Bubbles still here?
Did you see other things in her system that that at least would have caused you some concern or to consider?
Rob?
In my testing, no.
No, and Mrs. Benning's history in any of the testing.
There were several other rounds of testing that were done, but most of those, well, actually all of those were after this initial sample. So she was at the hospital and was given various medications to treat her at the hospital. So those medications showed up in that testing.
Well, specifically, you stated on that record, the marijuana, you were
Right.
looking at different things that were in it, correct? In her system.
Right.
Did you notice that cocaethylene was present in her system?
No. There's no cocaethylene in her blood.
Isn't that alcohol?
Do you remember
Alcohol?
where there was a confirmation testing that was done on cocaethylene?
No. And the cocaethylene testing was done on the hospital blood. The reporting limit is quite low, and there was none there.
Quite low, like you talked about with the cocaine in the baby's liver.
So it's,
And you testified that you noticed in the baby's liver there was cocaine, but it wasn't on the reporting level, right?
no, I asked the toxicologist if there was a presence of any, I think I asked about cocaine and I asked about marijuana. And they said they did see some cocaine, but it was near the reporting limit.
Right, but you testified earlier that even though it wasn't in the reporting limit, it was there, it was present. And so you like to look at that in order to make a determination.
Yeah, I was interested in learning that information, yes.
That would be the same thing for cocaethylene, would it not?
Right, but I wasn't aware there was any cocaethylene there. And the reporting limit it's very low, 10 nanograms per milliliter.
But in the same manner that cocaine was there in the liver, the cocaethylene is present too. It's just not in the reporting above the reported limit.
I'm not aware that there's any cocaine in this blood. I was not told that at all.
Well, why would a lab do confirmation testing if cocaethylene did not show up at all?
They did confirmation tests. Well, they did testing for benzoylecgonine, cocaethylene, cocaine, and equine methyl ester. That's what the cocaine and products panel includes. So they tested for all of that as part of that panel.
But why would a lab do confirmation testing? Because let's talk about that.
No.
The confirmation testing that's listed here is on the liver tissue.
That's her baby, is it not?
Right.
And you just testified that what's in mama is in the baby as well, correct?
I said that the cocaine was in her
Any
at a very
substance-
low level. But I wasn't told that there was any BE or cocaethylene. We just talked about cocaine.
Any substance that is in the baby can only get there if it comes through mom, is that correct?
Right. And I wasn't told that there was any cocaethylene in the baby.
Did you look at the results to see whether or not there was cocaethylene in the baby?
There's no cocaine, cocaethylene, or benzoylecgonine reported on this for the baby. I specifically called and asked the toxicologist about the presence of cocaine and was told yes.
That's not my question. I understand what was reported here. I'm asking whether or not the presence of cocaethylene was present in the baby liver at all.
I was not told there was any cocaethylene in mom or baby.
If the baby did have the presence of cocaethylene, but just not above the reportable limit, what does that mean?
I don't know what you're getting at. I asked about cocaine and I was not told there was any cocaethylene.
Right, but I'm asking a different question.
If there, so we're getting into hypotheticals now. If there was cocaine and ethylene, because there's not any. So
Your
if
testimony-
it was there,
Oh, I like her
your
snapback.
testimony today, there was no cocaethylene in
I'm-
Ms. Benning, if I could finish.
Sure.
And Ms. Benning and or the fetus, it's a simple question. Is
I'm,
that your testimony?
it is correct. I'm not aware of any cocaethylene in mom or baby,
If you,
either on the report or in my discussions with the toxicologist.
if you were to learn later that there was in fact cocaethylene in the baby or in mom, how would that change your evaluation?
It wouldn't.
What is cocaethylene?
Cocaethylene is formed when cocaine and ethanol or alcohol is in the blood at the same time.
And
Bing!
that would mean whoever has cocaethylene
I'm
in
on
their
fire
system
today.
was drinking alcohol and taking cocaine at the same time.
You want to show her something that shows that?
And,
She says.
He's done with your BS.
well, I can show her the lab she's looking at, where it specifically states that there was a confirmation test for cocaethylene.
She's got that. Do you see,
Yes, the confirmation test was for benzoylecgonine, cocaethylene, and cocaine, and none of them came up as positives on this page.
There's a screening test that's done before a confirmation test, is it not?
Correct.
And if something doesn't show up on the screen test, then it doesn't pass on to the confirmation test. Would you agree?
Correct. Because you could have a false positive. You want to confirm it.
Right. I'm not talking about false positives. And a lab will not move from screening to confirmation unless something shows up.
What do you mean,
positive,
Bubbles?
Correct.
Correct.
And in this case, there was a confirmation test for cocaethylene.
Sure.
That means that during the screening process, there was a presence of cocaethylene, not what the ending results end up, but there was a presence that made them move from screening to confirmation.
There was something of concern that appears for them to further test.
Now, let's talk about your conclusion in regards to Ms. Benning and the ingestion of cocaine.
Okay.
In order to arrive at the number of 7,878 nanograms per liters of cocaine,
Milliliter. Yes.
milliliters, I'm sorry, of cocaine, can you tell us how you believe that Ms. Benning would have had to ingest that?
When you look at the literature, it shows that you do not get these levels with all the other routes of administration. You really only get it with ingestion.
And is your testimony that ingestion from Ms. Benning would have been through a liquid cocaine?
I I don't know how it was ingested. I just know it was ingested.
Would you opine that it was one bolus dose or over a period of time?
I don't know. I know from obviously the investigation, she doesn't have a prolonged period of symptoms.
So you believe it would have been one bolus dose more likely than not?
It could be, yes.
How much cocaine is 7,878 nanograms per milliliters? Could you give us an example of equating what we would look, an apple, an orange, a lemon?
So unfortunately with illicit drugs, there's no quality control or testing process like you have with your normal medication that you buy over the counter or from the pharmacy. So it's in a tablet dose and you know exactly how much it is. I have no way of knowing how much powder or liquid or how pure it was. I can't give you any specific size or amount.
But you'll agree with me, it would be a whole lot, right?
If it's a very concentrated dose, it might not be like a large size of something.
So it could be very small.
It could be.
And then if it's very small, it could be something someone took on their own, could it not?
It's possible.
Will you agree with me that most overdoses are a result of an accidental overdose?
Yes.
And in our hypothetical just previous that we talked about that because of the concentration, it could be very small, then it also could be an accidental overdose of someone who took a small dose.
You mean like a small amount that turned out to be more than they thought?
Like we just talked about, yes.
Yes.
You're stating today that you've never seen prior to this dose or this case, doses of that amount of cocaine.
Yeah, I only found the one.
Okay, so there was one you've seen.
There was one, yes.
Okay, just making sure. Let's talk a little bit about the heart cells.
Okay.
Ms. Benning had enlarged heart cells, not major, but they were a little larger than normal, were they not?
Correct. She had focal myocyte hypertrophy in the left ventricle.
Okay, and what does that mean?
It's a small focus where the heart cells are a little bit bigger than normal.
And an occasional, hypothetically, an occasional cocaine user would have enlarged heart cells similar to what you described, would they not?
You know, I'm not sure about that. I've seen chronic cocaine users who have developed high blood pressure and thickened left ventricles, but I don't know about the occasional, if it affects the cells on the, it's possible.
It is possible.
It's possible.
Now, did you learn at some point that Ms. Benning tested positive also for fentanyl?
Yes.
And you familiar with the opioid crisis in our country today?
Yes.
No.
What's your next question?
And you'll agree with me specifically during this time that Nashville itself had an issue with fentanyl overdosing.
Objection, Your Honor.
Everyone does.
Do you care to be heard?
Yes, this goes to our defensive theory, Your Honor.
Ooh, okay. I'll allow
Do you
it.
have any studies that show in Nashville how many fentanyl overdoses there were?
I don't have them handy, but it's definitely been on the rise over the last several years and has been followed.
What are you referring to, Scott?
And there is currently an issue with what they call a fourth wave of the opioid crisis, where there's a mix of fentanyl
Yeah.
and a psychostimulant such as cocaine. Would you agree with that?
Yes. Fentanyl is often mixed with other drugs.
And that would be something similar and analogous to exactly, well, let me back that up. If someone was to overdose on fentanyl and cocaine, that would be consistent with the current rave of the opioid crisis today.
Never mind, Scott. I know what you mean. Yep.
Given that Ms. Benning had fentanyl as well as cocaine in her system.
Objection, Your Honor. Counsel is mischaracterizing.
Is what?
She's mischaracterizing.
Okay. You want to ask her where that came from her opinion?
No, I wanted to ask her whether or not,
Or you can do whatever, redirect.
if
What is
Ms.
your question?
if Ms. Benning had fentanyl and cocaine in her system, certainly that fentanyl could have contributed to her death, couldn't it?
It could, however, the fentanyl that I've learned about that was found in that testing was after she was given fentanyl at the hospital in course of her treatment.
Were you aware that she tested positive for fentanyl prior to being administered fentanyl in the hospital?
Objection, Your Honor. Counsel is misstating the evidence.
How?
No, I'm not.
Yeah.
You know, can you help them understand when it was given and
So fentanyl was ordered at the hospital and was given to her. And I believe there's been a lot of work to clarify the blood samples, but the blood sample that is positive for fentanyl is after she was given fentanyl at the hospital.
Are you aware that at 22:59, that there was a urine sample that tested positive for fentanyl from Ms. Benning? Are you aware of that?
Again, objection, Your Honor. Counsel is misstating.
okay. Dr. Ola
Oh.
Suga testified all negative in urine results from 2259.
Your Honor, we have direct evidence, and I'm
Okay,
asking
well,
her.
Wow. Okay.
I mean, they're objecting to your question is not accurate. So whatever proof you want to put on that it's not, then that's fine.
Hypothetically, if Ms. Benning tested positive for fentanyl prior to being administered fentanyl in the hospital, would
What
that
bubbles?
affect your decision as to what could have caused her death?
Oh, the circles running
I would
around.
want to know what the level was, and we can look at, whether or not it's fentanyl and cocaine causing her death. But everything that I've found, that urine drug screen that was positive for fentanyl was also positive for an anti-seizure medication that was given at the hospital. So I
That's
believe that
good.
fentanyl is administered by the doctors treating her, not illicit drug.
I understand that. Are you aware of the metabolite 4-ANPP?
Yes,
And would you agree with me that that's more in tune with illicit use as opposed to a medical use?
it has been in the past, but apparently that has now come up positive in fentanyl that is administered by a hospital, or by a doctor. So it doesn't really carry a lot of weight with me anymore.
But it used to carry a lot.
It used to, but not anymore. And I know that was negative for acetyl fentanyl, which was also tested and is more in the illicit drugs.
I'm not asking about a specific thing. I'm
Okay.
asking about 4-ANPP.
Well, I use that to kind of help in that determination.
Ma'am.
Sure.
I'm speaking of 4-ANPP.
Mhm.
There was a time where that was important to you, right?
Right.
And it was indicative of illicit use, was it not?
Yes,
And so, if Ms. Benning hypothetically tested positive for 4-ANPP prior to you changing your thought process on it, it would make you believe that there was illicit use, correct?
possibly.
And can you tell us what are some of the symptoms of a fentanyl overdose?
So whereas cocaine is a stimulant, fentanyl is a depressant. So it's more like alcohol, where everything slows down. The breathing slows, the heart rate slows, and they tend to get very sleepy and then go to sleep and don't wake up. They can also have issues with edema in their lungs, where you get kind of the fluid that's getting out into the air spaces. And so they might have like the foamy fluid in their mouth and their airways.
Okay, so you expect to see some foam around the mouth?
Possibly, yeah.
You expect for that person to become sluggish?
Yes,
Depression of the heart rate,
yes,
something consistent with the baby, the fetus's heart rate going down to 30? Would that be consistent with the slower heart rate?
yes.
Someone then going to sleep, as you just stated?
Mhm.
And with fentanyl overdose, that happens much quicker than a cocaine overdose. Would you agree?
No.
No? Well, could it happen quickly?
Could.
So If someone is snapping pictures and taking selfies, and within a minute, they have slipped into a medical episode that is described as becoming sluggish, foaming at the mouth, labored breathing, lower heart rate, would those be things that could possibly be consistent with a fentanyl overdose?
It's possible.
And to be clear, as it relates to Ms. Benning's OBGYN history, there was no testing done by her OBGYN to determine whether or not she had the presence of drugs in her system, correct?
I don't recall seeing that. Yeah.
So we don't know.
I don't think there was drug testing.
If you were to learn that Ms. Benning met with her drug seller or person she received drugs from on that day, February 25th of 23, would that weigh into your consideration?
I mean, it's a piece of information that's good to know, but it still doesn't change what's in the blood.
Thank you.
Okay.
Yes, Your Honor.
Dr. Carney, Ms. Collins just asked you a lot of hypothetical questions, beginning with fingernail clippings and whether or not you sent those off for drug testing. Was there any evidence that Ms. Benning ingested cocaine by snorting it?
No.
Was there evidence to the contrary that she ingested it by swallowing it in liquid form?
It's definitely consistent with the ingestion.
And she was specifically asking you about other drugs that Ms. Benning might have used. Did any of the testing reveal anything when Ms. Benning first went to the hospital other than cocaine?
No,
There's no alcohol, there's no marijuana, there's no nothing. Is that correct?
that's correct.
And she asked you a lot of questions about cocoethylene.
Yes.
Is there any evidence whatsoever that Ms. Benning was drinking alcohol and snorting cocaine?
No.
And is there very specific evidence to the contrary?
It appears that yes, from the investigation of the scene.
If she had been drinking alcohol, would that have shown up in testing?
Yes.
And did it?
No.
And if she had been using any other drugs, would that have shown up in testing?
Yes.
She asked a lot of questions about fentanyl and fentanyl crisis and opioid crisis. Dr. Carney, is there any evidence whatsoever that fentanyl was ingested by Ms. Benning when the dose of cocaine was ingested?
No.
And specifically to that dose of cocaine, can you say exactly how much it was?
Like
what amount?
size wise?
Yes. In the other case where the amount was 10,000 nanograms per milliliter, the circumstances of that person was in police custody, is that correct?
That's correct.
Were you provided with like the facts of that case as part of the autopsy?
Yes.
And was it a large amount of cocaine?
It would have had to have been something he had with him that he could swallow quickly.
And so something that you could have a small rock, pop it in your mouth, swallow it, and that would do it.
Yes.
Thank you.
And act totally normal
I do,
the remainder of the evening.
yes.
Okay.
Dr. Carney, what drugs did you test for?
I tested for cocaine and products as well as designer opioids.
What is included in designer opioids?
It's on the third page of the report, and it's a lot of these designer fentanyls, and it includes 4A and PP.
Now, You just stated that there's no evidence whatsoever of the presence of cocaethylene in Ms. Benning. Is that what you testified to?
I have no positive findings for cocaethylene and no communication to say otherwise.
Are you familiar with the lab of the Center for Forensic Science, Research and Education?
Yes.
Okay. And that's a lab here in Nashville?
Actually, the CSFRE is a branch of NMS labs.
Okay.
They're associated with NMS.
Is it a lab that is utilized by Vanderbilt?
If they send their samples to NMS labs, yes.
And are you aware that there was a sample of Ms. Benning's blood that was sent to CSFRE?
Yes.
Did you have a chance to look at the results of those testings?
Let's see. There's some testing here. I think it was urine actually that I was aware was sent.
Yes,
Yeah,
the
urine was sent to the research lab. Yes.
And in fact, isn't it true, Dr. Carney, that her urine tested positive for cocaethylene at the CFSRE?
I was not aware of any cocaethylene, no.
If I may, Your Honor, if I can show the witness.
Wow. For those of you,
Take a look at those results.
I should probably do this now. For those of you just joining us, whether you are watching live or on replay, please make sure to say hello in the chat. If you are unsure of what's going on, I'll fill you in. This is day 4 of the trial of Blaise Taylor. He is a former NFL scout for the Tennessee Titans who is accused of unaliving his pregnant girlfriend at the time. We are on the witness, I don't know which number right now, but it is the doctor who performed the autopsy. And there's a lot of questions about the cause of death, which was she couldn't give a cause of death. It was why am I struggling with that word? Couldn't give it a cause of death. And undetermined. And the other thing I wanted to mention is that she has been asked several questions about some illicit substance use. I have to be careful with YouTube words, and I want to make sure that don't get in trouble here. But if you guys have any questions, please let us know. And I guess by us, I mean me and my dogs. Thanks. Please make sure to hit the like button, or if you're on your phone, just double tap your screen. It helps push out the algorithm, which I need help with right now, obviously.
Okay.
Do you see there when Ms. Benning tested positive for cocaethylene?
I do see a positive for cocaethylene here.
So the statement, conclusion, or testimony that there is nothing, nowhere else to suggest Ms. Benning tested positive for cocaethylene isn't true, is it?
There's a positive here in the urine.
And so if it's positive for her urine, that means at some point, Ms. Benning had to consume alcohol and cocaine at the very same time.
It's a product of cocaine and ethanol. So yes, there's some sort of ethanol there.
No other way around that, is it?
No.
I'll pass the witness.
Any other questions?
Oh,
Dr. Carney, there were only 2
sorry, was that
samples
out loud?
that were obtained from Ms. Benning, a urine sample and a blood sample, prior to her receiving treatment at the UNC. Is that correct?
I believe that is, well, let's see. I know the blood sample is prior to. The urine here, if this is the first urine sample, it's positive for drugs that she was given as part of her treatment.
It is not the first urine sample.
Okay.
That is the purpose of my question.
Okay.
If this urine sample is after she received medical
Which
treatment,
one are you talking about?
I'm referring to the report that Ms. Holmes just
Okay,
gave
from
me.
the other lab.
Right.
Okay.
He's
what-
getting hungry, guys.
Collins was asking
We can already
questions
tell.
like that was a urine sample that was taken in the beginning. If that urine sample is from after Ms. Benning received treatment.
Right.
There's a positive for cocaine, but there's also a positive for fentanyl type products, correct?
Correct.
And that is consistent. I guess, can you describe it? Are all of those substances consistent with her receiving medical treatment at Vanderbilt Hospital?
Yes, so there's the cocaine and the ones that are associated with cocaine, and then the one positive cocaine, and then everything else looks like it was from her treatment.
And are you familiar with CFSRE labs?
Yes, I'm familiar with them.
And do they do kind of specialty testing?
Yes.
And their levels are lower than other labs, correct?
I would not be surprised considering there's not even a number on here. It's just a positive.
And I guess the toxicologist that performed this test might have more information about that level and why that finding was there.
Yes.
You reviewed multiple results of lab work related to Ms. Benning. Was cocoethylene in any?
Lunch?
No.
Oh, yeah.
Any other questions?
Yes.
Oh,
You're not telling this jury that Vanderbilt gave her alcohol and cocaine, are you?
No.
Okay, so regardless of when the urine was taken, she had it in her system, didn't she?
There's a positive there. I don't know what level, but
And if the original urine that was taken from Ms. Benning was notated at 2259 on 225, and her first administration of fentanyl was not until after midnight that night, that means that that urine testing was prior to her getting fentanyl. Would you agree?
so she had a seizure disorder? Because she has an anti-seizure drug in here that was given at the hospital.
I'm not talking about seizures. I'm
Then I
talking-
don't think that we can say that this is prior to treatment. This is after treatment. She very clearly has other drugs in here that were from treatment.
I don't think you're getting my question. I'm not speaking
Objection,
about
Your Honor, it's been asked and answered.
Okay, what is your question?
My question is, if her urine was taken at 10:59 PM from Vanderbilt, and fentanyl was not administered until after midnight, if that urine tested positive for fentanyl, that would
Objection,
be,
Your Honor, counsel is misstating the evidence. That
No,
report is
I'm
not
not.
related to that sample.
she can just answer the question, the evidence is going to come out
Did
as
you
it
have
is.
multiple urine samples?
So there are urine samples, and they're clearly after she's received treatment. And I believe this has been all worked out as far as the timing. So the fentanyl from this is from her treatment.
And you're right, it has been worked out.
someone
Right.
is
Because
So this is not
very
illicit.
dumb
This
here.
is treatment fentanyl.
Originally, up until as late as a few.
Objection, Your
What
Honor,
is your question?
counsel
I
is
can't
misstating the evidence.
answer. I can't answer.
What is your question?
For the first year and a half to 2
You gotta
years,
start out with that. What is your question?
the original urine was at 9, it was taken at 22:59. Is that correct?
That's what it states.
Okay, that's all I needed to know. And fentanyl wasn't given until after midnight, isn't that right?
I don't know that that's accurate.
Did you take a look at the records?
I did, but there's been a lot of examination of those records.
And so have they changed?
I can clearly see that she's been given treatment, and fentanyl was part of her treatment. It was ordered almost right, very early on when she was there. So my understanding from everything that I've reviewed is the fentanyl that's there is from treatment and was not illicit.
How does that
Did
make
not
sense,
include
though?
death.
I know that, but my question was, the first round of fentanyl wasn't given until after midnight, isn't that true?
I don't know that that's
Okay.
accurate.
All right, here.
And actually, if it was given,
What if you're wondering what the big deal is? So like the very first urine sample was before any of the Fentanyl. Hopefully that doesn't get me in trouble. Before any of that was administered by the hospital. And what the defense is saying is that that very first sample came back positive for that substance. And it has nothing to do with the care that she received while she was in the hospital that night. So she almost got this doctor to say something, if you caught it, about a seizure disorder, asking like, okay, she almost got the defendant to admit to something regarding that drug, and everyone got mad and objected over that, and she was unable to provide that answer. And I think no, she didn't have that disorder. She probably would have been able to give the defense the answer that they wanted.
After midnight, then this urine was taken after that. It was taken after she was given fentanyl.
But if the original urine that was notated at 10:59 p.m., that would be before, wouldn't it?
It would, but I don't think that that's accurate.
I don't know how you can dispute that. It's a system. You put it in the system.
Any other questions?
Like,
Leave those items.
and what I was saying before that is that someone is very stupid here. Or about to look very stupid.
Ladies and gentlemen, the jury will break for lunch till 1:40. You can step down.
See if he says anything. If we catch anything off the record, which we probably won't. Oh, let's look at his fit today. How's he looking? It's quite dark. We got a blue button-up. It appears to be the same red tie as yesterday.
Who is the next witness be?
I think we need to call Detective Reese based off of this morning, Your Honor, but we will only be calling him for purposes of establishing the chain of custody of the urine sample that he collected at Peterbilt.
Okay. Is Dr. O'Leary gonna testify?
I don't think that's gonna be necessary because we're gonna have other toxicologists, but I do have her available if I want to call her.
Is Dr. Krochulski gonna testify?
Yes.
And Your Honor, while we're talking about it, we will call Dr. O'Leary if they do not.
Is ex-girlfriend gonna testify?
Hey, Judge.
Okay. So if you happen to be new around here or just need a reminder of how this works, we are now on a lunch break. However, that does not mean anything for me. We are going to watch something that I think y'all would find very interesting based on what we did last week, which is we started and stopped a trial in Alaska because it was excuse me, it was really dragging, and I found this to be particularly interesting. So, here it is.
Thank you. Please be seated.
Once we come back from lunch, I'll stop this. Let's speed this up. Apparently,
My name
he
is Zarrius
admits
Hildebrand,
everything.
ZARRIUSHILDABRAND.
Good morning, Mr. Hildebrand.
I'm going to look Bubbles in the background while we're
Mr.
watching
Hildebrand.
this.
What is your birthday?
My birthday is August 5th, 2002.
How old are you today?
I'm currently 23.
And when was your 21st birthday?
My 21st birthday would have been August 5th, 2003.
Three?
Sorry, 2023.
Mr. Hildebrand, where were you born?
I was born in Elizabethtown, Kentucky.
And do you have any brothers?
Yeah,
Do you have adopted brothers or blood brothers or both?
I have both.
How old were you when you were adopted?
When I was adopted, I was 6. When I went to foster care. When I was adopted, I was 8. When I went to foster care, when I was 6.
And when you went to foster care, did you have older brother? Did you have blood
All
brothers
right.
with you?
Yes, we're attached to it.
And who was the friend that set this up?
Zach Farrar. From the point to where I initially came up here to when I cleared the barracks, yeah, I was living in the barracks.
Did Soraya live with you in the barracks?
No, we had an apartment outpost when she moved up here.
When was
Ye-
that apartment?
Okay, now we're
It
there.
would have been a late January, early February.
Soraya is his late wife, who he's literally they started off the morning in court with his attorney fighting, saying that he was not guilty, and he decided to take the stand and completely admit to everything. And it's pretty intense.
2023.
Do you recall the address of that apartment?
5210 Mockingbird Drive, and there's apartment number 13.
Sorry, so I want to talk a little bit more about some of your background information, specifically relating to alcohol. How old were you the first time that you had alcohol?
14 through 16, one of those early years.
And how would you get it?
Initially, I would, sneak a beer here and there from my parents.
All right, guys, I'm not going to make you sit through that. We need to move along.
Let me dim the lights a little.
Oh, let me do
And if you
this.
look behind you, do you see Plaintiff Exhibit 297?
Yes, ma'am.
Mr. Hildebrand, do you recognize that Plaintiff Exhibit 297?
Vaguely.
Do you recognize the people in that picture?
Yeah, he doesn't look like he remembers it.
And who's she with?
She's with me.
And where is that picture taken?
I believe that's in the smoking area of Willowa.
Do you remember taking this picture with Soraya?
Kind of. This is one of my last memories of the night. This is when the night starts getting spotty.
So have you seen pictures of yourself when you're intoxicated before?
Yes.
Can you tell, how do you look in this picture?
Well, my eyes are kind of lower. I'm smiling, I'm always smiling when I'm drunk. And then throughout the process of me drinking, my hat tends to make its way backwards. And that's how I know that I'm drunk in this picture.
And next I want to talk to you about State's Exhibit 298. If you look to the screen, do you recognize Plaintiff's Exhibit 298?
I recognize the people in the picture, yes.
Who's in that picture?
That would be me leaning on my wife's shoulder.
Oh, wow.
And do you remember this picture?
I do not.
Do you know, based on your memory, do you have any idea where this was taken?
No.
But you've seen it in the trial.
Yes.
Oof.
How would you describe yourself in this photo?
Passed out drunk.
I want to talk now about where you live. You said you lived in an apartment, Mockingbird, on Mockingbird Drive, apartment 13?
Yes, ma'am.
And you've seen in the course of this trial, have you seen Plaintiff Exhibit 17?
I have.
And And I don't know if we could get the laser. Can you show the jury with the laser pointer on the screen where your apartment was in Plaintiff Exhibit 17?
Yes, ma'am. It was right about there.
And where would you walk the dogs?
This area right here, usually from here, and then there's a park over here. We'd sometimes walk them as well.
And how many exits are there on your side of the building? From the building, can you show us?
On the whole building, or just
On your side of the building.
technically two. There's an exit right here, and then there's another exit right here as well.
And where's your apartment relative to that?
I would say my apartment's right here, and the exit's at this corner.
Thank you. I have another question that's just to clear something up. Using Plaintiff Exhibit 335, do
I have, yes.
you know who that is?
Yes.
Who's that?
That's just someone I went to, I was in the basic training and then AIT with as well.
Okay. Did you have any reason to suspect any sorts of affairs or anything like that with this person?
No, that was one of my friends.
Hi, Colleen.
And Plaintiff Exhibit 98. Do you recognize that?
Yes, ma'am.
What is that?
That'd be the block that I kept at my apartment for my friend.
Thank you. I want to talk a little bit about your apartment and where you live. And while I do that, I want so I want to talk about the apartment you live, specifically the apartment complex.
Yes, ma'am.
And your apartment building. And while we do that, would it be helpful for you when we're talking about your apartment to have a diagram of it?
Yes, ma'am.
Okay. Do you recall the layout of your apartment?
Yes, ma'am.
Judge, if I can approach with.
You wanting him to sketch out the layout?
Yes, Judge.
You have an easel?
Yes, Judge. I think.
Right.
In Exhibit 72, where would you normally keep your phone when you would go to sleep?
If you see where the bed it meets the sheet that's on the wall, right in that area.
Do you keep it charged?
Yeah, there's charges behind the sheet, and that's just where we kept them charged, and that's where they were.
Just a bit.
Yes, ma'am.
Let me see in the exhibit, the pickle.
Like,
Yes, that's it's pickle rate.
Where the,
We won it the night of my birthday.
and this is State's Exhibit 76.
That's right. That's a better picture of the tiny closet I drew here, and then looking into the hallway that leads to the bathroom, you can see the sink vanity area a little bit better.
Okay, thank you.
Yes, ma'am.
And State's Exhibit 93.
Yes, this is the hallway leading into the living room. As you can see, there's a kitchen table, a kitchen, and then there's the central couch I drew right there. You can start to see a coffee table.
And State's Exhibit 92.
It's just another picture. It's more centered towards walking into the living room.
And where's the hallway on the picture?
On the picture, sorry, this would have been the hallway. I'm making this worse, but the hallway, and then there's like another hallway right here that leads in.
On the picture, can you label the hallway as tile?
Yeah,
And then the living room is in kitchen area, was that carpet?
yes, carpet.
Yeah.
And then the kitchen was also like tiled. The kitchen was also tiled.
Okay. And is this an accurate depiction of your kitchen?
Yes, ma'am.
Exhibit number
103.
103. And you see the fridge, can you point out the fridge in the kitchen on that?
Yeah, the fridge would have been like right at the edge of the kitchen. This would have been the fridge.
We also see that there's kind of an island spread around.
Yeah, yeah.
And on the other side of the kitchen is this carpet.
Yes, ma'am.
Thank you. I'm gonna leave that there and we can come back to it later.
Yes, ma'am.
If you want to take a seat.
Are you leaving that easel up?
Would you, what would you like? Should I?
Are you needing it?
I'll take it. I'll put it down.
Thank you.
What are we doing, Lacey? And that's his defense attorney's name, Lacey Jane. I kid you not.
Darius, I want to talk a little bit, understanding the outline of your apartment a little better.
Are you kidding me?
What was the last thing you remember on your 23rd birthday?
I remember like I wanted to call it a night. I remember like leaning on my wife and probably yelling into her ear that I wanted to go home. Like let's leave, let's go.
Do you remember what time that was?
I do not.
Where were you?
We were still at Willow at that point.
Okay. Darius, where did you wake up on the morning of August 6th, 2023?
I woke up in my bed.
And is that in your apartment?
Yes, ma'am.
Okay. Do you recall where your phone was?
No.
Do you recall where Soraya was?
She was lying next to me.
Do you recall what you were wearing?
I was wearing boxers, but no.
Did you look for your phone a little bit?
I did. That was kind of the first thing I did.
How did you feel in the morning?
Hungover times 100. Still a little drunk from the night before.
How'd your head feel?
Felt like it was getting split in two.
Where did you look for your phone?
Yes, ma'am.
And it wasn't where you normally had it.
Yes, ma'am.
What did you do next?
I began looking for my phone by calling myself off of my wife's phone.
Okay. I'm gonna show you State's Exhibit 292. I can approach. Do you recognize State's Exhibit 292?
Yes, ma'am, I do.
What?
I don't know why these earphones do this.
Is that a screenshot of?
That's a screenshot of the 2 calls I placed to my phone off of Soraya's phone.
And where did you go? Did you hear your phone?
I heard it buzzing, but the ringer wasn't on.
Okay, so it was on vibrate?
Yes, ma'am.
And could you hear where it was coming from?
Sorry. I had to plug in my AirPod.
Vaguely?
Did you start looking around the apartment for it?
Yes, ma'am.
Do you recall where you found it?
Not really. It was either in the little hallway that led into our bathroom or on our kitchen table. I don't remember which one exactly.
Do you recall what you did? Did you find it?
Yes, ma'am. I eventually found the phone.
About what time was that? How long had it been from the time that you woke up and couldn't find your phone to the time that you found your phone?
5-10 minutes. It wasn't long.
Did you remember what had happened the night before?
No, like I said, last memory I had was around this picture.
What did you start doing?
Typically after I go out and either pass out or forget what happens, I go through social medias to try to like re-jog my memory. I check my bank account to see how much damage was done the night before. Just stuff like that I did because it usually helped me remember what had happened the night before.
Did you look at your phone after you found it?
Yes, ma'am.
What did you look at?
I remember checking Instagram, Snapchat, and my bank account, stuff like that.
What did you find on Snapchat?
On Snapchat, I found on Snapchat it tells you when you screenshot a chat and then when someone else screenshots a chat. And I saw that I had screenshotted chats with Cheyenne off my phone, and that's when I checked my phone and saw that the screenshots were there, and then saw that they were sent to my wife's phone and saw that they were on her phone as well.
How many phones did you have in your hand at that time?
I had one in each hand.
And I'm going to approach with what's been marked as States Exhibit 301 through States Exhibit 310. Mr. Hildebrand, do you recognize 301 through 310?
Yes, ma'am. I recognize all these.
What are those?
Pictures of me cheating with Cheyenne.
About what time of year are those?
April, end of May,
Of what year?
2023.
Is that what you saw when you looked at your phone?
Yes, ma'am.
And did you see those also on Soraya's phone?
Yes, ma'am.
What do you think when you saw those photos on Soraya's phone?
Thought in, oh crap, but in a much more vulgar way.
He was cheating on his wife?
What was going through your head?
Oh crap, how am I gonna fix this?
So what'd you do?
I went back into the bedroom and I was gonna ask my wife about it. And that's when I realized that she was no longer alive.
Were both of your phones in your hand?
I had two phones in one hand and she was like partially covered. I went to uncover her and essentially the first thing I saw was the gunshot wound to my wife's head.
Did you CPR?
I did not, just because I checked for a pulse once I saw the gunshot wound and didn't feel a pulse.
What's going on in your head at that time?
A lot. I just was confused. This is where the fear started to set in. I was hurt and I basically didn't know what I didn't know what I was going to do.
Use the word fear.
Yes, ma'am.
And hurt.
Yes, ma'am.
Why were you hurt?
I just discovered the body of my wife who I loved, and that's going to hurt anyone, regardless of it's just something that hurts.
Were you shocked?
I was confused.
And you said you felt fear.
Yes.
Had you ever felt a fear like that before?
No, never once.
What were you afraid of?
The first thing I was afraid of is having no recollection of the night before and just not knowing what happened. And then after that is when the fear of just letting everyone that I love down.
Who were you afraid of letting down?
Specifically my little brother MJ.
Why?
So I'm very proud of being adopted, and I'm very proud that I essentially got out of a life that wasn't good, and I took a lot of pride in that, and I wanted the people that I was really proud of being adopted. I was proud of my family, and MJ was probably the most who I was proudest of out of my family was my little brother, and I just didn't want to let him down.
How did you let him down?
I felt like I was his role model, like he wanted to be like me, and I feel like I immediately assumed the worst in this situation, as in what was going to happen next, and I just saw someone that my little brother, someone that I relied on, he relied on me, just never talking to me again, and just that the breakage of that such strong connection I had with him.
What would you found your wife deceased and you're afraid. Why are you afraid, Sarius?
I was afraid. Why?
Yes.
Because of what was going to happen.
What were you afraid was going to happen?
I was afraid I was going to lose my family. I was afraid that I was going to go to jail for something that I had no recollection of. There's so many unknowns, and I immediately assumed the worst and thought that I just assumed the worst.
And so you were afraid that your brother would disown you because you went to jail?
Yeah.
Were you afraid of what he would think?
What I would think?
What MJ would think?
Yeah.
Were you afraid of what the police would think?
Yes.
Were you afraid of what your mom would think?
Yeah.
Were you afraid of what Meredith would think?
Yeah.
Were you afraid that people would presume the worst?
Yeah.
what do you do in that fear?
I panic.
How long do you stand by the bed?
I don't remember.
Did you leave the bedroom at any point?
Yeah.
Did you go to the living room?
Yes, ma'am. After I left the bed, I ended up sitting on the living room couch.
And did you have the phones with you?
Yes, ma'am.
Are you still panicked?
Yes.
Afraid?
Yes, ma'am.
What do you do with the phones?
At that point, I'm not sure which happened first. I deleted the screenshots off both phones, and then I texted her boss from her phone.
Why did you delete the pictures?
It's shameful and embarrassing, and it just seemed like the appropriate thing to do.
Were you afraid of what people would see if they saw them? Think if they saw them?
Yes, ma'am.
I'm going to approach with what's been marked as plaintiff's exhibit 18. Sorry, do you recall what is marked plaintiff's exhibit 18?
Yes, ma'am.
What time, what do you recall about that?
Sending essentially a call out text.
Did you send the last message in state's exhibit?
Yes, ma'am. I sent the message timestamped at 10:44.
What does it say?
It says, "Hey, this is Soraya. I can't make it into work today. I went to Jimmy's last night. I'm pretty sure I got food poisoning from it. So I'm sorry. I would have called Craig, but I do not have his number saved. Sorry."
When you sent that?
Yes, ma'am.
Where were you sitting when you sent that?
I was sitting on the couch.
What are you thinking when you sent that?
Shame, dishonesty, guilt.
What are you guilty of when you're sending that?
Guilty of lying to her boss.
Did you have any idea what to do in that moment besides stall?
No, at this point I was stalling was the only thing I could think to do.
And you said that at 10:44.
Yes, ma'am.
How long have you been awake at this point?
2 hours.
And how many of those of those 2 hours, how long have you known that your wife was deceased?
Hour and a half.
Yeah, he definitely has some social anxiety. He might be autistic. I don't know.
Medics?
No.
Why don't you do those things?
Goes back to the initial fear of what was going to happen.
Were you afraid of being accused?
Yes.
I intend to go a little longer. I don't know if we need a break. This could be the breaking point.
All right, this might be a good breaking point. Is that what you're saying? Okay, we'll anticipate this is going to go for a while. So let's take a break here, please. Not discuss the case yet. I'll be back here in about 15 minutes. Right?
All right.
So just before our break, you were talking about the text message that you sent. What
That
time
was
did you send that message?
Sent the text message at 10:44 on Sunday.
On Sunday, August 6th?
Yes, ma'am.
And to kind of recap, what's going on through your mind when you're sending this message?
I said previously, just a lot of deception and shame, guilt, dishonesty.
Do you recall what you did after you sent that message?
And then up into the entrance of the park.
And we have State's Exhibit 46. Can you mark your apartment on State's Exhibit 46?
All right. I'm going to keep this going for now, but they cut out.
And do you recognize, do you know the path that you would have walked on this exhibit?
What he said.
the park line, but
Really, have you been there before?
yes, ma'am.
Earlier that day?
Yes, ma'am.
And Jed, I will mark you the different exhibit D and different exhibit E.
Right. Thank you.
Move that.
Any objections? Very good.
Sorry, what time of day are you taking this walk?
It was dark out,
Dark.
beginning to get dark out.
What are you thinking while you're walking this path, going out the back door to avoid the cameras, walking a path into the park, and you have your wife with you? What is going through your head, Sarah?
The feelings of shame and anger are building up more and more. Feeling of disrespect is building more, and just feeling so awful about myself for what was going on.
Did you feel like you were in a bad dream?
Yeah, yeah.
Did you wish someone could help you?
I still felt like there was no one to help me.
Did you wish you could make it stop?
I just wish it was, I don't want to say over, but I think wish I could make it stop is a better way to put it.
Sorry, so I'm gonna approach you now with say exhibit 49 and 230.
I'm like,
Do you recognize exhibit 49 and 230?
Yes, ma'am, I do.
do I find
On
myself?
exhibit 49, what is that?
That's the access road that led to the cistern or drainage pipe.
Is that the road you walked on?
No, ma'am.
It was different.
Yes, ma'am.
And what is state's exhibit 230?
State's exhibit 230 is the cistern.
Do you recognize that place?
Yes, ma'am.
Do you remember going to that place?
Yes, ma'am.
Do you remember how times you've been to that place?
Yes, ma'am.
This must be the manhole.
2 that day.
On August 6th?
Yes, ma'am.
Do you remember what you did there?
Yes, ma'am.
What did you do there?
I remember lifting off the cover of the storm drain. And then putting my wife's body down the storm drain.
What are your thoughts when you're doing this, Darius?
More disrespect, more self-hatred. I remember I just felt so hollow and empty and just disgusted and just hating what I was doing and hating myself for doing it.
Did you do anything else there, Darius?
I put the manhole cover back on and then I just left.
Did you put pillows down?
Oh, yes, ma'am. Sorry. In the trash can, there was soiled bedding, had blood and stuff like that on it. And I put those down the cistern as well.
And when you went there, you had a plan. Do you remember what else was in your plan?
Yes, ma'am. I brought along a gas tank I was going to burn the bedding, but I decided not to. I just decided to put everything
In the storm drain?
And then what did you do next?
So after I put everything down the cistern, I put the manhole cover back on, dropped the trash can off a little further into the woods, and at that point it was pretty early in the morning. I showered after returning to my apartment and went to work the next day. This is the 6th leading into the 7th.
Did you sleep that night?
No. I
And how did it feel going to work knowing everything that you had done?
I was so overwhelmed that I don't remember anything from work that day. I just remember feeling just so alone and like by myself.
I want to take you back a little bit to earlier in August 6th when you were cleaning the bedroom. Did you clean the mattress?
Yes, ma'am.
And what did you do when you were done?
Cleaning the mattress?
Yeah.
At this point, I started drinking, started getting drunk.
I'm going to approach with State's Exhibit 166.
I mean, I didn't want to see alcohol for a week
It's a picture of
after my
it's a
21st.
picture of our mattress.
What direction is it?
It's facing upside down.
Did you turn the mattress over?
I did.
When did you do that?
I did that after I cleaned everything up.
After you went to work on August 7th, what's the next thing you remember?
I remember calling Marie and telling her what had happened.
I thought he said I
Did you
was
call Marie or
hungry.
did Marie call you?
I think I asked. I think I used Soraya's phone to call Marie, but
Why would you do that?
I didn't have Marie's information.
And let's talk about some of the decisions and things you did on August 7th. Did you talk to Marie?
Yes, ma'am.
Did you tell Marie the truth?
I did not.
Why?
Because at this point, I wanted to follow what I was already committed to.
And were you scared at this point?
Fear is something that is a constant during this whole experience. So yes.
Do you recall if you called a missing person report?
I didn't.
Were you with someone else when they did?
I was.
And did you participate in the phone call?
I did.
Okay. And then do you recall if you spoke to a police officer and provided a missing person report?
I did.
And you didn't ask for help with that?
No, ma'am.
You lied.
I did.
Do you remember if you ever called Soraya's mom?
Yes, ma'am. After we made the missing persons report is when I decided to call Soraya's mom.
How did that phone call feel?
It once again it felt disrespectful.
Why?
Because I knew that her mom was going to fly halfway across the country to help with a missing persons case that I knew wasn't missing.
But you made the call anyway.
I did.
And you didn't tell the truth in that call.
I did not.
Did you call hospitals?
Eventually.
Did you call jails?
Yes, ma'am.
Did you call anywhere else?
No, ma'am.
And how did it feel making those phone calls, Darius?
Just the same feelings, that more dishonesty, more disrespect, more shame.
What shame?
Yeah.
Did you participate in a search party?
I did.
How did that feel?
It felt incredibly dishonest and disrespectful. Essentially my family away from my family, and then everyone
That
else
about describes it.
involved in my battery showed up, and it just felt just incredibly dishonest. Like, people I consider family were there helping a search party. Someone that a lot of people that normally aren't emotional, were showing me support. They were just showing me a lot of love for what was going on.
Did you feel like you were betraying people?
Yeah, I felt like I was betraying my gun section, my sergeants, my just everyone.
But you participated in it.
I did.
Do you remember when you spoke with Detective Clark and let him in your apartment?
Vaguely.
Did you tell Detective Clark the truth when you were speaking with him at your apartment?
I did not.
Why not?
For one, I felt like I still had to stick to what I was committed to, and then two, he's a detective, so I just didn't feel like telling him the truth.
Did you feel that if you told Detective Clark the truth,
Sustain.
were you afraid of being a suspect?
Yes,
Is that why you were honest with Detective Clark?
it is.
And you talked to multiple police.
Yes, ma'am.
When you were speaking with them, were you afraid that you'd be viewed as a suspect?
Yes, ma'am.
And is that why you were not truthful with them?
Yes, ma'am.
Do you recall going on your social media during this time?
Yes, ma'am.
Did you post anything about Soraya?
Yes, ma'am. I made a Facebook post of a flyer that either her family made or that I made. I don't remember which one, but I remember essentially just posting it on my Facebook and telling everyone to repost it and share it.
How did that feel?
Misleading, disrespectful. I felt like I was essentially leading the whole world on to something that wasn't the truth.
I want to talk about State's Exhibit 132 and 133. Can I approach?
Yes.
Do you recognize State's Exhibit 132 and 133?
Yes, ma'am.
What are they?
Marie is her friend.
Suicide note.
It's a suicide note.
Yeah.
Did you write that?
I did.
Do you recall when you wrote that?
I want to say it was on the 8th, but I don't remember.
What thoughts were going through your head when you wrote that?
I felt alone. I felt like I just felt really alone, and I just had nowhere else to go. I fell back into a corner.
Did you is every fact in that note true, Zarius?
I'm not sure there's any facts in this note.
Did you talk about Soraya in that letter?
I did.
Is there a reason why where she is not included in that note?
Yeah. Part of me was in denial. I thought that even if I knew where she was, but I just thought that maybe I just felt a lot in denial.
Do you remember where you were when you wrote that note?
Yeah, I was sitting on my couch.
I'm gonna say what's been in this State's Exhibit 136.
Spends a lot of time on his couch.
Do you recognize State's Exhibit 136?
Yes, ma'am.
Is that the couch you were sitting on when you wrote that note?
Yes, ma'am.
What's in the couch?
It's a gun.
Was that gun next to you when you wrote that suicide note?
Yes, ma'am.
But you didn't go through with that. Why not?
And I didn't want to kill myself in my apartment.
Did you have a plan about what you would do with your dogs?
Yeah,
What was your plan?
I'll drop them off at a vet clinic.
Do you recall everything that you did between the time that you woke up and found your wife deceased in your bed and the time she was found where you left her?
I do not.
I want to talk to you about some of the things we've heard in this trial about what you were doing on your phone.
Yes, ma'am.
Were you at any point in this time looking at pornography on your phone?
Yes, ma'am.
Why were you doing that?
I was attempting to find comfort in things that previously provided it for me.
And is pornography something that you had found comfort in the past?
Yes, ma'am.
Is alcohol something you found comfort in the past?
Yes, ma'am.
Were you drinking in this time period?
Yes, ma'am.
Why were you drinking?
I just did not want to be sober.
Was the drinking in this time period to you the same as the drinking that you did on your 21st birthday?
No.
How is it different?
The drinking I did to celebrate my 21st birthday was celebratory. And this drinking was more to
Numbing.
drown.
Sorry, where was Soraya's wedding ring on when you found her in the morning?
It was not.
Where was it?
She took all of her rings off before she went to bed. They were found. They would have been in our bathroom, the main bathroom with the toilet and the sink and the bathtub in it.
Did you move it or?
Yes.
Why'd you do that?
I didn't feel like I deserved it. I didn't feel like I deserved to have the ring in my possession.
So why'd you take it?
Initially, I was gonna give it to her mom, but I didn't have a chance. I just put both rings in my pocket, and that's where they're at.
Sorry, is this all the questions I have for you now? I believe the state will have some questions for you as well.
All right. This cut out all the break, so you guys are in good hands. I need to honestly, my face just feels gross. I need to go put on some moisturizer. And maybe if it's not raining, let you know what's
Thank you. Good afternoon, Mr.
you
Hilton.
know where.
I want to start by talking about Soraya. You referred to her as your wife regularly. Do you mind if I call her by her name?
Yeah.
Soraya enjoyed being in the guard.
I'd say she was indifferent to it.
Okay. She liked her job at Bread and Brew.
Indifferent to it. She liked some days, didn't like some days.
She had close friends.
Yeah.
Okay. Marie was one of them.
Yes, ma'am.
She had friends that were close at work.
Yes, ma'am.
Okay. Her and Marie went out together regularly.
Yes, ma'am.
They went to the gym together.
Yes, ma'am.
They talked every day.
Yes, ma'am.
They went paddleboarding, kayaking, had bonfires.
Yes, ma'am.
Okay. Soraya was planning for her future.
Starting to.
Yeah. She'd enrolled in school.
Yes, ma'am.
She wanted to be a combat medic.
I don't think she wanted to be a combat medic, but it was a stepping stone towards what she wanted to do.
Which was what?
An anesthesiologist,
Okay. Big dreams.
essentially.
She was generally a happy person.
Yes, ma'am.
Okay. She was close with her mom.
Yes, ma'am.
Talked to her daily or every other day.
Yes, ma'am.
Her family had a trip that was planned to come up and visit in just a couple of weeks.
Yes, ma'am.
She was excited about that.
She was.
She was planning for things to do with them.
Yes.
And on the night of your birthday and her death, your relationship was okay.
It's good.
Good. She got decorations for your birthday party.
Mhm.
She made you a cake out of beer.
Yeah.
Okay. You were angry with her about that?
No, I wasn't angry. I was upset. I
So she did something nice for you and you were upset about it.
think you're taking it out of context. I think I already told her that I didn't want a big deal. and she made a bigger deal than I wanted it to be.
Okay. So you were upset that she got you some decorations?
Yes.
Okay. But y'all worked through that?
Yes, ma'am.
And you went out and you were happy
Yes,
that
ma'am.
night? Okay. To put the relationship in context, you were newlyweds?
We were married for 8 months, so
Less than a year?
yes, ma'am.
Okay. And you didn't live together before you were married?
No, ma'am.
Okay. And you met at basic training?
Yes, ma'am.
And you lived separately after basic training?
Yes, ma'am.
Long distance relationship?
Yes, ma'am.
And the first time you lived together was when she moved up in February?
Yes, ma'am.
Okay. And you were already engaged in this online relationship with Charlotte by February?
I don't know.
Well, you talked about it starting when you went to the field in February or March?
Yes, ma'am.
Okay.
Charlotte.
Or I'm sorry, Cheyenne. Cheyenne, you were already engaged in this relationship when you went to the field in February?
Yes, ma'am.
After your brand new bride had just moved with you?
Yes, ma'am.
Okay. And you continued that through March and April?
Yes, ma'am.
And Soraya found out about it?
She did.
And she forgave you?
Yes.
You gave each other your passwords to your phone?
I already had those. She already had those before this, but yeah,
Okay. But you didn't stop talking to Cheyenne?
I did not.
Okay. But she didn't bring it up again until the evening of your birthday?
I don't know.
Did she bring it up prior to the evening of your birthday?
No, ma'am.
Okay. So as far as you're concerned, everything in your relationship with Soraya was good?
Yes, ma'am.
Okay. I want to talk about the guns in question. The Sig Sauer belonged to you?
Yes.
Okay. And had you gotten that gun recently?
Had it 3 or 4 months previously.
Okay. You were searching the features of that gun before you went out that day, right?
Yes, ma'am.
Okay. You spent some time online about 3:50 in the afternoon looking at that gun?
Yes, ma'am.
Okay. You were looking at other guns that day too?
I was.
Springfield XDs?
Yes, ma'am.
You were looking at different armories?
I was.
Okay. And then the Glock was a gun you were holding for who?
Just someone I was in the army with.
You don't know their name?
Not anymore.
Okay. Neither of those guns belong to Soraya?
No.
Okay. You both went through basic training?
Yes, ma'am.
So you have some familiarity with guns?
With rifles.
Primarily in basic, you deal with rifles, right?
Yes, ma'am.
But you said Soraya had shot the Sig Sauer?
Shot a similar Sig Sauer in the National Guard.
Okay. So she had familiarity with handguns?
Yes, ma'am.
Okay. As did you?
Yes.
Okay. And did you have specialized training with handguns?
I did not.
Did she?
I don't know what you consider specialized training, but I never qualified with a handgun and she did.
She did?
Yes.
Okay. So I want to talk to you a little bit about some of your testimony. You were asked probably no fewer than 15 times the emotions you were feeling after you found your wife dead and dumped her body. You described deception, right?
Yes, ma'am.
You described guilt.
Yes, ma'am.
You described disgust.
Yes, ma'am.
You described shame.
Yes, ma'am.
You described anger at yourself.
Yes, ma'am.
You described betrayal.
Yes, ma'am.
You described fear,
Yes, ma'am.
substantial fear.
Yes, ma'am.
You described stress.
Yes, ma'am.
You described exhaustion.
Yes, ma'am.
In all of the times you were asked, you never once said grief, did you?
I did not, but I did say loss.
You never said sadness, did you?
Emptiness.
Okay. You testified that you went through this elaborate lie of your wife being missing and telling everybody that she was missing because otherwise people would assume the worst.
Yes, ma'am.
What's the worst?
The situation I'm in now,
What is the worst?
going to jail.
They would assume that you murdered your wife.
Yes.
Okay. And you have testified that after you were at Willowa, essentially, you have no memory of the evening.
Yes.
Okay. That gun's a loud gun to shoot?
Say again?
That gun is a loud gun to shoot?
Relatively to a normal person, yes.
What do you mean to a normal person?
To someone who didn't shoot artillery, say the sound of a 9mm is loud, but
And you went to bed next to your wife.
I can't tell you for sure because I don't remember.
Okay. And you have no idea what happened until the next morning,
Yes, ma'am.
despite the neighbor more than 80 feet away hearing that weapon. Okay. How do you know, sir, that she didn't confront you with those Instagram and Snapchat messages, and you didn't put the gun to her head and tell her you were going to kill her? How do you know that you didn't pull the trigger?
I don't.
Okay. You don't know.
No, ma'am.
You want the jury to believe that she did this to herself?
Objection.
Overruled. It's not up to me what the jury believes.
Okay. Despite the fact that she was otherwise happy in your marriage. Yes.
Yes.
And planning for her future.
Yes.
And your future.
Yeah.
And tried to have a good evening with you on your birthday.
Mhm.
And had forgiven you for text message infidelity in the past. Right?
Yeah.
Okay. So you don't know that you didn't kill her.
Can you restate that question?
You don't know that you didn't kill her.
I'm not sure I answer that. There's a lot of do's and don'ts. It's just a complicated.
Do you know if you pulled the trigger, sir?
I do not.
That night, Soraya wasn't drunk.
I don't remember much from that night.
Would you agree that up until the part you can remember, she was the least drunk of your group?
Her or someone else I was with us, yeah.
Who's someone else? Let's be specific.
One of my friends, Zach,
Okay. So her, Zach were the most sober.
Yes, ma'am.
Okay. And was Soraya taking care of you?
from what I've been told, yeah.
Okay. Do you recall her helping you to the gaslight?
I do not.
Do you recall her helping you into the Uber
I do not.
and into the house?
I do not.
Okay. You kept that gun loaded?
Yes, ma'am.
With a bullet in the chamber?
I did.
What do you have to do to fire it?
Take the safety off and pull the trigger.
How do you take the safety off
Thumb switch.
and pull the trigger?
Yes, ma'am.
Once. So I want to get to, because you don't remember anything about her death, I want to get to the morning when you wake up.
Okay.
You were soaked in blood?
I was not.
Okay. You've seen the photographs of the mattress?
I have.
And you were laying in bed with her?
Yes, ma'am.
Okay. You didn't call 911?
Correct.
You didn't take life-saving measures?
No, I did not.
Okay. You didn't run outside and ask for help?
No.
You didn't call her mom?
Not.
You didn't call her best friend?
No.
You didn't call her command?
No.
You started planning how to protect yourself?
I wouldn't phrase it that way, but
You started planning how to dispose of her body?
I started planning on what I was going to do next.
And the first thing you did is you went to the Alaska Bush Company homepage, right?
I don't remember doing that, but
Were you looking for a potential other alibi or excuse, some other thing you could blame her death on?
I can't tell you what was going through my mind because I don't really remember looking that up.
You mapped to the Castle Mega Store
Mhm.
before you texted her into work?
Yes, ma'am.
Why'd you do that?
Can't tell you because I don't remember.
Again, were you planning some other potential excuse for what had happened for her?
At that point, I hadn't had a plan together.
But you started getting the plan together when you texted her work.
Yes, ma'am.
And you texted Nadia Jones, her immediate manager.
Yes, ma'am.
And you told her that she had food poisoning. You texted her as Soraya.
Yes, ma'am.
And you told her that she had food poisoning.
I did.
And that she wouldn't be into work today.
Yes, ma'am.
And she told you to call Craig or message Craig.
Believe so.
And you didn't know that Soraya had Craig's number saved in her phone under a different name.
Did not.
Okay, so you didn't call or text Craig. Right? Okay. What was the first thing you did to clean up her body?
Clean the surrounding areas.
Was that in the floor?
Clean the surrounding areas in the bedroom, the floor.
When did you discover the gun?
That would have been after I saw that my wife was dead with a gunshot wound.
You didn't say on direct examination, where was it? Do you remember?
I do not.
Okay, so you can't even tell the jury that it was near her?
Cannot.
Was it in the bathroom?
I don't know.
Was it on the floor?
I don't know.
Was it on the dining room table?
I don't know.
You remember finding her deceased, but don't remember where you found the gun?
Yes.
Okay. Did you clean the gun?
I don't know.
Well, would you have done it right away that morning?
I said I don't know. So
So the first thing you did was clean the surrounding areas. That means the floor.
it wasn't the first thing I did, but when I started cleaning up around the surrounding areas was the first place I cleaned.
You moved her body at least twice on the bed, right?
Twice, yes, ma'am.
But you did the floors first. What did you use to do the floors?
A carpet cleaner.
Okay. And was this before or after you went to Fred Meyer's?
During, because I took multiple trips.
After the first time?
In between the second and third time, I believe.
Okay, so after you'd been to Brown Jug?
Yes.
So after you've been to Brown Jug, you don't start cleaning until then?
Yes.
Okay. But you deleted the photos on her phone before you went to Fred Meyer's at all?
Yes, ma'am.
Okay, you deleted the photos on her phone at 11:30?
Yes, ma'am.
Okay. And why did you delete those?
They're embarrassing
Is it because they show motive?
because they're embarrassing.
Okay. Could they also be a reason that somebody would suspect you of her murder?
I don't know.
That's not what you were thinking?
I was thinking these are embarrassing pictures. I wasn't thinking that.
And that's the thought you had before you even started cleaning up the body?
That's the thought I had after. It's the thought I had after I found her body.
You thought these photos are embarrassing. And they're also something somebody could look at and would say was a motive to kill her. Right?
I don't.
I'm sorry. Oh, really?
I don't see it as a motive.
Well, you testified that, you had to get rid of the body and you couldn't tell anybody because people would assume the worst. And the worst is what you said that you might be in trouble for this.
Yes.
Okay. So you delete the photos at 11:30. You go to Fred Meyer's at 12:26. right?
Right.
You go to Brown Jug.
Right.
You text your dad. And we didn't talk, Miss Brewster talked about, the photo of the alcohol, but you told your dad that maybe you had a little too much fun.
Yeah.
We asked a lot about what's going through your mind. What's going through your mind when you tell your dad that maybe you had a little too much fun last night?
I just drank way too much.
Okay. Your parents have always been loving and supportive.
Yeah.
You're proud of being adopted.
Yes.
Proud of.
Okay. Hi, everyone. We are coming up at the end of the lunch hour for our jurors in Nashville, Tennessee. In Nashville, Tennessee, for the Blaise Taylor trial. It is day 4, and he is on trial accused of unaliving his pregnant girlfriend with a lethal overdose of the drink that I'm sure you can surmise what I'm referring to when I show you this soda. I have to be careful with YouTube not liking certain words, so I appreciate you guys tolerating the little kid talk. All right, so if you could do me a favor, if you haven't done so already, please make sure to double tap your screen if you are on your phone. If you are on your computer, please hit that thumbs up button. And if you could, if you're watching on replay, which I don't think you are, but if you are, please hype this video. That also helps. We're trying to get my algorithm back to where it was before I had to have surgery. So it's very much appreciated. Lastly, there is a online, it's like a fundraiser event that I am speaking at for tonight. I don't know what to say. I will provide you guys with some information in the comments, in the chat. Oh, that's what I forgot to say. I was going to ask if you guys could please say hi in the chat. It helps so much. It helps so much. But getting back to the fundraiser, it is for Edric Faust, and that trial happened in February. I covered the first week of it, and then it was kind of like the Alaska trial. It just didn't, my viewers weren't as interested in that as they were in a case that had happened recently, because Edric was found guilty. I hate saying that. He was found guilty for unaliving a woman. There was so much wrong with that trial. It is absolutely infuriating. If you want to look at a criminal trial where the evidence is just all over the place, everyone in town is touching it, it's lost, then it's found, it would be this case. And we were all so confident he was going to walk, because the evidence wasn't there. The evidence pointed towards this girl's boyfriend. And they found him guilty. And so there's appeals being made, and this is one that I feel very strongly about. I feel very, very, very strongly about it after seeing what I saw. So I will share that in the chat, 7 p.m. tonight. Would love to have you stop by. Okay, how am I feeling today? Out of breath. Out of breath. Uh, I I didn't sleep more than 2 hours last night. So I'm struggling, but I appreciate you asking me. I hope that you are feeling well too. Vicky is watching from Tennessee. Well, welcome, Miss Vicky. Please make sure to like the video and subscribe to the channel. Thank you for commenting. I really mean that. I appreciate it. Okay. Stephanie says, I have had several open heart surgeries, and I think everyone deserves health care. Pardon me. I think everyone deserves health care as well. I don't think that universal health care is the answer, but I think that everyone deserves health care. And I hope that you are doing better. Do you have to have more surgeries performed? If so, I will definitely keep you in my prayers. Thank you, Vicky. I so greatly appreciate that. Oh, here we go. Let me switch this over. Oops.
And just so the court's aware, the state.
Hang on, do we need Ms. Oliver?
Yeah, I'm sorry,
she had to step out for every.
I was having really bad symptoms last night that have to do with my surgery. And I couldn't enjoy that soccer game. Did you guys watch it? It's unfortunate we lost. By we, I mean America. Sorry. I know there are people from other countries in here watching. Do you guys hear Pearl snoring? She's so loud. She has such main character syndrome. What are we doing? Oh, and we know that he has come back from lunch. If you are just now joining us for the first time, this man, I can say without an inkling of doubt, I know it with all of my heart. This man is the meanest man I've ever seen after lunchtime. I don't know if he goes home and gets physically beat up. I don't know if he goes online and reads mean jokes about himself.
The state is going to call Dr. Kotulski, Ms. Hollins crossed Dr. Carney on his 2023 urine at 22:59. She says was incorrect and the time change is wrong. CFSRE never tested that urine that was later changed, and the state has a duty to correct the misrepresentation of the evidence and what the CFSRE reports show.
Sorry, let Dr. Toski.
Wait. What?
You let the jury step in.
I'm going to wait for him to tell the jurors. I like
I like his fit again. I'd give it a 9 out of 10. I liked yesterday's better with the white button down.
I bet he was a really cute baby. Bibby. Bubbles asked what mood they're in. Prosecution just said something about the urine being tested and how they were wrong, and they want to make sure it's correct. What?
Yes, I do.
Why didn't he address it? During the next break, we'll go back and we'll see exactly what he said. He said. It was difficult to hear.
Dr. Kurtulski, could you please state and spell your name for the record, please?
Yes, my name is Alex, A-L-E-X, Kurtulski, K-R-O-T-U-L-S-K-I.
What are you doing
What is
with
your
your
profession?
blonde hair?
I am a forensic toxicologist.
How long have you been a forensic toxicologist?
I've been a forensic toxicologist for about 11 years, and I've worked at the laboratory where I work now for all those 11 years.
Okay, where do you work?
I work at a nonprofit forensic laboratory called the Center for Forensic Science Research and Education.
And what connection does that have to NMS Labs?
Yeah, so we are a nonprofit forensic laboratory. NMS Labs is a for-profit forensic laboratory. The two of our forensic labs are actually in the same building. NMS is in the front half of the building. We're in the back half of the building. We do have some connections through the family and through the forensic toxicologists that founded NMS Labs, but we are two unique laboratories and two unique organizations.
And what is your title with CFSRE?
My current title is Director of Forensic Toxicology and Chemistry.
Okay, how long have you held that title?
I held that title as director for about 3 years, and prior to that had a title of Associate Director for also about 3 years.
And can you describe your job to the jury at CFSRE, please?
Yes, so I am a manager and a supervisor. I oversee a team of about 10 people, including 5 full-time forensic toxicologists. So as a research and educational facility, I do perform research in forensic toxicology and forensic science. I also teach and educate as part of our graduate programs that we have with universities in Pennsylvania. And then pertinent to this case, we also run forensic cases. So we bring in under chain of custody forensic evidence, process that through the tests and the methods that we have in our laboratory, and report out those results through forensic reports.
And what type of education do you have? Can you tell us a little bit about your background?
Yes. So my latest degree is a doctorate of philosophy in chemistry, which I did my dissertation related to forensic toxicology. I also have a master's degree in forensic science. And I also have a bachelor's degree in chemistry as well.
The bleach blonde hair.
So the document you just passed me is my CV, or my curriculum vitae.
Okay. Are you required to have ongoing training?
Yes, as part of really the field of forensic science as a whole, forensic scientists continue their professional education, whether that be through courses that we take, through conferences that we attend every year, through a variety of other means like reading journal articles and whatnot.
And have you ever testified as an expert in toxicology?
I have, yes.
Okay, about how many times?
Once before.
Your Honor, at this time, I could make Dr. Kurtulski's CD the state sex exhibit 33.
Okay.
And tender him as an expert in toxicology.
No objection.
Okay. All right, again, ladies and gentlemen, Dr. Kurtulski will be allowed to give his opinion as an expert.
Bubbles brought up a really good point in the chat. They didn't just bring anyone from this nonprofit. They brought in the director.
Dr. Kurtulski, did you get involved in a case involving a patient, Jade Benning?
Yes.
Okay. Do you recall about when you became involved with Jade Benning's cases?
Yes, that was in March of 2023.
Okay, and how did you become involved?
At that time, so our laboratory takes in cases generally for different unique scenarios. We do testing for a variety of different drugs and toxins in the field of forensic toxicology. So generally, the way we get involved in cases is that there are biological specimens, whether that be blood, urine, whatever it may be, that need advanced toxicology testing. So with our relationship with NMS Labs had contacted us about samples that they had that they were interested in getting additional testing performed on, and that's how our laboratory got involved.
Okay. Did you also talk to Vanderbilt doctors?
Yes, I talked to Dr. Blaire as well at Vanderbilt.
You're so welcome, Vicki. Thanks for coming here.
In regards to Miss Benning's urine?
Yes.
Did I just talk over the urine again?
Dr. Kutulski, what did I just hand you?
You handed me two different reports. One report for a urine sample that we tested and one report for a blood sample that we tested.
Oh, I'm sorry.
That's just stupid. They have to send it to a place in Pennsylvania when if Vanderbilt doesn't have it.
What is
the capability?
The case number for the urine is 2023-0092.
What?
The case for the blood is 2023-0089. Sorry.
And these are pretty thick. Can you
Okay.
explain to the jury what is with the report?
Yes. So this second report that I was handed is for a second urine specimen that we tested 2023-0090. These are the reports. The first 2 pages, or 1 page, is the report that we issue after our testing. That report consolidates all the information about who submitted the sample to us, what samples we received, what our results were, what testing we performed, as well as some reference comments as to the substances we identified. And then the rest of the page is the rest of the packet for the case. There are a few pages that include the chain of custody, as well as the sample preparation documents that we use to prepare the samples in the laboratory for analysis. And then the bulk rest of the pages are the data associated with the identifications for the drugs that we made.
And are both those samples involving Miss Jade Benning, or both those reports?
Yes.
Okay. And do you commonly refer to them as litigation packets?
Yes, yes.
Your Honor, at this time, I would like to mark those 2 reports as the state's next exhibit 34 and 35, please.
No objection.
Okay. Which you want to delineate?
34
Weird,
that
learning
be
that.
0092 and 35 be 0090. They're
Different
the
date.
report numbers. No, sir.
Okay.
Your Honor, if I could publish it for the witness, we have it on that PowerPoint.
Okay.
Dr. Kutulski, can you walk the jury through this first page and what we're looking at, and what kind of identifying information is on this page?
Yes. At the top, you can see that this is the toxicology report that we issued. That's the logo for our laboratory, as well as the date that we issued it. So it was issued in July 18th. Sorry, yes, July 18th, 2023. This report was issued to Dr. Rebecca Bruccoleri at Vanderbilt University Medical Center. On the top right there are the different case numbers associated with the case. So every agency is going to assign generally their own case number to a case. So our laboratory assigned our case number, the CFSRE case number, but then there were additional case numbers, including the NMS case number, as well as the agency's case number that we include as well. Next down under items received is the item that we received for that case number. In this case, under the description, you can see that it was 1 vial containing urine. The next section is the results and conclusions. So these are the substances that we have identified. In this case, the analytes, benzylecgonine, norcocaine, and cocaine. Under concentration, our laboratory does at times perform quantitative testing, so there would be values for the quantitative analysis there. However, this testing that we performed was just qualitative, so it just says positive, meaning that the substance was identified and was positively present in the sample. Under methods of analysis is the instrumentation that we used for testing. Under reference comments are generally short blurbs about the substances that we've identified. So if anyone's reading the report and they see the term benzylecgonine and they don't know what that is, they can correlate that under reference comments. And I'm so sorry, I did not mean to. Next is laboratory comments. That just says that we took the sample into our possession under chain of custody, seals and everything were in order, and also notes that when we discard the specimens. And then finally at the bottom is again the case number, the date that we're signing this, my signature, as well as another toxicologist signature at our laboratory.
And Dr. Kucholski, you've already talked about how you were in communications with Vanderbilt. From your knowledge, when was this first sample taken?
So in my communications with Dr. Brucolari, it's my understanding that this was the first urine specimen collected when the individual presented to the hospital.
And if medical records had previously been introduced and that first urine was at 2259 on 2/25/2023, would that be correct?
Yes, that's consistent with my understanding.
Can you walk the jury through your findings for this first urine of Ms. Benning?
Yes. So I will go in reverse order because it will make, I think, a little bit more sense. The bottom substance there is cocaine. So cocaine is a stimulant drug. We identified parent cocaine within this urine sample, as well as more cocaine and benzylecgonine. Those two are metabolites of cocaine.
Okay. And did this specific test for EME?
No, our testing does not include ecumene methyl ester, which is another metabolite of cocaine.
And can you walk the jury through how many drugs and what kind of testing this specific urine was tested against?
Yes, I don't recall the exact number. Our laboratory is constantly adding drugs to our method of detection. Currently, we test for more than 1,300 substances. This time in 2023, our scope was probably around 1,100 substances. And if the substance is not listed on this report, it means it was not identified through the testing process.
I have a great gaydar.
So we can say out of at least 1,100 drugs, the only one that was tested positive was cocaine.
And it's metabolites, correct.
And what, if any, what is your threshold for cocaine and the metabolites for a urine sample?
Yeah, our cocaine threshold is about 20 nanograms per milliliter. Sorry, I don't believe I said that correctly. Our threshold for cocaine in urine is about 20 nanograms per milliliter. That would be the same for its metabolite nor cocaine. However, benzylecgonine has some different chemical properties, and our testing limit for that is about 100 nanograms per milliliter.
And from your discussions with Dr. Brucolari, what were you advised that Vanderbilt's threshold was?
Yeah, so it's my understanding that in the hospital, as many hospitals do, they perform a urine drug screen. That's done by a different type of test than we perform. That's done by something called immunoassay, whereas our testing is performed by mass spectrometry. Through my conversations with Dr. Brucolari, it was my understanding that the cutoff for benzylecgonine in the hospital was 300 nanograms per milliliter. And again, our cutoff was 100 nanograms per milliliter.
So is it consistent that if Ms. Benning's blood or urine tested in the hospital negative, but then was positive with you, is that consistent with just the different thresholds and Vanderbilt being much higher?
Yeah, so when you have differences in thresholds, you can have concentrations that are between those thresholds. So one laboratory may report it negative because it's below their threshold, and another laboratory may report it positive because it's above their threshold. Both of our tests were not quantitative, though, so we don't know exactly how much benzylecgonine was in this sample. However, based on the data that we have from our test, we can see, based on some of the characteristics of the data that we look at, that it's my opinion that it looks like the amount of benzylecgonine likely was between our two thresholds, and that's why our result was positive and their result was negative.
Where's the hype girl from earlier this morning? Remember her?
Before I move on, can you walk the jury through what typical effects of cocaine are and then what the severe effects of cocaine are?
Sure. So cocaine is a stimulant drug. So it does a lot of things to stimulate your body. Certainly people use cocaine for its euphoria and its high feeling. But when you get to some of the sort of clinical signs and symptoms, it can do things like increase your heart rate, increase your blood pressure, increase your temperature. It can make people more talkative, more movement. It can
I don't need
in
that.
higher amounts, or for some people, it can cause sort of agitation and
I don't need
anxiety.
any of these
And in more
things.
severe cases, especially with the effects on the heart, you can have sort of detrimental cardiac effects because of that increased cardiac output. Cocaine has been associated with seizures as well as other more bad side effects, if you will, of cocaine.
Oh, that was totally natural that he just threw seizures in there after what we just went through.
Cocaine at either chronic use or at higher amounts.
And can you tell the jury what the common forms of someone taking cocaine would be?
Yeah, so in the United States, cocaine is primarily found in two forms, cocaine salt and cocaine base. So the basic form of cocaine is known as crack or crack rocks. Crack rocks are generally smoked. The salt form of cocaine, or known as coke, is a powder form that people typically snort.
Is oral ingestion of cocaine common?
No, from my experience, oral ingestion of cocaine is not common.
Okay. And for symptoms and side effects, how would oral ingestion of cocaine differ from snorting, something like that?
Yeah, so the manner in which drugs enter the body is really going to be dependent on potentially how quickly those drugs affect an individual and how quickly those drugs can get to the brain. So something like snorting or smoking is going to have a much quicker onset of actions. Whereas if you ingest something orally and it goes to the stomach, you have to get it then absorbed into your body. Some of that drug could break down in your stomach acid. So there's different effects and how quickly the substances can affect an individual based on the route of administration. But then also there's other things that can be important about how the drug is metabolized or how it's breaking down throughout the body based on the route of administration as well.
And in preparation for this trial, did you research to see if you could find any sort of studies on oral ingestion of liquid cocaine?
Yes, I did.
Okay, were you able to find any studies for liquid cocaine?
I did not. There are a few studies that have looked at oral cocaine administration, but typically they're through capsules or tablets, in large part because that's how a lot of substances are taken orally, as capsules or tablets. I could not find any studies looking at liquid cocaine oral administration to humans.
And I want to talk to you about your research that you found for capsules.
Isn't that a name of a shot?
How quickly symptoms appeared in your research?
Yeah, so in those studies, they looked at sort of the symptomology of individuals, but then also the peak plasma levels. So plasma is sort of a form of blood in terms of the way that drugs are in the body. They collect blood and then can convert it to plasma. So they found, one of the studies found that the peak plasma concentrations were between 50 and 90 minutes. And that just means that the cocaine has gotten into the bloodstream, it's circulating around the body, and as they test serial amounts of, serial meaning replicate amounts of blood over time, that in 50 and 90 minutes, it was the highest amount of cocaine, and then it started falling down.
Okay, is it in your opinion that liquid cocaine would work quicker than capsules?
Yes, when you have a capsule has to get into your stomach, the capsule has to be broken apart, the substance, in order for those substances to then be absorbed into the body. On a liquid form of the drug.
Ginger, let me know what you are asking how about. Like what is it that you are wanting more information about? Because the pathologist was up there earlier and she said the same thing. Like she looked for a while trying to see if there was any liquid form of it, or any studies, any data, journals, and there aren't. And so it's absolutely mind-blowing that this is what the state is saying caused the unaliving to happen, when there's nothing out there that looks into how this actually impacts people. You know what I'm saying? Hopefully I answered your question by providing some information. I know I don't know the impacts of it, but specifically, it is the interaction of this substance and alcohol together.
Generally, compared to a capsule or a tablet, that liquid is already ready to be absorbed, so that process can be a bit quicker.
Okay, so if we have Ms. Benning, who at 9:10 is painting words on a canvas, 9:25, a photo of a new word that she has painted on a canvas, and then we have a lieu of about 4 minutes of taking photos, and then 9:29, so about 19 minutes from that 9:10 to that 9:29, there's a phone call, and it's 6 minutes long. At the beginning of the phone call, you can understand Ms. Benning for the most part, and by the end of it, you cannot understand her. During that phone call, she's saying things like, I can't feel my legs. And then by 9:50, when EMS finds her, she's pulseless. From that 9:10 to that 9:50, is it consistent with a 30-minute window of Ms. Benning ingesting that cocaine and then feeling those side effects and becoming pulseless?
Yes, as I mentioned, you can get peak cocaine concentrations orally in about 50 to 90 minutes. So the effects certainly are presenting sooner than that. So that is consistent with that time frame and that the results or the data that's in the scientific literature.
Wait, we went over how there is none. Exactly,
Yeah,
Ginger.
you're saying it would be less than that time with the capsules. That 30-minute time frame for us is consistent because it was not capsules.
Yes, generally, the drug does not have to be absorbed or taken out of a capsule or a tablet. That time frame can be shorter.
And going back to the test result, is fentanyl one of the 1,100 drugs at minimum that you tested this urine for?
Yes.
And was fentanyl present?
No, fentanyl was not detected in this urine sample.
Okay. What about cocaine?
Yeah, so cocaine was also and is also in the scope of our testing, and it was not detected in this specimen.
Okay. And so I just want to be very clear for the jury: cocaine and only cocaine metabolites tested positive for this 2/25/2023 at 22:59 urine.
Correct.
And Vanderbilt's threshold was 300 and was only testing for the benzo. Is that correct?
So the way that immunoassays work, they have a target substance, and generally in urine immunoassays, that target substance for cocaine is benzoylecamine. Some of the other metabolites will have cross-reactivity, so their amounts could sort of combined in total potentially reach that threshold. In this case, with the result being undetected, those combined amounts of the substances still did not reach the threshold for them to produce a positive result.
Your Honor, if I could have the witness pass exhibit number 32, please.
It must be pretty nice to be the director of a nonprofit based out of Pennsylvania and have to go to work for a work trip in Nashville on a Friday during Pride Month. Oh, this is the last weekend of it.
Dr. Kwiatkowski, you are being handed State's Exhibit number 32, which is Ms. Benning's autopsy report. Are you familiar with any sort of addition that for cocaine, the parent cocaine and the ENE being added, and what that can give you as an estimate?
Yes, I am familiar with that practice. Again, methyl ester, or EME, is also a metabolite of cocaine. So there's a practice in which you can, or where folks will add the parent and the metabolite together to get an estimation of potentially how much of the parent drug could have been present if it hadn't broken down to that metabolite in this case.
And if you could, Dr. Kwiatkowski, get to that lab result in the autopsy report, please.
I mean, did you guys not just hear what
Could you tell the jury
Ginger and I just heard?
The cocaine was, and then how we would get to that number of the estimated concentration of cocaine in Ms. Benning's blood that night?
Yes, this is the NMS Labs toxicology lab report that reports cocaine at 78 nanograms per milliliter and the epinephrine methyl ester at 7,800 nanograms per milliliter.
Okay, and what would that bring us to if we were doing that addition?
Yeah, so if you were to do that addition of the two, it would be about 8,000 nanograms per milliliter.
Okay, and is 8,000 nanograms per milliliter a high concentration of cocaine?
No.
Yes, if there was 8,000 nanograms per milliliter of cocaine in someone's system, that would definitely be considered, in my opinion, a high amount of cocaine.
Nano
What
is 1/100th,
typical
right?
that you see? Do you see anywhere near 8,000 nanograms per milliliter on a daily basis?
Yeah, so we do quantify cocaine in blood samples, not as routinely as NMS does. I do not recall what the highest amount of cocaine we've seen in a blood sample is, but I would think that we have seen
Get a certificate
concentrations
from
of
them in the
cocaine
mail?
in the thousands. I just don't know exactly what those concentrations are.
Dr. Bertolsky, what are we looking at now?
On the screen now is the second report.
And from your discussions with Vanderbilt, do you know if Ms. Benning, if this report was after Ms. Benning had been treated in Vanderbilt?
Yes, it's my understanding, talking with the individuals at Vanderbilt, that the first urine sample was collected prior to the individual being given drugs in the hospital. And the second sample was collected after those drugs had been administered in the hospital, which is consistent with the results that we found.
Okay, and can you walk the jury through what medications, if you want to touch your screen, would Ms. Benning have received in the hospital and how you know they're medical grade medications?
I'm sure. So from our perspective, when we test for drugs, a drug molecule that we see, you don't necessarily know if it's medical grade or not. That's oftentimes why we'll consult with the individuals at the hospital to understand what substances the hospital is administering, but also through sort of my experience in dealing with these cases, many hospitals administer the same drug, so it's something that we can kind of see reproducibly. So one of the first substances, acetaminophen, oops, that was really bad. Acetaminophen is a drug that can be administered in the hospital. Acetaminophen is Tylenol. Levetiracetam, which is an anticonvulsant, also known as Keppra, can be administered in the hospital.
And Dr. Bertolsky, I'm going to stop you right there. Are seizures a side effect of ingesting cocaine?
Yes, as I previously mentioned, seizures can be associated with cocaine toxicity.
Thank you.
Next on the list is lorazepam. Lorazepam is a benzodiazepine, which is also, benzodiazepines can also be administered as anticonvulsants for seizures. And then fentanyl. Fentanyl is an opioid. Many people know about fentanyl because of its illicit uses in the street drug supply. However, fentanyl is actually a common opioid analgesic used in the hospital as well.
And is it your understanding that Ms. Benning received fentanyl at Vanderbilt University Medical Center?
Yes, that's my understanding.
And that Ms. Benning had no fentanyl in her when she got to Vanderbilt Medical Center?
So based on the testing that we performed, there was no fentanyl in the first urine sample that we tested.
Okay.
To draw your attention to levamisole.
Yeah.
Can
the
you talk to the jury about what you know about levamisole and its importance to cocaine?
Yes, levamisole is, while it has uses in animal medicine, it's something that we call an adulterant. So a lot of times drugs within the street level drug supply will be adulterated and things will be added to them. A lot of times to sometimes help with side effects, but sometimes make the high that those drugs produce better. So in this case, or levamisole
fertilizer.
Scenario, levamisole is a substance that we see as an adulterant alongside cocaine in the street drug supply.
And is levamisole a common cutting agent for cocaine?
Yes, levamisole is as well as lidocaine are common cutting agents for cocaine.
Okay. And what would be the explanation of why Ms. Benning's first urine, when she initially got to Vanderbilt, did not have levamisole in it?
Yeah, so I reviewed the results for the two urine samples, and as I mentioned previously, during our testing, aspects of the data can show us, while we don't quantify the amount of cocaine, how high or low that level is. The amount of cocaine that we detected in this second urine sample is much higher, as well as some of the other substances as well. So it is possible that because the amount of cocaine was lower in the first urine sample, the cocaine or the levamisole may not have accumulated or been excreted in the urine sample yet. So levamisole may have been there, but below our detection limits. Whereas in this later sample, as more cocaine is being excreted from the body and put into the urine, it's rising above and potentially then is above our threshold, and we're able to detect it in this sample.
And is that common to initially get a low threshold cocaine and then later on get a levamisole?
Yes, the way the drugs are excreted into the urine, when you first take a drug, there will be no drug in the urine. So you'll start out at zero. As the drug is metabolized, then the parent drug as well is excreted into the urine. Those concentrations increase. And eventually, as the bladder is emptied and the drug is sort of cleared from the body and there's no more drug to excrete into the urine, those concentrations then will go back down. So that is consistent with sort of that trajectory.
And do you know how low the levamisole was in this urine?
I do not recall, but I know that it was significantly smaller than the cocaine.
Let's talk about cocoethylene. What can you tell the jury about cocoethylene?
Yeah, so cocoethylene is
That's
an
exactly
interesting
what it sounds
substance
like.
in that it forms in the co-ingestion of cocaine and ethanol.
Okay. Was cocoethylene present in Ms. Benning's first blood or first urine?
No, it was not present, but similar to the explanation I gave for levamisole, it could be that it was present but below our detection limits, therefore we weren't able to see it because maybe it hadn't been excreted fully yet.
And do you know how low this sample of cocoethylene is in Ms. Benning's urine?
Yeah, so I did take a look at that, and again, comparing those responses that we get from the instrument, the amount of cocoethylene that we detected was about 1% of the amount of cocaine. So again, quite a small amount of cocoethylene compared to the amount of cocaine that we saw in this urine sample.
And this 1% of cocoethylene, would that be consistent with Ms. Benning drinking alcohol and then taking a bump of cocaine?
So from my experience in those scenarios, you wouldn't have that small amount of cocoethylene, although it does depend on sort of the timing of when the urine sample was collected. But generally, when we see cocoethylene with people who are co-using larger amounts of alcohol, we do see it at more appreciable amounts than the small amount that we saw in this sample.
Can you dissolve cocaine in alcohol to make it a liquid cocaine?
Yes, cocaine, like many drugs, are dissolvable in what we call solvents, and ethanol would be an example of a solvent.
I'm not even going to say what I know you guys think I'm going to say. But how in the world have we gotten here? We were told that there were no studies, that they didn't know about this. Like, what? There's no way all of us got that wrong. Are we being gaslit? And if so, by who?
Dr. Kotulski, was cocoethylene present in any other samples for Ms. Benning that you tested?
No, it was not. Cocoethylene was only detected in this specimen.
Right. And we talked about the hypothetical about her Ms. Benning's timeline. Would you expect to see more cocoethylene if Ms. Benning had been drinking alcohol?
So in cases where we do collect urine samples from people who have been drinking alcohol and using cocaine, I would say typically those amounts of cocoethylene are larger. But again, there's a variety of different reasons as to how the level of cocoethylene could be in this case, including the dose of the substances, not only the cocaine and the ethanol, but also the time associated with it.
Okay, and for that first urine to only have cocaine, benzo, and then the other metabolite, but no cocoethylene. If she had been drinking heavily and doing cocaine, would you expect to see that cocoethylene reporting above the threshold?
Yeah, so she was drinking and taking cocaine together. I would have expected to see the cocaine in that first urine sample.
And is it your understanding that through all the other testing of Miss Benning at Vanderbilt, that there was no alcohol present in her system?
Yes, it's my understanding, and through talking with the toxicologist at NMS Labs and Dr. Brucalari at Vanderbilt, that the ethanol testing that had been performed by the other laboratories was negative.
And Dr. Kratulski, is there any other explanation other than just drinking alcohol and being dissolved in alcohol that you can get that cocoethylene?
So there are other ways that small amounts of ethanol can get into your system. Some other drugs that are used may have ethanol as a minor component in them. There are some things that may be used in foods that could have small amounts of ethanol in them. So there are other ways that ethanol can get into your system other than drinking beer or other forms of drinking alcohol.
And is that consistent with how low Miss Benning's cocoethylene percent is at, and then we don't see it again?
Yes, I'd say that would be more consistent.
Right, and could it be used in cooking for like homemade cookies with vanilla extract or something like that? Could that low reporting level of cocoethylene be consistent with Miss Benning have cooked that night?
Yes, I'd say that could be consistent.
Hey guys, I started a goal for the dry erase board that we talked about. If we hit that goal, then we will get, I have it in my cart, my Amazon cart. Prime Day or week ends today, so
Good afternoon, is it Dr. Kratulski?
Yes.
I'm Letitia Quinones Hollins, and I just have a few questions for you. I first want to ask you about your forensic toxicology certifications. Did you have to go to school to become a forensic toxicologist?
So forensic toxicologist is a job, just like an electrician would be a job, or just like a chemist would be a job. So generally, there's a variety of different programs that train individuals to become forensic toxicologists. There's a variety of different ways that you can get to being a forensic toxicologist without a degree in forensic toxicology. In the United States, there are no PhD programs in forensic toxicology. So many of us who have our PhDs and work in forensic toxicology get our degrees in areas like chemistry, pharmacology, sort of general toxicology, one of those other fields.
So have you had training in toxicology?
Yes, I have a master's degree in which I spent 2 years learning about forensic toxicology. I've done a variety of different research work related to forensic toxicology. I also have on-site training. So in addition to the time I've spent at the CFSRA, I actually did also work at NMS Labs for a short period of time and received training as part of that at NMS Labs. So I have received training both through on-the-job training as well as educational training to be a forensic toxicologist.
And in order to be classified and certified as a forensic toxicology, it took many hours and a lot of time dealing with toxicology to be able to be qualified as a forensic toxicologist. Would you agree?
Yes, I would. There certainly has been a lot of time and education that I've gone through. The field of forensic toxicology is made up really of 3 separate fields: analytical chemistry, forensic science, and toxicology itself. So it's learning about all those different aspects and pulling all that together to become forensic toxicology.
Thank you. Now, I want to draw your attention to, I believe that the first testing from the 2259 urine, where it's labeled 20230092 from the CFSRA.
Yes.
And I see there that
it's like $30.
Results for what they call BZE?
35.
Correct. Benzoylacogene is called BZE for short.
Norcocaine,
Correct.
which is another metabolite for cocaine,
Yes.
and then of course the parent cocaine.
Yes.
Why would you say that I wouldn't see something here for like heroin?
Heroin is a substance called diacetylmorphine. It metabolizes to 6-monoacetylmorphine and morphine. Those substances are included in our scope of testing. So I would expect if they were present in the urine at our thresholds that we would be able to detect them and report them.
So the fact that that isn't there means that it doesn't appear that it was in this matrix of the urine. Is that correct?
Correct.
And my point with that is that when you go now to 20230090, we see cocaethylene. Is that correct?
Correct.
And just so that we're sure, this is the urine in 20230090 of Miss Jade Benning. Is that right?
Yes, I believe that's correct.
And so we see that cocaethylene is in fact positive, right?
Yes, and we're talking about the second urine sample that was collected.
Yes, the 20230090.
Yes.
Yes, okay. Now, you said the second urine sample. When was that taken from Ms. Benning?
As forensic toxicologists in our labs, we take in samples and they come with a variety of different information. In this case, the case was not given to me with the date and time collected, so that's not something that appears on our reports. That's something I would refer back to the folks either at Vanderbilt or also, I believe that information is on NMS Lab's report.
Okay. You believe that it's on NMS Lab report?
I believe it's included in their report, yes.
Okay, and that's NMS Lab report 896, based on where it says.
Oh my God, I'm an
I'm sorry,
idiot.
899. NMS work order number is 230788899. Is that correct?
So I don't have the reports in front of me, and with all of the numbers, I'm having a little hard time following. Yes, if that is, I do not have that report in front of me. If that was the, yeah.
This packet of yours have that.
Sorry, yes, the packet that you have. Oh, yes, thank you. Yeah, so this for this report, 2023-0090, which is our CFSRE case number, that is associated with NMS work order number 23078899.
Okay, here we go.
So, as it relates to the urine where we see cocaethylene, you don't know what time it was taken.
It won't let me respond anymore.
Correct. As part of our responsibility as a forensic toxicology lab, we bring the samples in, and it's our responsibility to report the results out. It's not our responsibility to keep track of when the samples were collected and to sort of marry up that information. It's our responsibility to do the drug testing and report the drugs that we find.
So is that a no, sir? You don't know what time it was taken?
Off the top of my head, no, I don't.
Okay. And so.
Is there any of your records that would take?
No, so our records do not. So you would correlate back our case number with the NMS Labs case number and the agency case number and the information they had in terms of when the specimens were collected. So that's NMS Labs or Vanderbilt's information about when the samples were collected.
So you can't say it wasn't taken at 2259 or that it was, as the information that you have before you at this time.
Again, that's not my role. Our role is forensic toxicologist.
I'm just
Yeah.
asking.
Okay, yes.
Yes. Now, irregardless of when it was taken, this is the urine of Jade Benning, right?
From my understanding, yes, this is the based on the conversations I had with Dr. Rebecca Bruccolari at Vanderbilt.
Okay. And so in the same manner that you don't see, I think you called it levamisole, which is a cutting agent for cocaine, right?
Yes.
The same way you don't see levamisole in your initial testing of 202.
What isn't a word?
Is the same manner for which you don't see cocaethylene, right?
Yes, as I explained before, in order for us to have a positive result, there needs to be enough of the drug or the metabolite in the urine sample to meet a threshold for us to detect it. So it is possible that they were present in the urine, however, below our thresholds to detect it, so therefore we would not report them as a positive result.
Nonetheless, you have those two different metabolites that weren't present in your first results that are present in the second? Yes or no, sir?
That is correct. However, I think it's important to note that these are not replicate samples, so we don't expect to have the same results in both urine samples.
Oh my God.
These
I
urine
never
samples
did
are collected
know.
at different times. We have different results because we know that there were drugs that were administered in the hospital that we don't expect in the first sample that we do expect in the second sample.
We wouldn't expect for Vanderbilt to give someone something that would cause them to test positive for cocaethylene, or would we?
So again, depending on whether or not cocaethylene was present but below our detection limits in that first sample, or whether or not the cocaethylene was formed after, that's not something that I can speak to because we don't have information about that. But it could be really either of those scenarios, or potentially either of those scenarios or others.
Okay, the statement that you just made was that Vanderbilt had treated Ms. Benning, and so that's why we'll see a difference in what is present in her urine in this later sample than you would in the first sample, right?
Yes, I said that referring to the drugs that would be administered in the hospital, things like levetiracetam, fentanyl, lorazepam, those substances that are medical grade drugs.
Are they administering cocaethylene, do you believe, at Vanderbilt?
No, I would not believe they would be administering cocaethylene at Vanderbilt.
And so if we see this in her system, then it is safe to say to this jury that she had to get it from somewhere other than the treatment she received at Vanderbilt. Wouldn't that be right?
And I apologize if I hadn't explained this well, but cocaethylene is really not a substance that's available out there. People don't go out on the street and buy cocaethylene. You can't sort of.
Oh,
get it
I'd
as a
like some
prescription drug.
cocaethylene.
Cocaethylene is something that's formed in the body when someone uses cocaine and ethanol.
I love
So again,
that
this
for
wouldn't be
you.
something that could be administered. This wouldn't be something that is ingested. It's something that's formed through those two substances.
Exactly. That person would have had to have ethanol and cocaine in their system at the same time. Yes or no, sir?
Correct.
Now, so what we do know, and the reason I gave you the hypothetical of the heroin is because the only reason that it's going to show up positive is because there was alcohol and cocaine taken at the same time from Ms. Benning, right?
Yeah.
That's why your testing came positive. Yes or no, sir?
So I don't want to confuse the terms ethanol and alcohol. Ethanol is
I
a
definitely
small
do that.
molecule. Alcohol, while we refer to drinking alcohol as alcohol, alcohol is really a class of substances. Methanol, for example, is also an alcohol, and there's other alcohols as well. So what I'm saying is that cocaine and ethanol come together to form cocaethylene. The source of that ethanol, as I previously testified to, is unknown, but there are different sources as to where that ethanol could come from.
Right. You said that it could have come from the vanilla extract that she put in her cookies.
I didn't say that. I said it could come from different things that are used in cooking. Could also come from, again, ethanol could be a minor component.
Ginger, I know you're watching really closely, and I'll be really quick. One time, my therapist told me this. She had a lady come into her office and was like, I'm going to have to go to the grocery store, and I left my wallet at home. And this lady was like bent out of shape about it. And she was in therapy for being an alcoholic and just like mood regulation issues. And my therapist gave her $5, and she went to the grocery store and bought a thing of vanilla and got drunk.
And some medications that are used, I didn't necessarily say it came from a certain a certain place. We don't necessarily know where that ethanol may have come from.
I didn't know that was a thing.
Prosecutor actually asked you, could it come from the vanilla extract? And your response was yes, it could.
Correct. She said could, and I said yes.
And that was my question. You just said earlier that it could have come from vanilla extract.
I apologize. I thought you were asking me if I said that it did come from the cookies.
No,
which
I
didn't.
said you said it could have. But it also
Hypothetically,
it could have come from her having a drink and then also taking cocaine, couldn't it?
Yes, that is possible, again, depending on the amount of ethanol consumed. Ethanol can come from, as I mentioned, those other sources. It also can come from drinking alcohol as well.
Now, do you know what a screen test is, sir?
Yes, I do.
And what is that?
So in forensic toxicology, typically we do two tests. Historically, we refer to them as a screen and a confirmation. Screen is a way of saying, okay, well, I've tested this substance, usually for I tested this sample, usually for a large array of substances, and then we know what's present, and then we take that through a confirmation test, which is then usually quantitative in nature. So typically in forensic toxicology, you would do those two tests, a screening test and a confirmation.
And so is it fair to say that a lab would not go past a screening test to a confirmation test unless something is coming up positive in that screen? Is that correct?
Yeah, so the field of forensic toxicology has really advanced in recent years. Historically, when we thought about screening tests were usually things that were not very accurate. They may have tested for a class of drugs and you would get a positive result. You have to figure out why you got that positive result. A good example would be if you tested for benzodiazepines and got a positive result for benzodiazepines, you may have to do a confirmation to say, well, what exact benzodiazepine am I looking for? But as forensic toxicology has advanced, some have tried to get away from the term screen and confirmation because a lot of the instruments that we use now for screening tests are actually a lot more accurate and sensitive than they've previously been, but also sometimes they're more accurate and sensitive than the instruments that we use for our confirmation tests. So typically, now you really have to understand what specimens were provided to the forensic toxicology lab and really understand what their methodology for testing was. It's not as easy to paint it with a broad brush to say, oh, absolutely this is a screen or absolutely this is a confirmation.
Well, you're not telling this jury, sir, that your laboratory would be using something that you can't rely on and or is not credible, are you? Are you saying that?
I'm not sure what you're referring to. No, I'm not saying that.
Scott, are you here?
I assume and hope that whatever immunoassay testing or whatever testing that you are performing at your laboratory would be one that is credible and reliable for you to represent to the community and your clients that trust you. Is that right?
Yeah, so we do not rely on the results of other toxicology labs. We perform all of our own testing in-house. When a sample comes to us, we may have heard of testing that's been performed externally, but we perform all of our own testing in-house. And then yes, to your point about our methods being accurate and reliable, we validate our assays. We run quality controls and different checks during our testing to make sure that the results that we are reporting meet a level of high forensic reliability.
And so your assay, the ones that you rely on and the ones that you deem credible, tested positive for this coca-ethylene, right?
Correct. The second urine specimen.
Now, in regards to the NMS lab, you see, if I can draw your attention to the 889, and we just talked about that you don't move on to a confirmation test unless there was something that was positive in the screening test, correct?
Yeah, again, to
Yes,
try.
sir.
Well, so I think that you're trying to use the terms screening and confirmation for the test that we performed. Our laboratory really does not define them as a screen and a confirmation. The test that we perform, we define as a drug identification. So we did not perform two tests. We performed a single test, a drug identification of these substances. I would not characterize it as a screen or a confirmation.
I wasn't speaking about your test. I asked you to look at 889 of NMS.
Oh, I'm sorry. I apologize. When you use the 4 numbers, I thought you were referring to my report. Yes, and I do not have a copy of NMS Labs report.
Okay, can I?
It's in the autopsy report, Dr.
Oh,
You have that.
I apologize. I do have that in front of me.
Yes. You see there that NMS moved on to a confirmation test for coca-ethylene. Do you see that?
Can I just ask a clarifying question? So I'm looking at an NMS Labs toxicology report that has a work order number that ends in 6889.
Correct.
Is that correct? Okay.
Yes, sir. And did you see a confirmation test performed for coca-ethylene?
So this is really getting slightly outside of the testing that we performed, again, because this is the testing that another laboratory performed. NMS Labs lists the tests that they performed, and they listed they included a cocaine and byproducts panel. So from looking at the report, It does appear that they would have looked for cocaine in those byproducts, but again, I cannot testify today to exactly what NMS Labs did. I don't have their data and their results in front of me. My testimony is really about the testing that occurred at the CFSRE.
I'm not asking you about the data that they utilized. I'm asking you, with your expertise, as you being a forensic toxicologist expert, is to only share with me about looking at this toxicology report. And so that I'm clear, you're an expert in the field of
Judge, I'm going to
toxicology.
object to ask an answer. He's already testified that
You
he's
know
not.
what that lab means by screen test.
So again, I mean, I'm happy to sit here and look through the report. Certainly they will lay out what testing that they used and what testing was performed. But again, this was not within the scope of what I prepared for this testimony. I mean, I'm happy to take a look at it.
Would you do that for me, please? Just to see whether or not there was a confirmation test performed for cocaine. Would you please do that?
Again, based on the report
Dude.
says testing was performed for cocaine and byproducts panel.
You're getting like essentially a free trip to Nashville for the weekend. Do whatever they say.
If you look then to 2 pages later where they describe what's in the cocaine and byproducts panel, it does list cocaethylene as an analyte within the scope of that testing, yes.
Thank you. And that's for the scope of testing on confirmation, correct?
I believe NMS would characterize this test as a confirmation
I need
test.
to give you guys the fundraiser info.
Now, let's talk a little bit about
Funny Gingers now.
the CFSRE lab. Do you see that?
Yes, by laboratory, yes.
And the number in regards to
You want 0092 or 0090?
0090
Oh my gosh.
for the cocaethylene that's present there, correct?
Yes.
So, when the testing was performed for this particular urine, do you know whether or not the levels for any of those metabolites, do you have those levels?
No, so for our testing, our laboratory, while we obviously test for cocaine in these substances, in this case, when we received the specimen,
I won't be looking at chat for like 5 minutes. I got to get something ready for you guys. You guys aren't going to believe this.
received our qualitative results and issued those results back. We were not asked to perform a quantitative test. We typically wouldn't just do that on our own. And there was no request for us to perform a quantitative test. So in this case, we did just perform a qualitative identification of cocaine in the metabolites.
Okay, so you didn't perform a test to give us levels, is that right?
That is correct.
Okay, so you can't tell us what level that cocaethylene is, can you?
So with exact certainty, the exact concentration of that cocaethylene, no, I cannot tell you what the concentration is. However, as I mentioned previously, and is present in our data packet, there are pieces of the data, what we call peak area. So as every analyte is detected by the instrument, it generates a response. And that response is proportional to the amount of drug that is present. So a higher response means more drug, a lower response means less drug. So we can use that response to see whether or not it's a high or low amount of cocaine. So I cannot say that there's exactly, say, 120 nanograms per mil of cocaine. However, I can see what the response looks like based on what comes from our testing.
So is that a no? You can't give us a level?
I cannot give an exact quantitative level for the cocaethylene.
Now, let's talk
That's
about
enough.
what you
Thank
were
you.
speaking,
Sit down.
With the prosecutor about in regards to, I think you said 8,000 nanograms per milliliters, is that right?
Approximately, adding those two numbers together, yes.
Okay. Now, is that the way that you would have calculated how much of that metabolite or cocaine, parent cocaine, was in that person's body or in that matrix?
And so our laboratory actually does not quantify, does not test for EME, as I mentioned previously. So this is not a practice that I would do on our cases because we don't have that data. I was asked whether I'm familiar with that practice, and I am familiar with that practice, but that's not something that I personally do.
That's not what you would do. Is that what you're saying?
I was not, so as a forensic toxicologist, in addition to the testing that we do, oftentimes we're asked to render an expert opinion. And as you sit and prepare for that expert opinion, that's something to consider as part of that process. I was not asked to do that as part of this case. So I would have to, and every case is different. You can't say that necessarily you're going to, because the drugs you find in every case are different. You have to take cases and evaluate them on a case-by-case basis. So it's really hard for me to sit here and speculate what I would have done because I wasn't asked to do it.
Okay, but you're a forensic toxicologist, correct?
Correct.
You are the director of a toxicology lab, are you not?
Yes.
You've had significant training in forensic toxicology.
Yes.
So I'm asking you, as an expert, if you were trying, giving you a hypothetical, you're given a case, and you're trying to determine how much parent cocaine is in a matrix, in this instance, someone's blood, would you utilize the method of combining the parent cocaine and EME?
So I think I would consider that, again, because that is a process that's out there. I certainly would not use that definitively. I would understand that that's a way of looking at kind of a generality, but definitely not anything definitive.
Exactly, because with all of your expertise and training, that is not a method you would use.
Yes, as I said.
Why do I always feel like she's
Now,
yelling at us
hypothetically utilize
and demeaning us?
and come up with a number of 8,000 as apparent cocaine in someone's blood. Okay? The pharmacokinetics that you would utilize to try to determine how much cocaine that person took at a certain time, how much cocaine would that equate to, sir? If we were to go back 24 hours.
Yeah, there's not really a way to correlate the amount of drug in this case to the amount that an individual would take. It's not, you can't say just because there's 8,000 nanograms per ml of cocaine there, there's not, or there was X amount of dose that the person ingested originally. That's not something that we would do in forensic toxicology to try to back calculate a dose.
So then are you telling this jury that you cannot so first you said that's not a method you would use. And so you're now saying that there would be no way to try to ascertain how much cocaine that person originally took. Is that what you're saying?
Yeah, through the training that we have as forensic toxicologists, we generally do not train individuals on how you would calculate a dose of a drug that someone used. Certainly through someone's expert opinion and training, they may try to do that, but that's not something that we typically do in forensic toxicology, to try to calculate a dose.
So what is pharmacokinetics?
So pharmacokinetics is the way that your body processes a drug. So it's broken down into 3 different areas: absorption, which is how the drug is absorbed into your body; distribution, which is how it's distributed throughout your body; metabolism, so breaking down cocaine to its metabolites; and then excretion through the kidneys into the urine. So pharmacokinetics is that process of what's happening in the body to a drug. And it's a very vast field. There's a lot of other parts of pharmacokinetics as well.
What is it used for?
So in forensic toxicology, a lot of the substances we deal with are not legal. You can't give them to humans. So a lot of times when we think about pharmacokinetics, especially for substances of abuse, we would look at pharmacokinetic studies generally in maybe a rat, and we'd see, well, how much drug was given to the rat, how much drug we were able to detect if we collected the rat's blood, how much of the drug was excreted through the rat's urine. There are some substances that are used in humans, like cocaine. I mentioned previously that there were studies looking at individuals ingesting capsules of cocaine, and through that same process, you can look at then peak plasma concentrations, as I mentioned, metabolites, all those different aspects.
So you'll agree with me then that pharmacokinetics is sometimes used to try to determine a dose amount.
I would not say pharmacokinetics is used to determine a dose. I don't think that would be the correct way to state that.
Well, how would you state it?
So I mean, the only time that this is really done in forensic toxicology is with alcohol. So you can look at, and you may be familiar with this, but you can look at, based on the amount of ethanol in someone's system, you can back extrapolate to potentially how many beers or how many shots or how many glasses of wine they took. The reason we can do that with alcohol is because of its pharmacokinetics and its linear elimination from the body. In the world of other drugs on humans, I'm really not aware of any pharmacokinetic properties or calculations that you would do to correlate those drug concentrations back to the dose. And in this case, the blood concentrations of cocaine back to an exact dose of cocaine consumed.
So you're stating that it is never utilized to try to determine a dose, pharmacokinetics is never utilized in your field to try to determine a dose of cocaine? Is that your testimony, yes or no, sir?
And so I am not in a forensic case like this. I am not aware.
As I said, ever, is pharmacokinetics ever utilized to determine a dose of cocaine?
Well, as I mentioned before, in terms of a rat study, actually this can be, there are certain research studies where they may look at in the hospital trying to see how much, if they can control the amount of urine that is collected over a certain amount of time and do quantitative testing on that urine. There are some research studies that would look at trying to then calculate back the dose of a certain drug that was consumed. So there are aspects of forensic toxicology where that may come up. But in terms of a case like this, where you're looking at drugs for a legal case, that's a whole different round.
All right, I'm almost done. I'll be
So your answer,
back
the
over
answer to
shortly.
my question is yes, it has been done.
Yes, it has been done, but again, under the different premises that I mentioned.
But is your testimony in a case like this, you should not do that, is that right?
It is my opinion that if I was asked to calculate the dose of cocaine consumed, that is not something that I would do.
And so then, based on your testimony, there is nothing we can do to try to determine the apparent amount of cocaine that was in her system at the time of ingestion.
Well, now you're asking two different things. The dose of cocaine would be the amount of cocaine outside the body that is then ingested in whatever form you want to ingest it. The amount of cocaine circulating in blood is a whole different thing from the dose. That's not the dose. That would be the circulating concentration of the cocaine.
I wasn't speaking about this, sir. I was speaking about trying to determine the amount of cocaine that Ms. Benning would have had to take
Her tone.
in order to have the numbers that we see in her blood. I'm asking you a simple yes or no for this jury. Is there a way to try to make that determination, sir? Yes or no?
Yeah. So I think I'm getting confused because you're talking about the 8,000 nanogram amount, and these are really two separate things. Yes.
Don't worry about the 8,000. Simply
Yeah.
listen to my question.
Let me ask it maybe in a more.
Yeah, maybe.
way. Can you tell us whether she took an ounce, 2 ounces, or a kilo?
There would be calculations to potentially rule out really large amounts or really small amounts. I don't think that there is not a calculation to get an exact amount in the middle.
And so there are calculations to make an assumption.
Yes, and in a hypothetical world, to make an assumption, yes, I believe someone could do that.
And what would they use to do that?
Critical thinking skills.
Yeah, I mean, there's a lot of factors. I mean, there's factors in terms of, right, you'd have to look at you'd probably take some sort of concentration that you're starting with from what we would detect. There'd be different parameters within the body.
Diluting it?
Was this a larger or a smaller individual? Did they have potentially a lot of blood, a little bit of blood? What is their different physiological parameters of them?
Like
Time
metabolism.
is a really important thing. If you're talking,
I'm not asking about the factors. I'm asking about what would you call it? If it's not pharmacokinetics, in order to get to that answer, what would you call it?
okay, so I would call it that it would be some sort of pharmacokinetic calculation, but it is not the entire field of pharmacokinetics.
Well, so then you can use pharmacokinetics to try to get to an assumption as to what amount of cocaine she took, correct?
Sure, yeah, somebody could, in theory, do that.
Thank you.
Is she the lead counsel?
So,
I I asked,
In regards to that, have you done that calculation for this case?
No, as I previously stated, that would not be something that I would consider doing.
Now, and a number of, well, let me ask you this. What is a half-life of cocaine?
So the half-life is defined as the amount of time it takes for a concentration to half. So say, for example, at 1 hour, it's 800, and at 2 hours, it's 400. The number is halved over 1 hour. The half-life would be 1 hour. And you'd expect then the half-life to continue 400 down to 200, down to 100.
Okay, so what is the half-life for cocaine?
I do not have that number off the top of my head. That's not something we typically would memorize.
Okay, but you will agree with me, there is a half.
Correct. There is a half-life of cocaine. I just don't have it off the top of my head.
And would you utilize that half-life if you were to employ the methods of pharmacokinetics to try to get to a number? I know it may not be accurate, but would you utilize that half-life?
Yes, if you were going to do this back calculation, one of the things in that equation that you would use, I would imagine, would be half-life. Yes.
Okay, very good. Thank you.
very good. I got my answer. Thank you.
Sit here today. The number that you see on that NMS lab that's with the CFSRE lab ending in 889, you agree with me that I believe it's 78? Is that right?
Yeah, so the econyl methyl ester concentration is 7,800.
No, the parent cocaine, is it 78?
Oh, I apologize. Yes, the parent cocaine concentration is 78.
And that number in and of itself is not just an abnormal high number, is it?
No, but again, this was not something I...
I'm asking about the parent cocaine and that number 78. That's not an abnormally high number, is it? Yes or no?
No, it's not that 78 alone is not a large amount, but again, there's a lot of factors that will go into it, and I've not reviewed this, so I'm not exactly sure sort of the time course of this.
I wasn't asking about that.
Oh.
I was just asking about that number. Okay. And so you agree with me also that that number 78 is in fact a number that someone could take on their own? Yes or no?
Well, certainly cocaine can be taken on its own by an individual, yes.
Thank
you. I was in the notes tab and I didn't see this. Thank you so much.
Dr. Carney had testified that she adds the EME to the parent cocaine to estimate the total amount of cocaine level before it began creating the ME or breaking it down. Do you agree that that is a common method to use to estimate the value?
Yeah, so one thing I didn't explain it, cocaine is a very unique drug. It's actually quite unstable. It can go through different processes of breaking down by enzymes or through hydrolysis. And it can break down to things like benzoylecgonine and econyl methyl ester. So because cocaine is sort of so unique, there have been different research studies looking at saying, okay, well, because we know it's an unstable drug, is there a way that through different calculations, we could potentially estimate how much cocaine was present at the time the blood sample was collected, rather than a few days or weeks or months later when that cocaine broke down?
And your testimony as a toxicologist is that you would not estimate that value because your testing is very precise, but you don't disagree with Dr. Carney using that.
Correct.
value.
I'm not disagreeing with Dr. Carney.
And the state never asked you to calculate a dose, but you can't calculate the dose Ms. Benning ingested. Judge asked you about an ounce or a kilo, but it could have been much smaller than that, especially if it was dissolved in a liquid. Is that fair?
Yeah, I mean, one of those factors is, as I mentioned previously, time. There's also a lot of times if you're going to do some of these pharmacokinetic studies, there's assumptions you're going to make. One assumption being that this was likely a healthy individual, normal processes, their heart was beating, their blood was flowing. If you're outside of those normal processes, some of these calculations start to break down. So again, I was not asked to do that. And again, it's a very complex process. And I just don't believe that that's something that would really be, I don't think you could probably do it with the information that I have and the understanding I have.
That's what I was about to ask you. You cannot calculate the dose Ms. Benning ingested.
Correct.
Thank you. Those are all my questions, Your Honor.
Yeah, I agree,
You
Rose.
stated-
Like they need to tie him into it. I don't know what happened to her.
Now, when I asked you the question, you told me that that was not a method you would use because it wouldn't be a definitive method. Are you changing your answer now?
Yay.
So, right. So when you say definitive,
No, you said definitive.
oh, sorry. When we use the word definitive, for example, in this case, when you have 78 and 7,800, I don't think it would be wise to put the two of those together and definitively say 7,778. If you're going to use it to as an estimation for the amount, that's one thing. But using the word definitive here, in my mind, that says to say exactly what this concentration is. And again, that's not. I don't know exactly what Dr. Carney's testimony was, but that's what I meant by not being definitive.
Actually, I think you said in a legal case like this, you would not utilize that type of method to get a definitive answer.
I'm sorry to do this for those hanging on the cliff to finish this, but I need to let everyone know what we are watching. If you are just now jumping in here, this is day 4 of the trial of Blaise Taylor in Nashville, Tennessee. He is accused of unaliving, his ex-girlfriend who was pregnant with his child, which he did not want, allegedly. All of this is allegedly. And this is a toxicologist on the stand. So I hope that you are enjoying this. Please make sure to double tap your screen if you are watching on your phone, or hit the thumbs up button if you are on a computer. And make sure you're a subscriber because we do this daily. All right. Thanks, guys.
Thank you, Lefty,
again.
On the calculation of
and
the dose,
Bubbles.
By adding EME and the parent, right?
He's talking about your question when you wanted to see if he could determine a dose.
No, my question was to determine the
What
parent
is your
amount
question?
of cocaine. I
And
want to be
everyone.
clear that you're saying if we were trying to determine the parent amount, we would not take the EME and the parent amount and put them together.
So again, I want to just make sure we're taking these two things apart. We're not talking about dose. So now we're talking about circulating amount of drug in the body. And in this case, taking the parent amount of cocaine and then the substance that the cocaine broke down into, understanding that those two substances are related and doing an estimate based on that is something completely different. And that's what I was just asked by the prosecution. Again, this is completely separate from the question of dose, how much someone ingests.
And when you were talking about the CFSRE record that did not show the fentanyl, and that would be 202300092, this was an opiate screen, was it not?
So our testing for
Yes or no, so was this an opiate screen?
So
one, you're way behind what was asked on redirect. So number two, let him answer the question.
So the testing that we performed on both urine samples includes opiates and opioids.
Told you guys.
So this was in fact an opiate screen?
So I would not characterize the testing that we did as an opiate screen. We consider it sort of a broad-based drug screen that includes opiates and opioids, as it does stimulants, benzodiazepines, and everything else. So if fentanyl was present in the first urine sample, it was in the scope of testing. And if we would have detected it, we would have reported it.
Yes, Rose.
So I just want to be clear, it would have, if fentanyl, if it was there, it would have been positive.
If fentanyl was present in the first urine sample, case 20230092, if it was present at levels detectable by our analysis, yes, it would have been reported.
So it could have been there, but it just wasn't at your detectable level.
Yes, that's how forensic toxicology testing works. As I mentioned with the levamisole and the cocaethylene, if something is below our threshold for detection, right, we would not be able to detect it, therefore not report it.
I just wanted to be clear so that the jury
What is your
understood
question?
is that it was possible it was there, but it just wasn't above the level.
Correct. And we have a pretty low detection level for fentanyl. I don't know what it is exactly off the top of my head. I'd have to go look it up.
Any other questions?
That's right.
Thank you, sir.
Thank you.
And can Dr. Tukolsky be excused?
This date is done with Dr. Kotulski.
We would say subject to recall.
Your Honor, if we can approach about that.
Okay.
Okay. Well, how long are they going to take? Because like I told Lefty, oh my God. I'm putting his name on screen so I don't forget. Say something. Like I was telling Lefty, I was gathering some links for you guys for us to watch a few short videos during the next break, because this story just keeps getting wackier. So I don't want to forget. He usually does that when he's going to break, but for Patriotic, if you guys aren't busy tonight, there is a fundraiser, but I think it's going to be very educational. It starts at 6 p.m. I am going on the fundraiser to speak at 7. If you guys are available, and this is for everyone, but I meant to grab my phone and message Patriotic earlier because I thought this would be something he would find very, very interesting. Okay, let's go. What's going on? We got someone in here who's never seen my channel before, and they said, a true crime channel I haven't seen. Let's go. And then I danced, and they haven't spoken since. So, yeah. I think we're like $10 away from this whiteboard. Because it's like 30.
How many other exhibits does the defense have some issue about chain of custody, if any?
We
All of
don't, I believe.
Okay.
Yeah.
Then they don't have an issue about Detective Reeves.
Well, I think she's trying to, he's the one that collected it from the hospital, so I believe she's just, are you talking about 227?
Sorry, I need to adjust this.
You just heard what she says up here. They've got a third sample they want to get into. Do you have issues about
I
that?
don't know which sample it is. There are a bunch of tests in this.
It's the one that Detective.
Tell me about a judge who is as mean as this guy every day, every single day after lunch. Not in the mornings.
February 27th, 2023 is 1600. It's technically 1604. It's the urine sample. It went to the MPV crime lab. They sent it on
From
to
what
us.
time?
February 27th, 2023, it's 1604.
Issues or not?
Oh,
I would like him to testify
Switzerland.
to establish it. But if he can testify that he was the one that picked it up and labeled it and put it in the Metro Nashville Police Department's vault, I would have no issues with it.
Okay. All right, let the jury step back then.
No, Judge Fletcher is a doll.
I don't know what you're all going to call it.
Steve was the troll, and then he realized that I'm just.
Dr. Grugaleri know when the second
Sweetest
sample was
pie.
taken? Is she here?
Judge, we have Dr. Benton here, and she has that information.
Okay.
We want to hear from the ex-girlfriend. thought you said not is. Yes. Which shit show are you referring to, Ginger Snap? My show or this? We're $5 away from meeting our goal because of the beautiful Rose, who already spends money every month to be a member. God bless you guys, and thank you to my viewers.
Yeah, bring her back in, so we don't have to take another break.
You guys are the best. I love that we got some new viewers in here. We do this daily, guys, so make sure to turn on notifications, please, to all. And let me see, are you watching on your phones? Yes. Ginger already liked and subbed, but Vamp, just make sure to sub up. Double tap your screen, give this a like, helps the algorithm. Please and thank you. Oh yeah, we're a great little community. Yes, we want to hear from the girlfriend. Like, I'm going to make it my my title again on Monday. I don't care. Like, that's what a lot of people came here for. And
Yes,
she should be up.
Raise your right hand. You swear to tell the truth, so help you God.
I do.
Have a seat.
Bubbles.
Doctor, you testified previously at the jury out hearing the defense has made a statement that you made up. Did you do testing on a comforter?
I did.
They've made a statement that you made up that test. Is that accurate?
No.
Do you have questions about whether she
They
made up
did.
the test?
Tattletales.
Okay, go ahead.
The testing that you did.
You can, so we can hear it on the mic.
He is so spicy today.
That you utilized for the comfort, was that a standard test that was previously approved and accredited?
So the physical testing on the instruments is,
On the comfort?
yes, but the preparation of the sample is unique. So how we figure out where to sample on the comforter, and then we do an extraction method to pull biological fluids and samples off of that inanimate object. But once that is extracted off of the comforter itself, it's run under the same methods that have been validated in the laboratory. So the testing itself is the only step that's unique is that initial preparation step.
And the preparation would be the gathering of the matrix from the actual comforter.
It's selecting the portion of the, in this case, a comforter, but selecting where you're going to be pulling samples from and testing. And then we prepare control samples in parallel along with the unknown sample being tested to show that the extraction is working properly, that all the steps in that process are working properly. So it's still following all those same scientific methods.
Once you get the actual matrix to test, but in order to remove the actual substance to test, that is something that is unique, correct?
It is unique in this case, yes.
And that is something that.
Why is that?
Why is that? Because they're so rare that we get these kinds of
That's not
cases,
your
and each case
job,
is different.
Judd.
It could be a bloodied t-shirt. It could be a bloodied napkin. I mean, we don't do DNA testing, but we only do the drug testing, but it's.
So you cut something off of something that was on the comforter.
We cut, squares, sample squares out of the comforter where stains were and in other locations where there were no stains.
Is there anything in that process that affects your findings?
We use the controls to make sure that they're not going to impact our findings.
Is there anything in that process that affects your findings?
Not that I'm aware of. I mean, we run the same internal standards and the same controls that we do with a normal blood sample.
Didn't you have to use another control in order to make the test work that wasn't actually assigned to this particular matrix?
We do that as a safety control.
Hang on. I don't know what matrix is.
Matrix is just
It's a
another
movie.
term for a specimen, whether it's blood, urine, it's just a general term.
What is your question?
The control that you developed originally didn't work, right?
No, that's incorrect. The controls worked.
What is it that you had to utilize from something else?
He's been doing that the
Oh,
entire trial.
I believe you're asking about the external control. So in addition to, we take control spaces on the garment when possible, places where there are no stains. We also do an external control. It's called a negative external control. That is an additional quality control sample to ensure the accuracy of the test and ensure that contamination isn't occurring in the laboratory, that our processes are working. It's just an extra safety and control measure performed.
But when the lab became accredited, they did not approve the method that you utilized to extract the matrix from this comforter, did they?
I'm not sure
You're a
that
lot of
that is
whispering.
under an accreditation. A forensic investigation like that isn't a category of accreditation.
Well, has that method ever been tested by your peers in terms of the one that you created, unique for this test?
It was peer reviewed and published.
I'm not speaking about for this test. Prior to this particular testing, that unique test that you created, has that, prior to this situation, been peer reviewed and or tested and or accredited?
Forensic investigations aren't under an accreditation category. So as far as I'm aware. The actual test itself, the test and the analysis is valid and accredited. The difference is the preparation, but a preparation may vary even on, say, a tissue sample. I may not use the same preparation for this liver tissue sample that I use for that brain tissue sample. So that's where that preparation step can vary a little bit, but it is done to get that biological matrix into a format that can be tested on those validated methods.
Because without you doing that, you can't test it. And my point is, there's nowhere in NMS labs, any of their systems, any of their standards of procedures that you can go to pick out
Why
what
are
have
you
to
yelling?
do in order to test this particular.
There's a general standard operating procedure for forensic investigations, but it is highlighted in that standard operating procedure that the exact controls and the exact process for performing that extraction will vary based on the nature of the sample being tested or what we're trying to remove that biological matrix from. So in the past, we've tested, I shouldn't say the laboratory has tested
Happy Friday.
things like tampons, used clothing, bedding, sheets. We've been asked to pull blood off of metal. So each one of those matrices is going to be very different, and the ability of us to pull that fluid or that biological sample off of that object is going to vary.
So if you had it, why did you have to create a whole new one? Why did you have to get one that's only unique to this case?
Because each one of these requests is different. Each one of these is unique. The stains aren't going to be the same. They're not going to be the same matrices. It could be blood, it could be urine, it could be vomit, it could be brain matter, stomach contents. And so this is one of those instances where you really have to use an experienced toxicologist or person to go in there and try and determine where that location is for the biological sample and pull out the proper sampling from the article of clothing or metal or wood or whatever it is.
So can you explain then why is the standard written as opposed to one that NMS normally utilizes? This is not what you normally do, is it?
That's my handwritten notes that I was taking contemporaneously, telling you every step that I did that day.
Okay. Isn't this what you had to use in order to extract it?
That was me writing down exactly what I did during that extraction process.
And that is something that was unique to this case that has not been peer reviewed and or tested.
It was technically reviewed. It was technically reviewed by another scientist at the laboratory.
After you create, I'm talking about.
This is this girl's reputation.
But I was still following my standard operating procedure. I was using a methanol extraction.
Me
I
neither.
was creating all the proper controls that are written in that standard operating procedure. I was following the method, but that method or that procedure gives me some flexibility in how I need to do that. So I was giving you very specific documentation of how I specifically did that.
If you could please just answer my question. Outside of the individuals who
You
tested,
just ask a question instead of adding what you want everybody to hear and what you think is very flashy. Just ask a question.
Your Honor, I promise I'm not doing that. I just want her
Don't
to answer the
outlive
question.
everything.
Has it, outside of the people in NMS, after you created it, is there anyone else that has peer reviewed this test so that it is
Somebody has to peer
accepted
review
science?
this test under 702.
If the court feels that way, I'm fine. I just want to be able to ask the question.
How could they peer review it when it just happened?
And that is my point as to why we were objecting to the
Have
validity.
you ever had any?
I'm shocked.
Person,
And have dry eyes.
any samples taken from a comforter that you found vomit on with some drugs in that you published or had peer reviewed
I mean, so this was included in a publication
afterwards?
after the test was performed, along with other forensic investigations that our laboratory has performed.
What you're saying is unique. is taking it from a comforter.
This stream.
It's not even that part is unique, it's just the having to do some extra steps to really prepare that sample is unique. I can't treat it just like a blood.
So what you do is that makes your results unreliable.
I don't believe so.
Anything else?
No, Your Honor, we would object and ask for a ruling from the court as to
Object based on what?
that it has not been peer reviewed and
What
or
hasn't
tested.
been peer reviewed?
The methods that she had to create in order to perform this, in order for it to
You've
move.
never done any samplings from any garments or blankets or
The-
blouses?
The laboratory has, that's what I'm trying to say, and we published on it. We share those duties.
Oh, you guys
So
aren't seeing Rose's
I
comments.
performed this one physically on a comforter. Other toxicologists within the company have performed them on other items of clothing. And so we did write up this unique preparation. It's not, and I wouldn't say it is unique to NMS. It's a similar method that's used for other types of unusual matrices. So dried blood spots, that's a very common test that's used in toxicology. It's a similar technique to that.
You've done that?
Dried blood spots I actually have in a previous job.
Does the state have any questions? On their objection, do you have any questions on this process?
Judge, I feel like she's fully explained.
Okay, you can step down.
Thank you.
The court is overruling my objection, Your Honor.
I've not gotten there yet. Will. 702, Dahlberg, GE versus Joyner, Kumho Tire. That list that's proposed under those cases is not all encompassing. It doesn't apply to every field. This lady, according to my understanding, sufficiently says that her findings are reliable just because there's having her notes that she's never cut up a comforter doesn't mean that her findings are not reliable and would assist this jury. So I'll allow her to testify about the comforter. All right, let the jury step back down.
Does he sound like he's having a stroke, or is it just me? If you're using your phone on vertical bubbles, you should see comments at the very, like, pinned comments that I'm sharing with the class at the top of your phone. If you are on a computer, it should be towards the bottom. Hold on, I don't want to miss this, but I want to. But Rose is commenting from her computer. She's using the horizontal stream, and unfortunately, YouTube hasn't picked up the ability for vertical and horizontal streams that are the same, streaming the same thing, have the comments merged together. So I have to do my best putting comments up on screen so you guys know what y'all are saying. And same thing, like I got one, my goal was to get 5 super chats. I got one from the horizontal and one from the vertical, and I can't combine them. So that's why I was just letting you guys know out loud, like, where we were.
All right, if you'll sit down with us just a second.
Yes. I did.
Sir, would you please tell us your name and spell your first and last name for us?
It's Detective Adam Reese, ADAMREESE.
And Detective Reese, by whom you employed?
Metro Nashville Police Department.
How long have you been, pardon me, with the Metropolitan Nashville Police Department?
18 and a half years.
And were you working in that capacity in the month of February 2023?
Yes, I was.
What were your duties or assignments in February of 2023?
I'm a detective in the homicide unit and was at that time.
Get to the point of why you're on the stand at this particular time on about February the 27th.
This is a great question. Hold on one second. I do want to highlight this. Vamp, I love this. So Vamp said, is this case located in the Deep South? The vibe is not giving Southern hospitality, but the accents are giving Fogham Leghorn. LOL. So interestingly enough, that state, I would say, is extremely Southern hospitality, except for 2 areas, Knoxville and Nashville. That's just tourist America. So I hope that answers your question. If anyone in the chat has something to add, I would love to hear from you. But I think that's a good synopsis of that, in my own opinion. Here's this cop again on his day off, I guess.
2023, had you become involved in an investigation concerning a young lady named Jade Benning?
Yes, I had.
And pursuant to your duties and responsibilities in respect to that case, did you have opportunity to go to Vanderbilt University Medical Center to collect an item of evidence?
Yes, I did.
And you recall approximately when that was?
It was on the 27th at approximately 4 p.m.
And where did you go when you arrived at the hospital?
I went to the room that Jade Benning was hospitalized in.
What was her condition, at least as far as you physically seeing?
I don't.
She was unconscious. I don't recall if she was intubated, but she was not in a position where I could talk to her.
Were there medical personnel present?
Yes, there were.
Okay. Were her family, was her mother present?
Yes.
And who was that?
Bridget Burks.
It's pretty southern.
And was there a reason for you being there and collecting evidence?
Yes, I was advised to come collect a urine sample directly from Miss Bennett.
And did you do that?
Yes, well, a nurse
I was going to say,
collected
you collected
it in my presence and then handed it to me.
And how was that collected in your presence? Just what did the nurse do?
She collected it from a catheter bag where Miss Benning's urine was collecting.
And what, if anything, was it collected in?
It was collected into a specimen cup.
And what did the nurse do with that specimen cup?
She put a lid on it and gave it to me.
And what did you do with that specimen cup?
I placed it in an evidence bag, sealed it with the adhesive, evidence tape label, and initialed it, dated it, and wrote the time down that it was sealed.
Okay. And was there documentation of that generated?
Yes, I mean, it was. Yes, there was what we call a Form 110, which is a property and evidence submission form.
No objection.
All right, if I could have this group of 5 photographs be passed to you, Detective Reese. Detective Reese, you're being handed 5 photographs. Would you look at those and see if you recognize what is depicted in each of those?
Yes, 4 of these is the bag, the biohazard bag that the item was placed in. From 2 of them are before it's placed into an additional bag, and then the additional bag looks like it was probably applied by our property and evidence clerk that I gave the sample to. And then the item that's a document is a photo of the property and evidence submission slip that I completed at the time that I submitted the urine sample.
All right, I would tender those as the next numbered exhibit, I believe 36. Okay, all right. And of course, permission to publish them briefly and ask.
You want these?
I think just here.
Okay, let him.
I have to itch my ear and it's going to pause this. So sorry.
I put up what I believe I just arbitrarily labeled A, which is now 36A, but what
in the world?
are we seeing in this photograph?
That is the property and evidence bag with the sample of urine that I just talked about placed inside.
Okay. And I believe you referenced there may have been additional labeling because the case went on from the property room.
Correct. So I placed it in one bag initially that was labeled for biohazard, and I sealed that with evidence tape. And then when I took it to the property room, they put it in an additional bag, and this barcoded label you see here is applied by them.
So Is that the same specimen cup of urine that you watched the nurse get out of the catheter bag?
Yes.
And this is the, I might need to zoom in a little bit on that, but can you see anything that you recognize as being your handwriting?
Yes, there on that blue evidence tape. It's a little bit washed out by the light, but I can read it. It's a AR, which is my initial, and then a 2/27/23 for the date of February 27th, 2023, followed by 1603 HRS, which is 1603 hours military time, 4:03 p.m.
You referenced there was a photograph or two before the real packaging took place. Is that one of those, a clear bag?
Yes.
And then as things went on, biohazard added
Yes, and that's just the other side of the bag.
the other side. And is this the one that indicates collection time, case number, when it was submitted to the property room?
Correct.
And when you took it to the property room, what did you do with it, this item of evidence?
I actually handed it directly over to one of the property evidence clerks.
And is that what generated this document?
Yes, yeah.
36?
I completed that document on the computer, submitted it, printed it, and turned it over to them, and they placed it in cold storage.
What in the world is this? What are you guys doing?
Those are my questions relevant to this issue.
Okay. Any questions from the defense?
No.
Thank you. Next.
Amanda Sweet.
You guys are gonna have to get ready with me for this fundraiser, since I'll probably be on stream until then. Or close enough. Anyways. Who's she?
I did.
Why does that look like Savannah Guthrie if you don't look very close?
Hey, Greg. Could you please tell us your name
Amanda Sweet.
and please spell your first and last name for us?
Amanda, Amanda, Sweet, Sweet.
I want that last
Who
name.
are you employed?
I'm employed by the Metro Nashville Police Department in the crime laboratory.
And what do you do in the Metropolitan Nashville Police Department Crime Laboratory?
I am the Forensic Services Division Director, which includes the crime laboratory and our crime scene investigation unit.
How long have you been employed by the Nashville Police Department?
Since 2013,
And when you were first became a member of the police department, what were your duties?
I was hired to be the toxicology unit supervisor and to help start the Metro Nashville Police Department Crime Laboratory. So there, my duties were to oversee hiring of staff, procurement of instrumentation, method validations, and things to be able to do toxicology analysis. But then in 2019, I moved
My
into a
assumption is that she
managerial
will
role as an assistant
be
director, and then as the
the
crime lab
first
director, and most recently the forensic services division director.
or like the second witness on Monday because they weren't able to get to her today because of this morning's
Where is
stupidness.
the crime lab located?
It's located above the Madison Police Precinct in Madison, Tennessee, northeast of Nashville.
And what types of examinations can be performed by the crime lab?
So we are considered a full-service laboratory that consists of several different forensic disciplines. We have latent fingerprints, tin print, firearms identification, drug identification, DNA testing, and toxicology testing.
So why didn't they use them for toxicology?
Are there some things, though, that the lab does not do and are
Yes.
outsourced?
Yes, so even though we're a full-service laboratory, for example, our toxicology unit specifically does DUI testing, so driving under the influence analysis. And the best specimen for that type of testing is blood. So our panels for testing are limited to drugs that you would see in impairment cases. So anything outside of the realm of DUI testing, we will sometimes send to a private laboratory like NMS laboratories because they can do testing on different matrices like urine that we're not capable of doing just because it's outside of our scope of testing.
In pursuant to your duties and responsibilities, are you essentially a supervisor over what comes in and what goes out of the crime lab?
Yes, so as the division director, the crime lab falls underneath me in all those disciplines. Those supervisors report to a crime lab director who ultimately reports to me. So I oversee the operations and what samples come into the laboratory, what evidence we accept, and make sure that it's within the scope of testing that we can perform.
And are there certain protocols as far as accepting evidence into the crime lab?
Yes, we have an evidence receiving unit that has their own set of standards of how evidence is received and accepted. And we also follow accreditation guidelines. Our laboratory is accredited by ANAB. So we follow a set of national guidelines on how we receive evidence, how things are documented, how reports are issued from our laboratory.
And is that documentation retained with each specific case?
It is. We have a software called Justice Tracks in which we image all evidence that's received. That's where we have all of our notes, all of our analytical testing results, and our reports are issued through that system so that everything is tracked and documented.
And specifically, with respect to your laboratory case number 23-001060 involving Ms. Jade Benning, have you reviewed the materials and chain of custody, everything to do with that case as far as the crime lab is concerned?
Yes, I have.
All right, this time, could she be handed exhibit number 9?
9.
It's the previously introduced.
I found a whiteboard that's actually glass.
Is it
That looks
Miss
really
Sweet,
cool,
Officer Sweet?
but it's more.
Miss Sweet, I'm not an officer.
That's what I was gonna ask. Are you a sworn officer or
I'm a civilian within the police department. All crime lab employees are civilians. Nobody are sworn in the police department. Crime laboratory.
That's interesting.
you've just been handed our exhibit 9, it's the exhibit 9 to this proceeding.
Hi, Grace.
Did you look at that document and see if what is depicted in those photographs, if you recognize that?
Yes, I recognize this as a blood alcohol kit that we would routinely receive in our laboratory. You can see it has the Metro Nashville Police Department property and evidence label on it. And we routinely receive these for DUI cases.
Jury's previously seen these, so I'm not gonna read
You're
it.
so welcome. Please make sure to like and subscribe.
Turn to the, I'll look this up, the next to last, well, third from the last page. Alcohol.
No, it actually has a very good system to, like, you have to drill it into the wall, but all of these have to be drilled into the wall. Here, I'll try to post it.
It's something, it's coming back up hopefully here now. Again, it's previously introduced, but you recognize that document?
This one.
Yes, I do.
And does that indicate alcohol toxicology request?
So this is a form that is located in the kit that we request the officer submitting the kit fill out that has some information regarding the case. And in this case, you can see where there are 2 blood tubes that were received with the specimen date collected and time collected. The registered nurse that collected the blood sample, and they are requesting an alcohol and drug screen on this case.
Now I'm gonna go down to the, where it says for laboratory use only. What is that part of the document reflecting?
So the top half of the document is where the officer will fill out the form. The bottom half is once we receive it in the laboratory, the technician that receives the blood actually opens the kit up, will document the specimen accession date and time. So that's the date that she received this into the actual toxicology unit from our evidence receiving unit. The time that she opened the kit, she's indicating that the kit is sealed, what the unique crime lab number that was assigned this kit is, her name, and what specimens were received. So in this case, there were 2 blood tubes. They were labeled 001-01, 001-02, an approximate amount of blood in those. And these were full tubes, so there were 10 milliliters of blood.
And down, excuse me, at the very bottom of the, is that a picture of the tubes?
Yes, it is. That's a picture of the tubes that were received within that kit.
You say received, how does that take place? From the Metropolitan National Property Room, or where it's stored, how does that get to you? And is that accounted for in your chain of custody document?
So we receive samples directly from our property and evidence storage location. An officer will bring evidence out daily to the laboratory and hand it off to our evidence receiving technicians to log it into our system and to store it in the evidence in a vault until it's ready to be analyzed by a scientist. The property room is also ran by the Metro Nashville Police Department. It's located off of Trinity Lane, and they will go around to police precincts daily and collect evidence that is submitted, or people can drop evidence off at the property room directly.
Can we say people can drop evidence off?
I'm sorry.
Would it be law enforcement?
It would be law
officers?
enforcement. My apologies. Yes, it would be law enforcement officers would drop evidence off at the property room.
Just briefly show you the last photographs. Again, there is a little bit of a glare, but can you see what is depicted?
Yes. This is a copy of how the tubes are currently located in the laboratory. So the first page was how the tubes were received from the hospital with the hospital labels. this is an image of the tubes once we received it, once we put our labels on it and how it's being stored currently.
There appears to be a little something that looks yellow. You can see on one of them. Does that have any significance?
Yes, so that is a return label from NMS Laboratories. So we kept tube 1 in-house to perform an alcohol analysis. We shipped tube 2 out to NMS to perform drug testing on this sample. So tube 2 came back to us with the return label from NMS Laboratories.
I think that's all I was gonna ask you about that, if you want to set it aside. But do you have your chain of custody report, copy of it with you?
I do.
And council's been provided a copy of this. You referenced that one of the tubes was designated as 00101, is that correct?
Yes.
And the other was 00102?
Yes.
Now, does it start off though as just being collective 001?
That is correct. 001 is the actual kit. It's given that number, and then any item within that kit is sub-itemized and given a unique number. And that's where the 001-01 and 001-02 come into play, the two separate tubes.
When you say kit, is that the collection box?
Yes.
Evidence box. Okay. And does it indicate when and from whom that item came into the crime lab's custody?
Yes, the kit was received by the crime laboratory on February 27th, 2023 at 10:25 a.m. by Daryl Osment, and that is an officer with our property room.
And was it then logged into the crime lab?
Yes, it was received by Barbara Reed, and she is an evidence receiving technician with the crime laboratory. And she, once she received it, that's when she would image the kit, and then she would give it a unique crime lab number, and then it goes to a storage location, which is a vault within the evidence receiving unit.
As far as security, what type of security is there on items of evidence that come to you for examination?
So our crime lab has essentially 3 levels of security, the vaults being the most secure. There are other people within the police department that have access to the crime laboratory hallways, but the units are locked down specifically to crime lab employees. And the vaults are specifically locked down to people that work within that unit, myself and the crime lab director only. So it is very limited access.
Now, does the chain of custody indicate that 001-01, what happened to that tube after it was removed from the box and separated?
Yes, so those tubes, once Jessica Brooks, who works in the toxicology unit, she's a senior scientist there, she retrieved the kit from our evidence receiving unit. And that's when she took custody of it to actually open the kit, verify that it was sealed before she opened it, and to take the images that we have already referenced of the blood tubes and the form that was within the kit. And then after that, she puts it into a refrigerator that's located within the toxicology unit, also in a vault location that only is accessible to the people in that unit, myself, and the crime lab director.
And what happened to that? Was it relabeled the 001-01 and the 001-02 at that time?
Yes, when Jessica took possession of the kit and itemized the blood tubes, at that point they received our unique crime lab label with those with that description on it.
And would it also be with your unique crime lab number?
Yes.
And what, if anything, occurred with 001-02?
It followed the same steps where she took images of the evidence and she put a crime lab label on it with our unique crime lab number and labeled that second tube 001-02. And those are also on the images that we previously referenced, where you can see the unique number on each tube.
I hope
And what, if
everything's
anything,
okay.
happened with that tube, the 02? Was it examined by a general lab or referred out?
02 was the tube that was sent to NMS laboratories. 01 is the tube that remained in-house for the alcohol analysis that was performed.
Now, are you familiar with NMS labs?
I am, yes.
And how so?
We have worked with NMS labs for approximately 6 years to provide some testing for our toxicology unit. We had to use them for testing. We have to make sure that they follow the same accreditation standards that our lab does as part of our accrediting body requirements. So they are
Someone
also
messed up.
accredited by ANAB, so we know that they follow the same set of guidelines that we would follow in testing. And we also had to get approval from the police department to send cases to NMS laboratories for testing.
And was 02 sent to the NMS labs?
Yes, it was.
And when was that done?
That was sent to NMS laboratories on March 6th, 2023 at 10:45 a.m. That's when it was packaged and scanned out to NMS laboratories. And in this process, it's going to be put in a sealed kit within a sealed box. And we have a FedEx tracking label so we can see where that is in the process.
And with respect to that particular item, after it is FedExed to NMS, did it return to your possession?
Yes, it was returned to our laboratory from NMS Labs on March 30th, 2023, and we took possession of it at 3:09 p.m.
And where are those 2 tubes today?
Those 2 tubes are currently being stored in a hold refrigerator within our toxicology unit at our crime laboratory.
Were there other items submitted to the crime lab with reference to Jade Benning's case?
Yes, there were.
Was one of those urine specimen collected by Detective Reese?
Yes.
And did it go through the same protocol as far as being brought to the lab, checked in, and given its own number?
It did.
And what was that particular item? What number was it given?
The specimen cup of urine was given item number 002.
And, pardon me, when was it received into the crime lab?
That was received on March 2nd, 2023 at 12:21 p.m. from our property room. The same officer, Daryl Osment, also brought that sample to us, and it was received by Barbara Reed, our evidence receiving technician, and then placed into an evidence freezer for storage.
So by being an evidence freezer, was the urine sample frozen?
They're
Yes,
not
the store
in
was
court
frozen at that time.
tomorrow, right?
And is that protocol?
Yes.
Policy?
Because they did that in the
What was
Alaska
the progression
trial.
of that item
So,
from the freezer?
And
so that item, the original container that the urine came in stayed within our laboratory, but we took an aliquot, a portion of it, to send to NMS laboratories. We did not want to send the entire specimen. We wanted to preserve some at our laboratory. So it was itemized as the cup of urine was 002-01, And then the aliquot taken to send to NMS Laboratories is 002-01-AA.
Shut up, for real?
Could you spell that and tell us what that is?
So that's essentially taking a sample of it. We took a portion of the urine from the original cup so that we didn't send the entire sample out in case we needed to do additional testing in the future. So it's just a portion of it that was put in a separate vial and given a separate label with the 002-01-AA to recognize that it came from 002, but it was a separate portion taken out, and that followed its own chain of custody that was being sent to NMS Laboratories so that we could track the original container as well as that sample that was taken.
Did the original container ever leave Metropolitan National Crime Lab?
The original container never left our crime laboratory. It just moved from an evidence vault into the toxicology unit for storage in a refrigerator there.
And is it still there today?
It is.
Now, with respect, though, to the sample, what happened to it, the one that was taken from the original container?
So that portion of the urine was sent to NMS Laboratories on March 6th, 2023 at 10:45 a.m. That's when it was scanned to be put in the box to be sent via FedEx.
Same procedure as they discussed previously, correct?
Yes, it is.
And, pardon me, was that ultimately received back from NMS, or did they keep it?
That was received back from NMS on March 30th, 2023 at 3:09 p.m. And then it has been stored in a vault location within the toxicology unit since it was received back.
Josh, what are you hearing from your people, your sources? Is there going to be court tomorrow?
Photographs documenting what you just testified about with respect to the items and their receipt into the crime lab.
Yes.
If I could ask this be passed to witness and counsel.
I mean, it might be a good opportunity. I'm certainly not going to complain if that's what they're planning on doing.
He just want you to look through it and see if you recognize.
Oh my God. Okay. All right. Thank you. Yep.
Urine specimen we've just been discussing.
AirPod went out. I don't like what? I'm going to mess it up again.
Yes, yes.
Or can you give the,
As those be marked as the next way to exhibit and allowed to publish. 30 seconds.
Go ahead and make 30s.
Here's already seen one or two of these, but I'll just. And does that appear to be standard Metropolitan Police Department packaging and have the documentation?
Yes, it does. You can see that the larger label, that is our property room label where it went there prior to being submitted to the laboratory. And then the label kind of on the right with the barcode is the crime laboratory label with the unique crime laboratory number. And it's hard to see here, but it says it's 002 is the number.
And is this picture of the backside of the bag?
Yes, it is.
seen this, but picture of a bag, of the urine container in the bag prior to it being labeled.
Yes.
Yeah, I agree, Grace. You're not wrong. All right, so streaming all day today, streaming tonight, streaming again tomorrow. And this weekend, like Sunday?
And reference to barcode and the identifying information, does this also contain the crime lab number, case number?
It does. That is our crime laboratory label with our unique crime lab number. And you can see now the outer packaging was labeled as 002, but then now the sub item for the actual urine is 002-01. So that's the label that went on the actual urine.
The one that went into the freezer?
Yes.
And what is this a photograph of?
This is a photo of the aliquot or sample of urine that was taken from the original container that was going to be shipped to NMS laboratories. So you can see it now has a crime lab label that the submission is 002-01-AA to represent that it came out of that original urine container, but that it is a separate sample so that we can track its movement specifically to NMS laboratories and back to our laboratory.
And the last one.
That is the same urine now with an NMS. That is NMS's barcode that we're looking at there.
And is that how it would have looked when it came back to you from NMS?
Yes. So once NMS receives it, they will place their own label on it. And this is routine how we receive samples back from them with their label.
Tip of this back. 37. I believe you previously said when that came back, it went to the cold storage. Is that correct?
Yes, it's in a storage location within the vault within our toxicology unit.
Thank you so much, Josh, for letting me know.
And how, if at all, do you know that it is still there?
I, last week, went back and I visually looked at it to verify that it was in there. I also asked a evidence tech or a forensic scientist within the unit to take photos of that evidence and to show the state that it is currently in the laboratory. So on June 18th, I asked her to re-image everything in the case to show that it was located in this refrigerator number 6. But before she did that, I went back in the refrigerator and looked at the evidence to verify that it was in that location.
Is there any standard retention period for, let's say, blood that comes in for a DUI case?
For routine DUI cases, we will keep samples for 1 year, and then after that year, they will be destroyed unless we receive a hold request. But anybody, the defense counsel or the prosecution or an investigator can always send us an email requesting a sample to be held. If they think that court might be coming up, it might take longer than that 1 year. So we will routinely hold cases upon request if necessary.
And was there such a request made in this case?
Yes.
And you referenced having someone take pictures of the items that you visually saw were still there.
Yes.
If I could have this council's.
Oh,
If you can take a look through those and see if you recognize those photos.
Yes, I do.
I believe that would be 38. Publish at least one or two of these. Where is the refrigerator located where these items are?
It's within the vault of the toxicology unit.
Is it in a secure part of the building?
It is, it's badge access only, and only the individuals that work within the toxicology unit, myself and the crime lab director, have badge access to that vault location.
Put up one, and this appeared to be well, you tell us, what are we seeing here?
This is with the refrigerator door open. This is the location where the case is being stored in the refrigerator.
And one thing I'm gonna try to zoom in here, if I can. There in the corner, what do you see there?
So anytime that we take an image and upload it into the case file, it is, an annotation is burned into the image. So this represents the case number, the technician that took the photographs, and the date that she took the photographs.
And June 18, 2026, last week.
Yes.
And does that image appear on any and every photograph of everything that's at the crime lab?
It does, because our software actually puts that in there, whoever's logged into the computer that scans the image in. So it's at a timestamp that's put by our software on that image.
So if somebody scans that picture, we know the date.
We know the date.
So this one just for the sake of. So we see the word hold on that.
They write that on the bag just to make sure that it doesn't get destroyed.
Okay. That makes sense. Thank you so much, Josh.
So we can see only.
Oh, God, did you hear that? That was my hip.
Does this also appear to be what you talked about, the tubes that are still there?
Yes, and you can see the actual crime log number, the CL-23-001060. You can see that on the labels within that bag, within the hold bin.
It's like a hostage video. They need to have a newspaper up next to these files.
Anything about the handling of evidence involving this case out of the ordinary as far as using FedEx, NMS, retaining the evidence? Was it handled according to your protocol?
Yes, this was handled according to our protocol. I've thoroughly reviewed our chain of custody and have seen no issues or discrepancies with our ship date, when NMS received the samples, when they shipped them, when they returned back to us. And we routinely use NMS laboratories, so we will make shipments to them almost every month routinely. So this is a very common process for us.
And would that be true for any other items that may have come into the crime lab regarding this case and then gone out for further testing?
Yes, we also outsource cases for DNA to another laboratory, and they follow the same standard protocols.
Oh.
And larger items or items, containers, do they eventually go back to the property room?
So it depends on the type of analysis requested in the unit. Toxicology cases do not go back to the property room. They stay in-house for 1 year, and if we have no hold request, then the evidence will be destroyed after 1 year.
Those are my questions, John.
My question.
Yes, thank you. Good afternoon, Ms. Sweet.
Good afternoon.
Saw a whole bunch of pictures that just came up, and I'm not gonna ask you about individual pictures, but one thing I was kind of noticing as they were coming across is we're talking a lot about labels and how things were labeled, and that seems to be a very important part of what you do and what the crime lab does. Is that right?
That's correct.
So you take a lot of care to make sure things are labeled accurately.
Yes, we do.
And there's a lot of different kinds of labels too, is that right?
We have, in our laboratory, our labels are pretty uniform on what we put on the case as far as a crime lab number and specific item number.
Well, let me clarify that, because that was kind of a bad question. I noticed different types of labels, like you have a label for your crime lab, right?
Yes.
And NMS Labs has their own label.
Yes.
There's sometimes tape across the top that says evidence on it. That's a kind of label, right?
That would be, I would consider that a kind of seal.
Okay,
Yes.
seal, and that's important too, right?
It is.
There was even on one of those outside bags that someone wrote in marker "hold" on it, right?
Yes, that was somebody in our toxicology unit.
That's a direction, but that's kind of a label too, right?
Yes.
So there's all, and I'm being
Josh,
a little
are
like,
these
you know,
yours
big picture
sequestered?
here, but there's all kinds of labels that help people know what to do with certain kinds of specimens, right?
Yes,
And it's important that those labels are accurate, right?
it is.
And part of your job, you're maybe not doing all the labeling, but you're kind of overseeing, making sure that everything is done in the right way, or that your lab is operating in the right way, right?
Yes.
We'll be able
part
to
of your-
zoom
if you're a
through this
manager, right?
next
Yes.
break.
And then, am I right? And did I understand it that in your managerial role, you're kind of like a in-between person for communications between these different entities?
I'm an in-between person communicating with our police department, with other laboratories and agencies, yes.
Sure, so you work for the police department
Yes,
in the lab, but still for the police department.
yes,
Sometimes you communicate with the actual detectives or whoever's investigating the case.
yes,
Sometimes you communicate with NMS Labs.
yes,
Sometimes you communicate directly with the district attorney's office.
yes,
And as part of that, you're one of the people that helps make sure everybody knows what needs to be done at various parts of the investigation.
yes,
So if NMS Labs needs some information on what kind of test needs to be done for what specimen, are you the person that helps kind of connect that information between agencies?
Myself or the toxicology unit supervisor specifically would probably be more involved in that in most scenarios with our DUI cases. But they are the ones responsible for what testing panel is being ordered.
So for example, and let me know if you remember this, I think we even maybe had a call about this several months ago. There was a situation in this case where there was some testing requested and some testing not requested. Do you remember that vaguely? And I'll ask more specifically if that helps.
Yes, if you could, that would be helpful.
So do you remember there was a comforter in this case that there was some testing done?
Yes,
And some initial, we don't have to talk about the reasons for the specific results necessarily, but like initial panels suggested that there was cocaine, fentanyl, marijuana, and amphetamines at a very kind of low level screening. You remember that?
I do remember that.
And that there was some subsequent communications about what do we want further testing on. And you were involved in those communications, right?
I was with some of the specimens. I don't know, I'm not aware of all the specimens, only what came through our laboratory and was sent. But I was involved in some of what was being tested as far as ordering the panels.
Sure. And ultimately the decisions were made, we're just going to test for cocaine and fentanyl, right?
Yes,
And there were probably reasons for that. There was a lot of communication surrounding that. And that, you may or may not have been the person making that decision, but you're involved in the communications, right?
I was.
And those communications are really between kind of the toxicologist and maybe the DA's office and law enforcement who are investigating the case, right?
Yes,
And you are kind of involved in coordinating that.
I was.
And ultimately, you did end up being kind of present at like this final team meeting before a charging decision was made in this case, aren't you?
I was involved in a meeting to discuss some of the samples and what was ordered and things like that, yes.
And that was sort of with the detective and the district attorney's office, and you were kind of there to help explain what was done in toxicology in this case, right?
Yes, what samples we had received, what samples had been sent out, in regards to what we had in our life.
What happened? That was weird.
Kind of there to help explain what was done in toxicology in this case. Right?
Yes, what samples we had received, what samples had been sent out in regards to what we had in our laboratory.
Thank you. Those are my questions.
Oh.
Can you redirect?
No, Your Honor.
Thank you. Thank you. Who would the next witness be?
Judge, the next witness would be Dr. Mithen. I do recognize the hour. If I might suggest a possibility, she could clarify the collection time for the 2 CFSRE reports.
Okay. If you're ready to call her as a witness.
I am, but
Okay.
I am also understanding of the time.
Or we'll go till we finish. All right, ladies and gentlemen, if you'll step down the hall, we haven't taken the break that you did, so we'll take a short break and then come back to this last witness for the day.
I mean, what do you say to that? Dag nabbit, Lacey. No. Sorry, guys. Okay, we're good. We're good. Okay, so what we have going on is that I just found out that there is going to be court tomorrow unless something radically major happens between now and the next witness finishing. So make sure to turn on your notifications on my channel page. You see the bell, you click that and you select all. Whenever you subscribe to someone's channel, when you click on the bell, it'll say personalized usually. So this makes sure that you receive all the notifications, which don't worry, it's like only when I go live. So that's interesting. I wonder if he's gonna do court on Sunday as well. But tomorrow's gonna be wild with his ex-girlfriend, Miss Arkansas. I wonder why they did this. Like, what was the intent behind speeding this up as quickly as possible? Are they like having trouble with this judge's docket? Someone's sick, retiring.
Do you swear the testimony you're about to give? I do.
The audio is court TV's bad. Oh my God.
Good afternoon, Dr. Naivety. Could you please state your full name for the record?
Carrie Midthun.
And could you please spell your first and last name for the court reporter?
First name is Kari. Last name is Midthun.
Where are you employed, Dr. Midthun?
NMS Labs.
And can you describe what is NMS Labs?
NMS Labs is a large private toxicology laboratory. They specialize in both forensic toxicology, so driving under the influence of drug investigations, postmortem toxicology.
All right, for those of you who might randomly be popping in right now, just going to let you know what you're watching. This is day 4 of the Blaise Taylor trial taking place in Nashville, Tennessee. It has been a long day, but we have learned a lot about all the medical stuff. The judge has decided that we're going to proceed with witnesses until we're done. And excuse me, I just found out that we are the star witness that was supposed to take the stand today has been moved to tomorrow. So make sure to turn those notifications on, like I said a few minutes ago. And if you wouldn't mind, please make sure to double tap your screen if you are watching from your phone, or if you are on your computer, make sure to hit the thumbs up button. If you are, if you are watching on replay, please make sure to hype up the video. All right, with that being said, we will proceed with what we believe to be the last witness for the day.
Testing, specialty testing for things like metals, volatiles, special matrices like hair, neonatal testing, and then they also perform clinical testing. So testing forwarded from hospitals, testing forwarded from reference laboratories, things of that nature.
And what is your position at NMS Labs?
I'm a forensic toxicologist.
How long have you been in that position?
I've been at NMS for more than 6 years, but working in forensic toxicology longer.
Where were you at before NMS?
Immediately prior, I was at a company called United States Drug Testing Laboratories. It's out near Chicago. It's also a toxicology lab. And then in addition to that, I worked for several years as a forensic scientist at the New York State Police Forensic Investigation Center.
And what is your background, kind of training and experience to be a forensic?
Sorry. I keep forgetting about this.
So the training is very specific and on the job, but then in addition to that, I have an educational background that includes bachelor degrees in both chemistry and biochemistry from the University of Wisconsin at Madison. And then in addition to that, I earned a Master of Science and PhD in chemistry and chemical biology from Cornell University in New York.
It's a holiday.
And can you approximate how many specimens that you have analyzed over the course of your career?
At the bench, thousands. In the capacity of a case reviewer, tens of thousands.
And have you been previously qualified as an expert in toxicology?
Yes.
And have you, I guess, how many states have you been qualified as an expert?
I have no idea off the top of my head. It's more than 10.
Yeah.
This year alone, I've testified in California, Montana, Florida, Pennsylvania. Trying to think if I did any video testimonies. I did a video testimony with the state of Washington.
And you were qualified as an expert witness, is that correct?
Yes.
Did you analyze samples related to Ms. Jade Benning?
I did.
At this time, I would tender Dr. Mitten as an expert in toxicology.
No objection.
Okay, all right, again, this witness will be allowed to give an expert opinion. You can place such weight as you choose to.
You guys, I gotta go get a drink.
Okay.
Dr. Mitten,
I'll
are
be
you
right back.
familiar with CFSRE?
Yes.
And can you describe what kind of experience do you have with that lab?
So NMS Labs and CFSRE, which is the Center for Forensic Science, Education and Research, they are owned by the same family of companies and or families. So the NMS side is more of the for-profit routine testing side. So individuals and agencies submit their samples. We perform the testing as a for-profit. The CFSRE side is more academic and research-based. So it's just a separate side to kind of two different heads and for different purposes.
And are you familiar with Dr. Alex Koltuski?
Yes.
Did you forward any samples to him during the process of analyzing different samples from his bed?
The laboratory did, yes.
Not you personally?
Not me personally, correct.
And can you describe, how does that work? If someone wants to have some type of sample tested, do they request a certain person? Like, do they request that it be sent to you? Or how do those assignments get made?
It can happen in many different ways. It can happen during the course of testing for an NMS case where we've identified a possibility that there's a drug or something in the background, and we don't have the capabilities to perform the test, but we think CFSRE might have that ability. So then we would ask permission from whoever submitted the sample. If they are willing and okay with it, we can then proceed to assist with transferring the sample or a portion of the sample over for the additional testing. Sometimes the request is made without us having to reach out. They just indicate that they would like that sample sent over. It happens organically, it just depends on the nature of the case.
And how many scientists from NMS worked on different samples related to this Benning?
I have no idea what the total number is. NMS works in a very departmentalized system. So we have different departments performing different functions. So one department may just perform the alcohol testing. Another department may just perform the screen test. A separate department may perform some of the additional tests, such as a marijuana cannabinoids test. And so all of those different pieces are working simultaneously. When that finishes, it comes to my department, which is the toxicology department. We perform a final case review. So we're bringing all those pieces back together. So before the case ever reaches me, it could have touched dozens and dozens of individuals, depending on how much testing was required.
But were there other toxicologists that performed the same testing that you do that tested different items related to Ms. Benning's samples?
Yes, there were at least two others. Actually, there were a total of 5 that were involved in the case review for the number of cases that came through with that naming.
And have you reviewed and done your own testing for any of the samples that we're presenting in court today?
I re-reviewed 2 of them by request.
And the others, you were the original examiner, is that correct?
All but 2 of them, all but 3 of them. One of them went out without a signature. It was a clinical request that did not require a forensic toxicology review. And then 2 separate work orders were reviewed by other toxicologists within the department.
I am going to ask that this witness be handed Exhibit 34. And Dr. Mitten, I'm also going to hand you several pages from your litigation packet related to NMS Work Order 230788891. And do you recognize those two items?
I recognize the NMS final report.
And does the NMS final report for work order 23078891, does that match the CFSRE report?
There is an indication here, yes, that they refer to each other, yes.
And there were samples from NMS that were transferred to CFSRE, is that correct?
Yes.
And these two things correspond?
Yes.
There was a page denoted with a post-it in the litigation pack paperwork.
Yes.
Can you describe that barcode in the middle of the page that is titled Analysis Requisition?
I'm sorry, I'm not seeing analysis requisition. On the page with the yellow?
Yes, at the top of the page, does it say analysis requisition?
Oh, I'm sorry, yes, it is this, I thought the sticky note was pointing me towards something, so yes, the top of the page.
The note is on the page that has that title.
Oh, good.
The sticky note is right under the barcode. Can you describe what is that barcode?
So this was a barcode placed on the requisition or submission form by the agency prior to it.
Where's my?
So it's some form of a sticker barcode placed by the agency prior to them sending it to NMS. So it is adhered to the form, and then this is a photocopy of that.
And can you read out the barcode specimen ID number that's under the barcode for the record?
Yes, there's 23-056-007049A.
And can you also read for the record what the patient name as well as the date of birth is on this requisition?
This is going to pause the video
So
for
the
a
sample
moment.
ID patient name was listed as Mayotte, VUH, with a first name of Stat Fat.
Coco.
And at this time, I'm going to ask the witness be handed 2 pages from Exhibit 11, is page 70 and page 279.
Coco.
And there is a sticky note on the first page. Is there a corresponding specimen ID number on that page 70 of the medical record?
So there is a specimen collected with a test ID noted that matches that number I just read from the barcode, which matches the same number that was on the sticker of the requisition form.
And is that specimen collected at 22:59 on February 25th of 2023?
According to the timeline here, yes.
And that was submitted to NMS Labs for the NMS work order 230788891, correct?
Yes.
And then that sample was then transferred to CFSRE, is that correct?
Yes, no testing was performed on that sample at NMS. It was transferred directly over.
And Your Honor, at this time, I would ask that the NMS litigation packet be entered as the next numbered exhibit. And I would also ask to publish the first page of that along with previously introduced exhibit number 34.
Okay, cool. Let them pull out the exhibit they're wanting more.
Thank you.
So, yeah, is that the one you're wanting more? You said you wanted the litigation package
The one in
marked.
your
Where
left
is
hand
that?
is the one that I would like introduced as an exhibit. and
All right,
then I
that'll
just
be 30.
Wanted her to retain the 2 pages with medical record numbers, so we don't have
You
to deal
have
with
that.
the binder.
Okay, go ahead.
Is there anybody that can turn on the system?
Yeah, switch it over. Switch it to, you want it on the card?
I want it on the computer.
Thank you, doctor, so much. The reminder that we should all have gone to the bathroom.
And Dr. Mitten, again,
And for those that heard me talking about the fundraiser earlier, I hope I am done with this by then. But if not, then I just messaged her.
You have
Tripping
your
over my
work order
words.
on your report, and then that same work order number is on the CFSRE report, correct?
Correct.
And this is for the urine specimen from Vanderbilt University Medical Center, February 25th, 2023, collected at 22:59, and you have matched up that specimen ID, is that correct?
Correct.
And this is for patient Jade Benning, date of birth, March 6, 1998.
That was the day she died.
It's at the top of the
2023,
medical record.
March 6th.
Oh, yeah, I'm sorry. I was gonna say, it's not on either of the CFSRE or NMS lab reports at this time, but it does, yes, correspond to the same medical number on the top of the medical records for Jade Benning.
And you have page 70 of the medical record that gives the collection time, as well as page 279 of the medical record that lists that same specimen ID, and it has a reference to the NMS labs report and has your signature on it. Is that correct?
Yes.
Thank you. And I can ask that the witness be handed exhibit number 35. And if you could just retain that, I'm gonna ask that you be handed NMS final report 2307889, as well as a portion of the litigation pack from that same report 2307889. It's pages 6 through 10 of the litigation packet.
Okay, I let her know that I will probably be late. I don't see them finishing this
Do you recognize those documents, Dr.
easily.
Mitten?
I recognize the NMS report and then pieces of information from the NMS litigation packet. I had not reviewed the CFSRE
Thank you,
report
John.
prior.
Which that's already an introduced exhibit. Is that the NMS report that corresponds to that work order number?
Yes, they both reference the work order 230788899.
And is that work order, it is Dr. Kotelewski's report, exhibit 35. Do you recognize the work order on Dr. Kotelewski's report?
Yes.
And his case number is 2023-0090, is that correct?
Yes, that's the CFSRE assigned unique number.
And Your Honor, at this time, I am gonna ask that the NMS report be made an exhibit, but I would ask the witness to be able to retain it for a moment.
Okay, go ahead.
And may I publish that
Coco?
exhibit,
No.
which is now in 40, along with previously introduced exhibit number 35. And again, Dr. Minton, do we have the NMS work order number on both of these reports?
Yes.
Thank you so much, Coco.
And I am going to ask that Dr. Minton be handed pages 320 and 321 from exhibit 11. Dr. Minton, do you have the analysis requisition form as part of that paperwork
Yes.
with the barcode?
Yes.
Perfect. Can you read out the barcode for that analysis requisition form?
So beneath the barcode, the number is 23-057-00 I believe it's 143A.
And the medical record that you were handed, the 2 pages, do you see that exact same specimen ID in those medical record pages 320 and 321?
The nice doctor.
I do see it on the bottom of page 321. I'm looking on page 320.
Cop.
I think it's just on 321, those 2 pages just go together.
Okay, I see it, yes. It is clearly noted on the bottom of page 321.
And does that have that specific specimen ID?
Yes, it does.
And do your NMS records reference the date of collection for that specimen?
They do not.
Can you, so you validated the specimen ID, correct?
The
Barcode.
Yes. Oh, I mean, there is a collection noted on page 321. However, NMS was not provided that, so it's not on the NMS report.
But you have that specific barcoded specimen ID, correct?
Yes.
And that specific number is also listed on page 321 of the medical record, is that correct?
Yes.
And that collection date is February 26th of 2023 at 13:35.
Yes.
Is that correct?
Yes.
And that is page 321 of exhibit 11. And just, can you verify that at the top of that medical record, it also has Jade Benning's name as well as her date of birth of March 6, 1998?
Yes.
And Your Honor, at this time, I would ask that that litigation paperwork be entered as the next.
I'm
referred
sorry,
exhibit.
who's getting
Exhibit
sued?
pages 6 through 10.
When did this happen? Can someone bring me up to date on that?
Her report, she was gonna hold on to it. It was gonna be
Hold on one
40, and
second.
then you want the package?
To be 41.
Okay. Right, yeah, give those to the clerk.
Was there like a civil suit?
Your Honor, may I ask that the witness be handed exhibit number 32?
We're looking at litigation paperwork. And I mean, my attention may not be perfect 100% of the time, but I think I would have remembered
Okay.
this.
Thank you so much, cameraman. Okay, so if you are just now joining us, the most important thing you need to know right now is that we will be back tomorrow. So, huh? I'm here hustling.
Okay, so we don't need that.
Damn straight, you don't need them, Judge.
Do you have exhibit 32, Dr. Nathan?
Yes, I do.
And can you turn, I apologize, I don't have the page number with me, but there is an NMS report that is incorporated within Dr. Kearney's autopsy. Do you see that?
I do.
And I have pages 15 through 27 of the litigation packet, as well as a copy of NMS report 23126889, report issued March 19th of 2026. I'm gonna ask that the witness be handed these two items.
I was going to catch up on so much stupid stuff tomorrow. Paperwork, emails. Hopefully we start with like an exciting witness.
Okay.
Dr. Vinton, do you recognize the litigation packet as well as the report that is dated March of 2026?
Yes, I do.
And did you complete that March of 2026 report?
Yes, I did.
Are you familiar with the report that is in the autopsy of Dr. Aaron Kearney?
Yes, the original report from May of 2023, yes.
And who did the original report?
So the original report was reviewed by, at the time, Megan Ringel, now Hessler.
And can you describe what, if anything, did you do regarding the samples that Megan Hessler previously analyzed?
So I performed a re-review of the
I
case,
agree.
but I performed it from fresh. I looked at all of the data on my own fresh, didn't rely on her report to generate my report. And so based on my review of the findings and then all of the data generated, I created the secondary report. It's labeled corrected because it is different and separate from the original that was issued. As part of our process, we have to notate if there's any difference or if there's a second report ever issued. And so the NMS system of doing that is to label this as a corrected report because the signature changed. My signature now replaces hers.
And did you do your own independent analysis?
Yes.
And did you come to your own independent expert opinion?
I did, yes.
And did you reflect that in that corrected report?
Yes.
Your Honor, at this time, I would ask that Dr. Mithen's report be entered as an exhibit. I would ask that she be able to retain it during testimony, but may I publish it to the jury?
Okay.
Will be
We would just raise a same objection.
Okay. Or it'll be 42.
42, and then if I can have the litigation packet, it would be 43 with correspondence.
All right, where's the
Well,
litigation?
KMS Labs.
Or give that to that
aren't they the ones that are in Pennsylvania?
Yes.
Let's look. If you're talking about this lady having a posh
And Dr.
accent,
Mithun, do you recognize the document that is on the screen next to you?
Yes.
Which this is just the first page of your report. Your report is actually multiple pages, is that correct?
Correct.
But does this summarize your findings?
Yes, the front page is a good summary of the findings.
And can you state for the record the work order?
The work order here is 23126889.
And is that the same work order that is on the original report of Ms. Hessler that's part of Dr. Carney's autopsy in Exhibit 32?
Yes, it is.
And specifically, can you describe what was the item in 001 that you analyzed?
So 001 is a hospital tube. The collection date and time noted were February 25th, 2023 at 22:31.
And who sent that in to NMS Labs?
This was submitted through the Forensic Medical Management Services, or FMMS.
And can you describe what is the collection date and time that is listed on the report?
So the date and time provided was, again, February 25th, 2023 at 22:31.
And this is kind of a zoom in. It still has your work order as the collection date and time. Can you describe your findings for hospital blood 001?
Yes, the sample confirmed positive for the presence of cocaine and metabolites, including benzoyl-ecgonine and ecgonine methyl ester.
And are your results consistent with forensic scientist Megan Hessler? Or toxicologist, I apologize.
Yes, they are.
And are you familiar that Dr. Carney, who does something completely different than you do as a toxicologist, that when she is trying to estimate the number of the parent cocaine, when she has ecgonine methyl ester, that she adds those two numbers together?
I became aware of it while preparing for today. It was mentioned to me, yes.
And is that something that you as a toxicologist, you do not estimate these?
We do not.
You are finite, very specific numbers.
We like our facts and figures, yes.
But are you familiar with forensic pathologists that they interpret toxicology results as part of their profession?
They use it to add to the context of the case information that they have in order to perform their job, which is determining the cause of death.
And so what you're doing and what she's doing are two separate things. Is that correct?
That's very fair, yes.
Thanks.
And can you just read into the record what the results were for the three substances related to the 001 hospital blood from February 25th, 2023 at 22:31?
So the results were benzoyl-ecgonine at 1,800 nanograms per milliliter, cocaine at 78 nanograms per milliliter, and ecgonine methyl ester at 7,800 nanograms per milliliter.
It's a mouthful.
And the test that you ran, did it also test for cocoethylene?
Itsy. Are you?
I believe so. 1 second. Yes, cocoethylene is within the scope of that test, yes.
And did it also test for several other narcotic substances?
A separate test was asked and requested to be performed for designer opioids.
And were any found?
No, none above any detection limits or reporting limits.
Are these the only substances that were found in the blood that was tested from that first hospital blood?
The only findings within the scope of what we were asked to test.
And one of those was cocaine, correct?
Yes.
And then also designer opioids, is that correct?
Yes.
And specifically, did you also test the item 003 of the liver tissue?
Yes, the there was a homogenated liver tissue that was tested.
And that was also submitted by Dr. Carney with Forensic Medical Services, is that correct?
Correct.
And can you describe what was the positive result for that?
So this is based on just a screen test. The other results where a numeric value is reported is actually the result of multiple tests, both a screen and a confirmation. So in this case, there's only a presumptive positive finding because only the screen test was performed, that initial test. And it was positive for fluconazole.
And are you aware if there were any other substances that were under the level?
There were indications of things under the level. There was some additional testing performed on the liver to try and confirm those results, and all findings were below any detection limits.
And so if Dr. Carney said she called and spoke with someone and said there was cocaine that was detected, but it was not at the reportable limit, would that be consistent?
I saw the same notes and reviewed the same data, yes. So there were additional cocaine tests performed on the liver tissue.
Thank you, Dr. Smithson. I believe I asked that she be able to retain the last two exhibits, but if those could go to the clerk, I believe it's 42 and 43.
Okay.
It's a damn shame, kids. It's a damn shame.
I am going to ask that the witness be handed NMS work order 23086-183.
My 15-year-old dog is going deaf. And so his natural response is to bark at literally everything. When he's excited, when he's sad, when he's mad.
Do you recognize the report that was just handed to
When he sees a reflection.
Yes, this is the original final report for work order 23086-183.
And is that report dated March 17th of 2023?
Yes, it is.
And I am going to ask that the witness be handed a second item, which is also labeled work order 23086-183, but with a report issue date of March 19th, 2026.
But have you had Diet Coke? Because I know they don't sell it.
Do you recognize all of those items?
Yes.
And can you describe what is the report that has an issue date of March 19th, 2026?
So this is the corrected report that I personally issued for the same work order when asked to perform a re-review in preparation for today.
And did you analyze the samples independently?
Yes.
And did you form your own expert opinion about the results?
Yes, I did.
And did you document those results in the report issued on March 19th, 2026 at 1500?
Yes.
And if I can ask that the witness be handed another item, it is pages 17 and 18, and then I believe 41 through 43 of the litigation paperwork. Do you recognize those pages?
Yes.
And can you describe what those pages are?
So this includes the submission form and then documents noting the inventory of the items received for work order 23086-183.
And can you describe what was the item that is labeled in your report as 001 antemortem blood?
Oh, well,
It's
that
a
means
gray
you're not.
fiberglass tube.
And does it have a date and time associated with it?
The collection date and time provided to us was February 27th, 2023 at 2:17.
I can already guarantee that you are remarkably more
And
healthy
that
than
is
me.
one of the items that you reanalyzed and have findings on, is that correct?
I re-reviewed, yes, the data and the information generated.
Your Honor, may I publish to the jury the first page of Dr. Mithen's report dated March 19th of 2026?
Okay.
Dr. Mithen, do you recognize the image on the screen?
Yes.
And is that the summary of your findings related to the antemortem blood collected by NMPD and submitted to you by NMPD on February 27th, 2023 at 2:17 p.m.?
Yes.
And I am going to zoom in to just the results related to that antemortem blood. Was there another item that was submitted under the same work order?
Yes.
So just focusing on the antemortem blood, can you describe what testing you performed and what your results were?
So in this instance, the request made by the Metro Nashville Police Department Crime Lab was to perform a more expansive blood test. So this includes looking for common drugs of abuse and misuse. It includes looking for common therapeutic prescription drugs, over-the-counter drugs, things of that nature. And I'm sorry, what was the second part of your question?
So could you explain your findings of, I guess, what you were testing for, but then also what you found based on that testing?
So this was a more expansive blood test that was performed. It did include looking for things like ethanol and various volatiles. And so the results concluded from the blood sample, they were positive for acetone, positive for lorazepam, which is a benzodiazepine, positive for cocaine and one of its metabolites, positive for a drug called levetiracetam, and then positive for fentanyl and its metabolite norepinephrine.
No, I meant you are.
And can you describe
Diet Coke is bad.
the cocaine and the BZE? Are those consistent results with the prior testing that was done on Ms. Benning's blood? From the autopsy report that had an earlier, thank you. That had an earlier collection time.
Someone
Is
get that girl
consistent
water.
Based off of the collection time of this blood sample?
I mean, yes, they're both present. So we're still seeing indications of the active cocaine. And then we're also seeing indications of that metabolite, yes.
And is it, I guess, can you describe, like, does cocaine, is it going to dissipate over time, not all at once?
As the body is metabolizing it, yes, your body metabolizes a portion of it at a time. So we typically indicate that as a half-life. So the amount of time that it takes for approximately half of the drug to leave the body is one half-life. And it can take anywhere from 6 to 8 half-lives for a drug to fully eliminate from the body. But there can be some very big variations there depending on the drug involved. Some drugs have a longer half-life, some have a shorter half-life. In the case of cocaine, it gets complicated because cocaine itself is a very unstable drug. It can actually break down even when it's in a glass tube. So we have to keep that in mind. That's why it's hard to really compare apples to apples there. The cocaine, it's possible it broke down when it was in the first tube. It's possible that some of it broke down in this tube as well.
And have you seen results of cocaine in blood samples of this level before?
Because we do a lot of postmortem autopsy testing for all 50 states in the country. Yes, I have actually.
And this particular result, I guess I'll wait till we get to your final test to kind of connect the two things.
I meant to say
Can you
day,
describe
not
the acetone that a positive result.
Nail
What is that indicative of?
The presence of acetone in blood or urine can indicate a couple different factors. The key part being that there's some sort of ketoacidosis going on. And so that is the formation of these ketone bodies like acetone and isopropyl alcohol in the body. But what is indicating, it could be from a variety of different reasons. It could be diabetic or alcoholic ketoacidosis. You can see it happen in trauma. You can see it happen in like a flight or fight response. You can see it happen during times of starvation when the normal way that the body digests food and metabolizes food isn't working, and the body actually starts to work on using its fat reserves as a food source. So it could be in there for a variety of reasons.
And is it consistent with Ms. Benning arriving at the hospital dead, having to be intubated and then placed on a respirator to help her breathe?
Your Honor, I'm going to object to this witness answering that one.
Of course.
And she answered when she was being qualified that she was.
Okay, do you want to rephrase that to see if she has an opinion about where that comes from?
Dr. Mitten, is it major surgery or extreme stress that you would receive in a hospital if you're on a ventilator? Is that something that?
But she could have opened up a bag of the stuff she was selling and accidentally exposed herself.
Would that be that ketone that you were describing?
There's that what if in my head.
I'll rule the objection. Go ahead.
It is also possible, yes.
And can you describe lorazepam? Is that something that you
Heavenly.
see when someone is in the hospital undergoing medical treatment?
It can be administered. It is a prescription benzodiazepine. It's typically prescribed for conditions like insomnia or possibly to assist with reducing and limiting seizures.
And you've already talked about the
the phone
BCE and the
record.
cocaine, the next substance. Can you describe what is that positive?
The phone person.
So it's positive for levetiracetam at a result of 24 micrograms per milliliter. Levetiracetam is commonly known as Keppra, which I think people may be more familiar with and is definitely easier to pronounce. So that is also an anti-seizure drug that is commonly provided or administered during medical treatment.
And the next two positive results are for fentanyl and norfentanyl. Are those also common medications when someone is in the hospital and on a ventilator?
They can be. They can be commonly administered depending on the nature of the trauma or event that's happening with the individual. Fentanyl can also be used as an anesthetic during surgery.
And if the medical records indicate that Ms. Benning was given fentanyl sometime on February 26, 2023, then this test on February 27th.
Cut your goods from your dealer, lick your fingers. Yep.
It would be very possible to still detect it, yes, depending on the dose provided.
Well, she was continuing to get fentanyl from February 26, 2023, I believe, up until the point that she was removed from the ventilator on March 6th.
They gave me that in the
So
ER.
if it's continuously being added, then yes, it's certainly possible to be able to detect it.
Yeah, the whole drink thing.
And going back to, this is the exact same report that you have been testifying to. There is a second item, which is the 002 urine. Can you describe what testing did you perform on that?
So similar idea. The request made was to do an expansive test on the urine sample as well. The scopes may be slightly different for the drugs that are being tested for between the urine and the blood. That's just due to the nature of those two samples. Urine tends to see more metabolites because the body has processed it. It's on its way out of the body. And so the scopes are slightly different between the two.
And can you refer to the analysis requisition that is part of the litigation paperwork. As it relates
why do we
to
think it was in her
that
food?
item 002 urine, can you describe the information listed for the collected date, time?
We were not provided any specific information for a time, but a date of February 27, 2023 was provided.
And can you indicate which officer requested that testing be done?
This was requested by Adam Reese with the Metro Nashville Police Department.
This brought
And
me
can
crazy.
you review the subsequent pages of the litigation paperwork and can you verify where that sample came from and where it was returned to?
So it was received via FedEx courier from Metro Nashville Police Department Crime Lab in Madison, Tennessee. And then as far as return, it was returned to the Evidence Return Department at the MNPD Crime Laboratory in Madison, Tennessee.
And are you familiar with Amanda Sweet?
Previously, and then from professional organizations, she and I have worked previous cases as well.
And she works for the Metro Nashville Police Department's crime lab, is that correct?
Yes.
And if that specific piece of evidence that there's been chain of custody on indicates that it was collected at 1603, you would refer to the actual piece of evidence for the time since it wasn't provided on your paperwork, correct?
Correct. We'd have to refer to the physical evidence if there was a sticker on it or some alternate paperwork provided.
But it definitely was February 27th of 2023.
Yes, that's what was provided.
And can you describe what testing was done on the urine and then also the results that you received?
So an expansive urine panel was performed. And as you can see, there's a lot of findings. So we'll go through kind of one by one. For ANPP and naloxone were both reported presumptive positive based on a screen test only. The remaining findings all had both a screen test and then additional definitive confirmation tests performed. And so that includes acetaminophen, commonly known as Tylenol. We have several different benzodiazepines, including nordiazepine, nordiazepam, oxazepam, temazepam, lorazepam, and 1-hydroxymidazolam. Those are all in that class called benzodiazepines. There was also a finding of cocaine and its metabolite benzoylecgonine. There was a finding of levetiracetam, and then fentanyl and its metabolite norfentanyl.
And I guess, can you explain why do we have additional substances in the urine that did not show up in the blood? Is it just a different type of testing?
In this case, it also is possible that these were drugs administered a longer time ago and the body is still working to flush them out. Urine keeps retained in your bladder for some time until you void it. So it's just possible that those drugs were administered longer ago. And in the instance of some of the benzodiazepines, it's very likely that some of these are metabolites based off of a different drug that was provided.
And this is during the time that Ms. Benning is admitted to the hospital. Again, she was in the emergency department, but then she's placed on a ventilator.
No,
Given more drugs when
I
she's
know
first
that
being worked
Scott
on,
warned
and
me
then
100
changed
times of that.
protocol. Would that be consistent with these results?
It's definitely possible, yes.
Which I kind of find insulting as someone who's chronically ill, like, and I have serious medical issues. Like, why do you want me to hold back what's going on in my life?
And
That's
I guess
real.
kind of comparatively, the urine result of the 4,000 nanograms per milliliter of cocaine compared to the result in the blood, can you kind of give some context to that? Does
my
it
God.
make sense to compare a blood result to a urine result, or are they
Okay.
different types of matrices?
Now let me read that.
They're different types. If you think about the idea that urine can be stored in the bladder, you can have an individual who's dehydrated or who's drank a lot of water and kind of gotten overhydrated. That can really change the concentration in urine. So I would say we look at urine more qualitatively typically and look to see if there's a lot of a substance in there or a little of a substance in there. But we don't necessarily rely on the hard values just because there can be a lot of variability there, depending on how often someone's going to the bathroom and voiding their bladder. It can really change those concentrations.
And somebody that's on a ventilator, that's going to affect that as well.
Yes.
And Your Honor, at this time, I would ask that her report, the original report, and the litigation packet be made a collective exhibit 44. That's the one that I handed to y'all.
31926.
Sorry.
We have so many more witnesses.
230-86183. It has one litigation pack with 2 different samples.
I think we're going to hear quite a bit more.
And Dr. Mithun, I have a set of 11 photographs, as well as an NMS report, work order number 23129-285. I'm going to ask that you be handed both of these items. Thank you.
Man, it was such a ugly day here today. And it's honestly usually been at night when it's rained, so it's been nice during the day. If they call all 10 of their witnesses.
Dr. Mithun, do you recognize that report?
Yes, I do.
And can you describe what is that a report of?
This is a manually created report that I authored with regards to a request that came for testing of both a washcloth and a comforter that were received with biological stains on them.
And who submitted those and made that request?
This was submitted at the request of Metro Nashville Police Department in care of Officer Adam Reese.
Oh, wow. And do you recognize the 2 samples that you received? Are they reflected in those photographs?
Yes.
And did you examine, at least visually examine, both of those items during your analysis?
Yes, I physically performed actually I took most of these pictures myself too, but I physically performed the visual inspection and the inspection of the items.
And did you do the original sample collection and analysis of these 2 items?
I did. I did the original sample selection, so where we were going to be testing which parts of the fabric we were going to physically cut out and test, because we obviously can't test a full large bedside comforter. And then I prepared the samples and got them to a point where they were then able to be entered into the laboratory in the normal flow of samples.
And the first item that you've just been describing, can you just state for the record, what was that item?
The item that we physically tested was item number 2, which was a large blue comforter.
And I guess I call it the second item, but it's labeled as 00. Well, I'm sorry, the one that is labeled
Oh, I'm sorry.
231-292-85001.
Sorry, you are correct. I have them flipped. 001 is the large blue comforter, and then there was an item 002, which was a normal sized, kind of golden yellow washcloth.
Okay.
Sorry, I misspoke.
It is late in the day. Your Honor, may I publish Dr. Mithen's June 30th, 2023 report, work order number 2312928?
Okay.
And Dr. Mithen, this first page of your report, does it reflect those two items that you had just testified to?
Yes.
And are those two items located on this portion of your report?
Yes.
And does it actually have the Metro Nashville Police Department case ID number associated with your work order?
Yes, it does.
And that is kind of midway through the page.
Yes.
And you said that you did recognize those 11 photographs, is that correct?
Yes.
And Your Honor, at this time, I'm gonna ask that those 11 photographs be introduced as the next number of exhibit, which I believe is 45. And I can't remember the 11th number of the alphabet, but I'm sure Madam Clerk will assist me with that.
Do you need these back?
No, Your Honor.
Okay.
May I have permission to publish those?
Sure.
Thank you. Dr. Mithen, this is exhibit 45A. Can you describe what's shown here?
So this is how the items were received. They were received inside of a large red biohazard bag. And then inside that biohazard red plastic bag was in this case, it was actually a brown paper lawn bag, because it was the largest bag that could fit the item. And then once we opened the seals and went in even further, we were able to see what the actual items were. But this is what it looked like when we received it.
And that has the Metro Nashville Police Department complaint number 23-0120532, as well as the address of 1522 Lebanon Pike, number 107. It has a February 27th, 23-0219 date, and it's also labeled as blue comforter. Is that correct?
Yes.
And the next image is 45B. Can you describe this exhibit?
This is just the backside of the first image that you had, so you can see the seals, and
This
how
is that comforter that they make
the item was
such a big
received
deal
completely
about
taped
having
over and
trouble
sealed.
putting away.
And the next image, which is a zoom in of the label from 45B.
I can't wear this
Can you describe
anymore.
what's
Sorry. Of course it did that.
shown here in 45C?
So this is a sticker applied to the outside of that lawn bag that was provided with Metro Nashville PD's information on it. So this appears to be their way of labeling their evidence.
And the next image is exhibit 45D. Can you describe what's shown here?
So this was the biological stain located roughly near the center of the comforter. It's a little hard to see on the picture, but there is a discoloration. It's a darker blue color, roughly the size of a dinner plate. And then there is some pink solid material kind of towards the center of the stain.
Dr. Mithen, if you touch the monitor in front of you, you should be able to draw on the screen to show what you're referring to.
So that's approximately, it fits within that.
And can you describe, I guess, your visual examination of this blue comforter? What is the substance within that circle that you have circled?
It was labeled vomit as we received it. So we believed it to be some sort of gastric contents, vomitus. It's unclear, and we don't necessarily know when we receive items what they are, but it was labeled and told to us that it was some sort of a biologic.
Biologic
And
sounds so scary.
the next image, which is 45E, can you describe what's shown here?
Same picture of the stained area, but with a ruler added just to help with sizing reference.
And the next image, which is 45F, can you describe what's shown here?
So the first image was trying to get kind of the width of the stain. This is trying to provide the rough height of the stain, but same thing, trying to provide a scale for how large the stain size was.
And the next image, which is 45G, can you describe what's shown here?
So this is if you flip the comforter over. Some of the stain was actually visible all the way through the comforter onto the back side. So it was a smaller surface there. And so the ruler is provided to help with scale.
And can you describe the process that you went through to analyze this particular item that was submitted to you?
So these are a more unique type of testing that NMS can perform. It's called a forensic investigation. And so in order to perform the test, we have to identify where a stained area is. We also try to look for areas outside of that stained area that we can use as control samples, just to try and ensure the accuracy of the result. If there's some sort of response that we're receiving from the fabric, it should also be in those control samples. So it helps us kind of determine what is background versus what is this additional biologic material bringing to the case at hand. In addition to that, we also prepare some external samples that are external to this blanket. So we'll find some fabric that is unrelated to the case and use that and test that in parallel as well. So as part of analysis here, it's identifying the region where the stain is, and then identifying a relative size and area that we can actually cut out and excise from the stained area. That becomes our case sample for testing. And then areas external to that, so in this case, I chose areas towards the outer portion of the comforter that did not appear to have stains, that I could also cut and use as my control samples.
And did you cut that portion of the comforter?
We physically chose to cut the portion that we saw that was stained all the way through, just because we thought that represented kind of the most saturated portion, and had our best chance of trying to extract whatever that biological fluid was. So yes, that square directly was what we tested.
And what type of testing was performed on, I guess, the sample that you collected?
Once prepared and we were able to, using methanol, we were able to extract off what was in the fluids off of the comforter and the fabric and the batting. The test procedure that we used is just a general basic drug test. So it ran under what's called an immunoassay. Immunoassays are looking for general drug classes. So it'll look for things like cocaine. There's a test that can be performed for the drug class of cannabinoids or marijuana. Another test can be performed for opiates. So it's looking for very general common drugs of abuse and misuse. Specifically in this case, Metro Nashville police let us know that they were interested in having us test for fentanyl and cocaine. So in those instances, I only prepared controls and control samples with known quantities of cocaine and fentanyl in those controls. I didn't prepare with any additional drugs that could have been within a scope.
And can you describe, when you're testing, did you receive any results?
Yes.
And what were those results?
So because we don't know how efficient our ability to extract those biological fluids out of the blanket maybe, we don't quantify. It's really a positive or a not present. And so in this case, we were able to detect the presence of cocaine and benzoylecgonine in the stained portion of or from that stained portion. We did not detect fentanyl or norfentanyl.
So there was no fentanyl whatsoever, but you did have cocaine and the BZE.
Not in that stained portion.
And can you describe that testing process when you run kind of a first screen? Is it possible that the concentration of the sample that you're running is too high for the, I guess, testing equipment that you're using? Can you describe that testing equipment a little bit?
One issue and limitation of immunoassays, just because they work like a lock and a key with antibodies. So the antibody is your lock. If a drug is present, it's the key, and it goes and binds in. And then it's called a sandwich assay because we have a detection molecule that then comes back on the other side. And so they sandwich the drug in between. And one limitation of performing a style of test like that is that if you have too much drug present, it can cause something called a hook effect and lead to a false negative sometimes. And that means that you have so much drug, it's binding to the antigen on this side and the detection molecule on that side, and they aren't able to fully form that sandwich. And so it can actually interfere with your ability to properly detect.
And what was the, I guess, concentration level of the cocaine in this sample? Did you have to run it multiple times?
We did have to repeat the test. The initial attempt with the cocaine exceeded the ability on our confirmation testing. It exceeded our analytical range. So when we create these tests in the laboratory, we set them up so that we can run them repeatedly, and they fit the vast majority of our case samples. So concentrations usually fall within a specific analytical range that we're looking at. In this case, the case response exceeded that original analytical range. So we had to go back and repeat it on dilution to ensure that we were getting an accurate result, that there were no interferences, that things were running properly, and we had an accurate response coming through on all of our indicators and acceptability for the criteria.
And what is a typical BZE amount?
The analytical range normally for that method runs from 50 to 5,000.
And I guess, what was the concentration of the first test before you diluted it?
I'm trying to recall it, and it far exceeded the 5,000. We ended up repeating the test at both a 10-fold dilution and a 100-fold dilution because we weren't sure whether a 10-fold dilution would properly get it into that analytical range.
So you diluted it 100-fold to be able to test it properly.
We ran it both 10-fold and 100-fold. On the same run, we ran them together.
And was the amount at 10-fold, was that too high to report? Is that why it was diluted again?
I don't recall off the top of my head if the 10-fold result was acceptable, or if the acceptable result came from the 100-fold run. I'm sorry, I don't recall the exact.
My notes based off of our many conversations about this particular test is that you diluted the sample 100-fold to get it down to a level that your machine could test.
We ran it on the same batch. We were able to run both dilutions, and so that's where I'm fuzzy on if we accepted the 10-fold result.
You can find that out by tomorrow.
Yes,
Okay.
it's in.
Go ahead.
It's in my notes.
Their notes are here.
In the back of the room, yes.
How long
You
was
got her notes?
Sure. Where are they?
I believe the binder.
Perfect.
And Ron, maybe ask that we be allowed to look at those notes as well.
Are your notes included in the litigation packet?
No, these were just my notes for trying to remember all of the runs today and trying to keep all the work orders straight. Yes, in preparation for today.
Okay. Find them and we'll make a copy.
Oh, actually, I think they might actually be in there. I'm sorry. Okay, so in this case, we were able to accept the 10-fold dilution. The 100-fold dilution provided a consistent result with the 10-fold dilution. So the two results were very consistent with one another. Since they were consistent and the lower dilution was acceptable, we accepted that result.
Okay, but you did both of them, correct?
Yes.
And you said that the results were consistent.
Okay. 1 second. I'm gonna misstate that. I misstated that. Both results, I was looking at the high control sample. Both results were accepted from the 100-fold dilution. And those were the ones that were reported, both the cocaine and the BZE were accepted from the 100-fold dilution.
Not the 10-fold.
Not the 10-fold. I'm sorry, I misstated that. I was looking at one of the control samples. I apologize.
The 100-fold dilution, so if the amount that you typically would test would be 50 to 5,000 nanograms, we are now looking at up to 500,000 nanograms per milliliter.
Yes, so 5,000 to, yes, 500,000. Yes.
And what was the result?
So we reported as positive, because we don't have a true quantitation running there. We reported as positive. We don't report that quantity.
What was the number that you obtained to be able to report it positive?
In the data, the reported result or the quantitative result was over 87,000. Yes, over 87,000.
And 87,000, that is nanograms per milliliter.
Sorry, yes.
I'm going to object to her attaching a number, a quantitative number, because she has stated she could not do it.
Okay, well, you can cross-examine about that. Do you want to ask any other questions about that?
I have other questions for her about this, Ms. Schroeder.
The data is in the litigation packet.
Yes, it was provided to our office as well as defense counsel. They have all of that underlying data. Dr. Mithen, can you explain why the report is just reported out positive?
So we don't know the efficiency of being able to extract those fluids off. And so we were repeating on dilution to ensure that the sample fell within a proper quantitative range and that the ratios were acceptable, and our acceptability criteria is met, but we do not report quantitative values in these instances because it would be hard to assign a number and a value to what's going on there. It's more a qualitative presence of was it present or not present. So that's why I do caveat
I know that I had
that is the
that sort of
response of the
poisoning,
instrument,
and it was
whether
black.
that is a true, fair, and accurate concentration. I
didn't
would
go to the hospital.
hesitate to say that. It was a large value that needed to be run on dilution in order to get an acceptable result.
And again, that is because as a toxicologist, everything that you are doing, it is precision, it's very precise, as well as there are certain reporting limits and kind of rules about what actual amount and level you're gonna report out versus just a positive, is that right?
There are requirements about what needs to be run, and I'm looking at, there was a note that there may have been some questions on the original calibrator curve for that run. So anything that was attempting to be reported with a qualitative value was going to be repeated to ensure the accuracy of anything that went out with a number attached. We know that the quality controls that we run several quality controls that are just positive at a high concentration, positive at a low concentration, qualitatively, in addition to those numeric controls. Those were all acceptable. So we can accept things as qualitatively positive, qualitatively not detected. But we were not able to report things with a numeric value on that run just due to questions they had with that calibration curve. So that is my hesitation in assigning a numeric value. I would say it's a response. It is a strong response.
And that amount of 87,000 nanograms per milliliter with all of the kind of conditions that you have put with it, is that consistent with Dr. Carney's prior testimony that adding the EME to the parent cocaine in that first hospital blood being 7,878 is the value that you obtained? Is it consistent?
Objection, this witness has already testified that that was outside of her wheelhouse to be able to make those kind of opinions.
Okay, from your perspective as a forensic toxicologist, can you answer that question?
I mean, they're different specimens, so I would hesitate to do that. This is.
You hesitate to do that.
Dr. Smith, then, this was determined to be a spit up vomit, correct?
Correct.
And the analysis included that first hospital blood that you also analyzed, correct?
Correct.
And is your assessment that the substance of cocaine was ingested orally by Ms. Benning?
Objection, outside the scope of her expertise.
Okay, she's smart enough to, can you answer that question?
I think I
From
can.
your training?
This is indicating that there was some sort of oral consumption, yes.
I have a ruling, Your Honor, on that.
I just did. She answered. I allowed it to answer, so I ruled to accept.
And if that substance on the comforter that you tested that came back 87,000 nanograms per milliliter, which I know that is just the
Okay, what
number.
is your question?
Is it consistent with the result in the first hospital blood?
Objection, same objection.
Oh my God, are we just,
Consistent in
is
terms
that what
of
we're doing now?
kind of quantitative or that it's positive?
That it's, are those two values consistent?
Objection.
Do you have an opinion on that from your training?
I mean, they're separate. They're distinct matrices, so it's not comparing a blood to a blood. They're two separate
What's your
matrices.
next question?
Is it a high value?
If we're just looking at the numbers, it is higher than the blood number, but again, they're different matrices. They're not the same.
And now I have page 2 of your report on the screen. Can you describe the additional testing that you did to kind of verify the validity of this testing?
So as I said, we prepared a number of control samples. So in addition to the case sample, the unknown, we prepare a positive control that's at a low concentration of known concentrations. So I physically will go to the laboratory and I took spike solutions of both fentanyl and cocaine and added that to blank pieces of fabric, let them soak in, and then treated them as if they were stained pieces of fabric and ran them through the process. So I have a low control. I also did that with higher concentrations of those drugs. So I have a low control and a high control. We do another sample that is a negative control. It doesn't get any drugs added to it. That's really to test and determine kind of any background noise that may be coming from the fabric and the
90
comforter.
minutes.
And then I also do that external negative control. So that's really a control to ensure that the laboratory hasn't introduced contamination into the sample during its run through the laboratory. that this process works. We can detect our internal standards and the extraction process is working well. And so in all, 5 pieces of fabric were prepared in order to test just this one case sample.
And all of those 5 testings were done to validate the results of the testing of the case sample, which is 2312928.5-007. Is that correct?
4 controls and the 1 case sample, so 5 total.
And so on your report, it is that case sample with the positive for cocaine and the BCE.
Correct.
And all of the other results that are listed, that is referencing to those other samples.
Yes, there is a result for one of the negative control samples, and then other findings, none were indicated.
Can you explain what is the case blank in 004?
The case blank is that negative control from the comforter itself. So it was not spiked with any intentional fentanyl or cocaine solutions. It was from the outer periphery of the comforter in an area that we believe to be void of any stains.
And can you describe what area of the comforter did you take that sample from?
If I'm looking at the comforter, it was the lower left corner.
And did you pick a spot that was as far away from the actual case sample as you could?
That was our attempt, yes.
And can you describe the testing and the result that came from that case blank in 004?
During the course of testing, the result that came back, there was a slight positive indication for fentanyl and fentanyl only on a piece of that negative control piece of fabric. There were no indications of norfentanyl, no indications of any other drugs. And it was just above our instrument's reporting limits. So it was a very low concentration, very low amount.
And can you describe, what does that mean that there was no norfentanyl in that trace amount?
So it can be contamination. It can be contamination from the environment, from someone handling it. It's hard to know how that got there. It did not appear in any of our other control samples.
That doesn't make me feel comfortable.
So it does not appear to be something that was caused during the testing in the laboratory, but how that result got there, I can't explain it other than to state it was likely some sort of external contamination from an environment somewhere.
But there was nothing about that sample that indicated in any way that it had been consumed and processed by a human body. Is that correct?
Nothing visible to our eyes.
And it didn't have any of the breakdowns of fentanyl that you would see if it had been ingested. Is that correct?
Correct. And it's also true. So when I was spiking with the known compounds, I was spiking with a mixture of multiple fentanyl compounds. So fentanyl, norfentanyl, acetylfentanyl, because I used a common spiking solution that we had in the laboratory so that I knew the exact concentrations I was adding. And I didn't see any of those either when in looking at the data. Those were not present. So it wasn't from, say, me misspiking the sample or some sort of issue in that way.
And can you describe kind of the value? Was it a small amount?
It was just above the detection limit for that assay, which was 0.5 nanograms per milliliter.
0.5 nanograms.
Correct.
And it was just above.
The response was just above that, yes.
And did you try to duplicate that result?
I gotta splash some water on my
How
face.
so?
Like, I mean, did you do any testing to try to, I guess, put fentanyl on a piece of fabric to that same result?
Yes, I mean, that's the control samples we run. So there was a low control sample. I'm trying to remember, I believe I attempted to spike at 2 or 3 nanograms per milliliter of fentanyl in that low control. It might have been higher, but I'm 2 and 3 nanograms per milliliter are ringing a bell in my head. And then the high control was a significantly higher concentration. It was, I believe, 20 nanograms per milliliter.
And so are you saying that you weren't able to reproduce it?
And those controls came back positive for the drugs that they were supposed to come back positive for. And it was also appropriately resulting with norfentanyl and acetylfentanyl and the other drugs that I spiked in that instance. So those responses were agreeable there, and what was expected.
And can you describe, you testified that it was a trace amount that you feel like came from environmental kind of contact.
It's some sort of contamination externally.
I'm object to the testifying in the leading nature of the question. I don't remember the witness testifying.
You want to ask her again what she's already testified about?
Yes, can you just clarify what you mean by external in the environment?
So it's somehow it was placed onto the fabric, and I'm unclear how that happened. There are a lot of ways it can happen, just from the movement of that object between different individuals and different environments. Where that happened, I couldn't say. It happened before it reached the laboratory.
Thank you, Dr. Minton. You have described that you also analyzed a second item, and I have 45H on the screen. Do you recognize that?
Yes.
And can you describe what it is?
So this was a secondary package also received, also noted under the same work order 23129285.
And the next image is 45I. Can you describe what's shown here?
So it's the backside of that same brown paper bag, and then it contains all of the agency markings when it was submitted.
And it has that same address of 1522 Lebanon Pike, number 107. Is that correct?
Yes.
And the next image, which is 45J, can you describe what's shown here?
So this was the yellow golden washcloth that was received.
And the next item or photograph is 45K. Can you describe what's shown here?
So it's the same washcloth. It's just a movement of the ruler so that we can get the width.
And did you end up doing any testing on this washcloth?
We chose not to.
And why is that?
It was very difficult to see stained areas on this coloring and on this fabric. You can see some, can I draw on it?
Absolutely.
Okay. You can see some pink markings kind of in here, roughly in that range. There's a few spots with that same kind of pink solid material, but it was difficult to tell where any kind of that clear fluid may have been on the washcloth. And so it was very unclear where we could take a case sample versus a control sample, and feel comfortable and confident about it.
And I am now displaying page 3 of your report. Can you describe what information is on page 3?
So you see my signature at the top, because this is the final page of the report. It explains the testing was performed under chain of custody. And then it also provides a summary of what testing was performed and which instruments were used to perform the testing.
And again, your result is on page 2 of your report, and the case sample is 007, correct?
Yes.
That is for the comforter, and it tested positive for cocaine and BC.
Yes.
Is that correct?
Yes.
Thank you, Dr. Minton. Your Honor, at this time, I would
Okay.
ask that Dr. Minton's report that is labeled AMS Lab Work Order number 231-29285 be admitted as the next numbered exhibit, is 46.
We did the 11 foot, let's see, your way.
This is for 45 age group.
Those are my notes. Right, the 11 photos that you said plus the work order.
11 photos
So
were
now you're wanting the work order.
is the next numbered exhibit.
Oh.
46.
Any other questions?
He's been in that courthouse all day long waiting to testify.
I don't have any other questions.
Okay, let the lawyer step up.
They'd be crazy to have the defense. Come on. They would be crazy to let the defense cross-examine her at this hour on a Friday. Because if I'm feeling this way, surely a juror feels this way.
All right, ladies and gentlemen of the jury, we're going to recess for the day. Remember what I said about not discussing the case, forming any opinion about it, looking anything up, watching any reports or anything media-wise. Leave your notes up here. Tomorrow, if you report like you did this morning, downstairs in the jury assembly room, 8:45, 8:50, been pretty good on being on time. So thank you for your service, and we'll see you in the morning. You can step out with the court officer.
All right.
Are you making a photocopy of that or? Okay. Thank you.
So I will create a live stream with that information for tomorrow. You guys can expect to see me at I'm sorry, I just got distracted, at 9:45 tomorrow, bright and early. So I hope you guys have a great evening, and hopefully I'll see you tomorrow. Thank you to everyone who participated in the chat. Remember to like this stream by double tapping the screen and by hitting the thumbs up button on your computer. Double check that you are subscribed. Turn on notifications to all, and may you all have a good night. All right, bye. Finally, bye. Wait, people are typing. Bye, Bubbles. Good night. Bye, Steve. Bye, Scott. Bye, everybody. Okay, I gotta go. I gotta go to this other stream. See ya.
Credit card, where's the cash?